The Senate will come to order. Senator Murphy.
Thank you, Mr. President. I impose the call of the Senate.
The Senate is now under call. Senator Rare. And I'll talk to you. Senator Murphy for a motion.
Thank you, Mr. President. I move that further proceedings under the roll call be dispensed with and that the Sergeant at Arms be instructed to bring in the absent members.
On that motion, all in favor say aye. All those opposed say no. The motion prevails. Members, if you'd be so kind as to stand As a gentle reminder, in our Senate tradition, we always start with prayer. And today's chaplain is Reverend Melissa Shazer from Christ Presbyterian Church in Edina, Minnesota. Following the prayer, members please remain standing for the Pledge of Allegiance.
Please pray with me. God, giver of all hope, all truth, all light, we call upon you this day to bless and to guide this session of the Minnesota Senate. We come before you with gratitude for the gifting and the experience of the elected leaders within this room. We know, oh God, that with you nothing is wasted. Every hard conversation, every setback, every challenge that they did not choose for themselves, Lord, you use those to help build bridges, to creatively find solutions. And so, God, we pray for everything, too, that is happening outside this room. While they are gathered in this session, we pray, God, that each of these leaders may be at peace and fully present here. We lift up, God, each of their families. Watch over them and tenderly care for them. We pray for their communities, that they would see them being shaped by listening and by learning from one another. We pray, too, for our cities and our state, which you love and you created for a purpose. The theme of light transcends our lives, and it is a gift that light, whether bright or dim, is pervasive. It enters into places of darkness and chaos and confusion in order to bring structure and peace, understanding and harmony. And so, God, we pray that your light would fill this session today. May the God of hope fill us with all joy and all peace as we trust in him. We pray this in the name of God's incarnate love. Amen.
The secretary will take the roll.
Abler, Barr, Bolden, Carlson, Champion, Clark, Coleman, Swadzinski, Dames, Dibble, Dornick, Draheim, Drazkowski, Duckworth, Farnsworth, Fateh, Frentz, Green, Grunhagen, Gustafson, Hochschild, Herr, Heinzman, Hemmingson-Jaeger, Hoffman, Holmstrom, Housley, Howe, Jasinski, Johnson, Johnson-Stewart, Klein, Coran, Kroon, Kunish, Kupek, Lang, Latz, Liskey, Limmer, Lucero, Mann, Marty, Matthews, Maye Quade, McEwen, Miller, Mohammed, Murphy, Nelson, Verbaten, Pappas, Pa, Port, Pratt, Putnam, Rarick, Rasmusson, Rest, Seeberger, Utke, Weber, Wiesenberg, Westlin, Westrom, Wiklund, Zhang.
Members, a quorum is present. The following members intend to vote from a remote location under Rule 40.7. Senators Carlson and Senator Pa. Members, if you'd like to follow along with me, I'm reading from today's Senate agenda, which is dated Wednesday, April 29th, 2026. The first order of business will be second order of business, and that's executive and official communications. The following communications were received. Please note, no action is required. Members, we will now proceed to the fifth order of business, which is reports of committees. Senator Murphy for a motion to adopt the committee reports.
Thank you, Mr. President. I move the committee reports printed in the agenda be adopted with the exception of the reports pertaining to appointments.
On the adoption of the committee reports, all in favor say aye. All those opposed say no. The motion prevails. I will now call on Senator Murphy to lay appointments on the table.
Thank you, Mr. President. I move the committee reports pertaining to appointments be laid on the table.
To that motion, all in favor say aye. All those opposed say no. The motion prevails. Members, we will now move to the seventh order of business, which is second reading of House bills. The Secretary will read the House file number.
House File Number 4224.
The House file has been given its second reading. Now moving to the eighth order of business, introduction and first reading of Senate bills. The bills listed on today's introduction calendar are given their first reading and referred as indicated. Now proceeding to the ninth order of business, that's motions and resolutions. We will adopt the author's motions as one motion. All in favor say aye. All those opposed say no. The motion prevails. Senator Murphy for a motion.
Thank you, Mr. President. I move that to take House File 4239 from the table and give it its second reading.
To that motion, all in favor say aye. All those opposed say no. The motion prevails. The Secretary will give House File number 4239 its second reading.
House File Number 4239.
Senator Murphy.
Mr. President, I move to lay House File 4239 on the table.
To that motion, all in favor say aye. All those opposed say no. The motion prevails. I'll now call on Senator Port for a motion.
Thank you, Mr. President. I move that the appointment withdrawn from the Committee on Housing and Homelessness Prevention and placed on the confirmation calendar under Senate Rule 8.2, reported in the Journal for April 29th, 2026, be returned to the committee for which it is withdrawn. That's Minnesota Housing Finance Agency, Commissioner Jennifer Ho.
Member Senator Port moved that the appointment withdrawn from the Committee on Housing and Homelessness Prevention and placed on the confirmation calendar under Senate Rule 8.2, reported in the Journal for April 29, 2026, be returned to the committee from which it was withdrawn. Any discussion on that motion? Seeing none, all in favor say aye. Aye. All those opposed say no. The motion prevails. Members remaining under motions and resolutions, I'll now call on Senator Murphy to designate special orders.
Mr. President, pursuant to Rule 26, I designate the following bills be made special orders for immediate consideration.
Members, the special orders list is on your desk. It's dated April 29, 2026. Consistent with that special orders list, we will start with Senate File number 4612. Senator Wiklund.
Thank you, Mr. President, and I am pleased to be able to present Senate File 4612, which is the HHS Omnibus Budget Bill. This bill is about protecting Minnesotans' health and stability during a time of serious uncertainty. It makes targeted investments to preserve access to health care, strengthen food security, support children and families, and to help local governments manage new federal mandates and rising administrative burdens. More than 90% of the spending in this bill responds directly to changes imposed by Washington that threaten access to medical assistance, SNAP, and other core supports. If we do not act, more Minnesotans will lose health care coverage and access to food benefits. Counties will face unsustainable costs, and hospitals will struggle to absorb more uncompensated care. This bill does not ensure that we will avoid all of the negative impacts due to the imposition of onerous policies coming from H.R. 1, and it is frustrating to think about the eligible Minnesotans losing their health care coverage due to the burden of meeting work requirements and more frequent redeterminations, which will affect their lives in ways we won't be able to know about. Because these actions are taking place because those in power at the federal level wish to deliver tax cuts to those who are more fortunate. Senate File 4612 responds responsibly and strategically. It provides stabilization funding for hospitals and safety net providers, including EMS, so patients can continue to access care in every part of our state. It specifically grants funding to Hennepin County Medical Center, which is a statewide asset providing unique, life-saving services that people across the state have direct experience with in times of need. Both the Hospital Stabilization Program and the Hennepin County Medical Center Stabilization Grant have reporting requirements because it is important for us to understand the current status of hospitals, as well as understanding what stabilizing funding means for the ability of a struggling hospital to continue operating. More work will be needed to understand how to sustain hospitals in the long term, but this initial work is critical to address needs this session. This bill invests in county and state IT systems, specifically so counties can more efficiently implement complex new requirements without shifting the burden onto property taxpayers. In addition to providing funding to make up for the costs of cuts to federal funding for both SNAP benefits and new and expensive administrative costs that would be passed along to the counties who implement the program, we have provided funding in this bill. It also includes food shelf, food bank, and prepared meals support, so families, seniors, people with disabilities do not go hungry. This bill also continues our work to improve lives through smart investments, strengthening mental health reimbursement, which we passed a bill to do last session, only to find that H.R. 1 took away state tools for sharing the costs of increasing rates with the federal government. It includes an interim pharmacy dispensing fee of $2.25 per fill to support community pharmacies as we wait for approval of a directed payment program by the federal government. There are investments and the language to modernize child care licensing for both child care centers and family child care providers. This will help support child care providers in both settings be able to better meet the needs of their families. Licensing regulations that have not been overhauled since the 1980s need to be updated and put into statute to help providers. And this work has been a work in progress. The initial money to study and begin work on this was in 2021. And I think now is the time to move this legislation forward so that we can begin having the implementation period, which will be, the language won't be implemented until at least July of 2027. This bill also makes investments in family preservation efforts that improve outcomes for children. This is a practical bill reacting to stresses we would prefer not to be facing. It addresses immediate risks, it protects essential services, and it reflects Minnesota values that healthcare should be accessible, families should have support when they are in a time of need, and no community should be left behind. I look forward to our discussion today up on the floor, and I do have a couple amendments to start. The first one that I would like to offer is a technical amendment, and it is the A63.
Senator Wiklund offers the A63 amendment. The secretary will report the A63 amendment.
Senator Wiklund moves to amend Senate File Number 4612 as follows. Page 30, delete Section 9. This is the A63 amendment.
Senator Wiklund, to your A63 amendment.
Thank you, Mr. President. This amendment accomplishes several different things. I will call out the line 1.2. It deletes a section in the bill that we found had a fiscal impact that we weren't able to accommodate, and this relates to the work that we did last year on changing the date for the dental, changing to a single administrator. We had hoped to include language to support some of that work going forward, but it is not possible due to the fiscal impact, and so that removes that section. Then there are a number of lines that have to do with making adjustments to different figures in our appropriations articles, and those relate to the need to have our numbers agree with what the governor's proposals actually included. And so these are technical updates to make the numbers line up with what the governor's proposals say. On line 1.10, 1.11, that relates to providing administrative cost for the Helping Paws grant that's in the bill. And then there is a line 1.14, 15, and lines 1.19 and 120 have to do with the transition of the unit within the Department of Health from the Department of Health to the Department of Commerce. Lines 1.16 and 1.17 are updates that were requested by the Department of Health to the article that relates to the helium gas, that language. And I think that, yeah, and then line 1.18 also relates to the transition, excuse me, of Department of Health personnel to the Department of Commerce. So those are the updates in this amendment.
Any other discussion on the A63 amendment? All those in favor say aye. Aye. All those opposed say no. The motion prevails. The A63 is adopted. Senator Wiklund.
Thank you, Mr. President. Now I would like to offer the A59 amendment.
Senator Wiklund offers the A59 amendment. The Secretary will report the A59 amendment.
Senator Wiklund moves to amend Senate File Number 4612 as follows. Page 210, line 7, delete medical and insert Maye Quade. This is the A59 amendment.
Senator Wiklund to your A59 amendment.
Thank you, Mr. President. This amendment relates to Article 9, which is the hospital stabilization article. And as we have been working with both the Minnesota Hospital Association and with Hennepin County on this language, we have seen the need to make some language changes to conform with requests that they have and just to make the language work better. So you'll see that there are updates to where we have the words Hennepin Healthcare System. We would like to make sure that we have the accurate name, which is Hennepin Healthcare System, Inc. And so there are a number of places where that change is made. We have removed some language that the Hospital Association felt would be difficult to provide in a report. That's the financial liquidity and balance sheet analysis line. We are reorganizing the accountability section to make sure that reads properly, that there are accountability measures that we have in the bill, as well as reporting requirements. And so we've updated some of the language in there. Again, there's some more places where HCMC was not the correct term, and so we've replaced that with the correct terminology. And then on page 2, there are some changes that were made to the task force language and an update to increase from 14 members to 15 members. And there's an additional person added, and that's the line item that relates to labor. Instead of having 3 members representing the healthcare sector workforce, we now added a 4th member to accommodate requests from the EMS workforce. And then it also includes some standard language for this type of task force relating to legislative coordinating commission functions, and updates the months of the appointments to comport with what is required by the task force standard language that we include. So those are the changes that are in this amendment, and I'm open to any questions.
Members, we are on the A59 Wiklund amendment. Senator Rasmusson.
Thank you, Mr. President. Would Senator Wiklund yield for a question?
Senator Wiklund, will you yield? She will yield. Senator Rasmusson.
Thank you, Mr. President. Thank you, Senator Wiklund. And I know the topic of HCMC is a very important one this session. And one of the items that I looked at in this bill that I thought was beneficial was having some accountability requirements from HCMC on reporting on their financial state and some key financial metrics. And I'm worried that the amendment before us would remove and reduce some of those accountability requirements that are in the underlying bill. And so my question, Mr. President, to Senator Wiklund is, could you explain why we're taking out some of these accountability requirements that are in the bill before the body?
Senator Wiklund to the question.
Mr. President, Senator Rasmusson, these changes are designed to make the language comport with reporting that the hospitals can actually do. We had received some concerns raised by both the Hospital Association and Hennepin County on being able to produce the information. And so we're trying to work to make sure that when we ask for reporting and we ask for them to respond to an accountability measure, that it is actually metrics and information that they can provide to us. So that's what these changes represent. They're not to diminish the importance of it. If you had questions about any specific one, we can continue to talk about those and make sure that they stay strong. There's not any indication that this would weaken the requirements that we have.
Senator Rasmusson.
Thank you, Mr. President. Thank you, Senator Wiklund. And I guess I'm just looking at one of the concerns I have is on page 1, line 3 of your amendment, where it would delete reporting on financial liquidity and a balance sheet analysis, because I think that's one of the key questions where we have HCMC saying that they may be running out of money, and that's why they're asking the legislature to act this session. So I think that information should be made available, and I guess if they don't have information on their financial liquidity or their balance sheet, maybe that underscores the governance problems that HCMC has. Additionally, if we go to page 215 of the bill and we look at the accountability requirements in subdivision 3, I look at those as being quite basic around providing a comprehensive financial analysis that describes the sources and magnitude of HCMC's financial stability, quarterly reports on key metrics. And so again, I'm concerned that if we adopt this amendment, the legislature will have less information, will have less accountability on what the financial problems are at HCMC.
Any other discussion? Senator Wiklund.
Thank you, Mr. President. I would just comment the first concern that you raised it's contained in section 4, which is the report on financial stability of hospitals, which is something that we are proposing be a report that's delivered every year. And the reason we took out that particular phrase, financial liquidity and balance sheet analysis, is that it fits in with the sentence that says core financial metrics of hospitals, expenses and staffing data, revenue, including payer mix. All of the items other than that phrase were deemed as very accessible and reasonable by the Minnesota Hospital Association. It does leave in that the commissioner can include other data to be determined by the commissioners. So that is why that phrase was removed, because it wasn't making sense for the hospitals. And then on page 215, where you're talking about the accountability requirements, we did a little bit of just to streamline. We put in that the reporting submitted under the hospital annual report, and that has particular statute sections that declare what needs to be provided each year. And so we're trying to make sure that if there are metrics that are being reported in a way that we can capture in a more streamlined manner, that we do that. This is a one-time grant, and so we want to balance having all the information we need and also with consideration for the entity. And Mr. President, I'd like to request a roll call.
Roll call requested, roll call granted. Any additional discussions on the A59 amendment? Senator Rasmusson.
Thank you, Mr. President. Would Senator Wiklund yield for one more question?
Senator Wiklund, will you yield? She will yield. Senator Rasmusson.
Thank you, Mr. President. Thank you, Senator Wiklund. Senator Wiklund, would you remind us in the bill how much money does this bill provide to HCMC?
Members, we're on the A59 amendment. Just for clarity, because this seems to go outside of that amendment, but Senator Wiklund, specifically to that question, sir. Ma'am.
Mr. President, Senator Rasmusson, everybody does have a spreadsheet on your desk, and you will find that in here, and that's $150 million.
Senator Rasmusson.
Thank you, Mr. President. Thank you, Senator Wiklund. And I think if we're going to be handing over $150 million of taxpayer money to HCMC, we should make sure that we have accountability. And so I'll be voting against the amendment today. I think we want more information, more accountability from HCMC, especially if they're going to be asking for a substantial amount of public dollars. Thank you.
Members, we are on the A59 amendment. Any other discussions before we vote? Because a roll call was requested and a roll call was granted. Seeing no additional discussion, the Secretary will take the roll on the A59 amendment. Members, please vote. Members, a gentle reminder, we're under roll call, and there should be no other discussion at each other's desks, please. Senator Kupek, that includes you, my good friend. You have to move over while we are under roll call vote. Thank you. Senator Jasinski, for those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Coleman votes no.
Senator Coleman votes no. Senator Hoschow, for those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Carlson votes aye.
Senator Carlson votes aye.
Senator Pa votes aye.
Senator Pa votes aye.
Senator Latz votes aye.
Senator Latz votes aye.
And Senator Rest votes aye.
And Senator Rest votes aye.
Mr. President.
Senator Jasinski.
Senator Weber votes no.
Senator Weber votes no. All senators having voted who desires to vote, the Secretary will close the roll. There being 33 ayes and 32 nays, the A59 amendment is adopted. Senator Wiklund.
Thank you, Mr. President. And now I'd like to offer an amendment related to the articles that relate to child care licensing. It's the A67 amendment.
Senator Wiklund offers the A67 amendment. The Secretary will report the A67 amendment.
Senator Wiklund moves to amend Senate File Number 4612 as follows. Page 90, line 20, after year, insert. This is the A67 amendment.
Senator Wiklund to your A67 amendment.
Thank you, Mr. President. The A67 amendment makes some changes to the language in Articles 6 and Article 7 relating to child care center regulations and family child care. I've been working with members of my committee, Senator Coran, as well as stakeholders from child care center perspective and family child care perspective to make some additional fine-tuning of the language in the bill. And there have been several issue areas that have been brought forward, and I've been working closely with the Department of Children, Youth, and Families and these stakeholders to try and come up with what I think are reasonable solutions to some of these concerns. And so I'll just go quickly through this amendment. It starts out with changes to the Article 6, which is child care centers, starting with line 1.2. Relates to a provision that clarifies that people who are on a documented leave of absence are able to have the ability to prorate training during a year. Lines 1.3 through 1.5 relate to a concern brought forward by child care centers that the policy for sleep and naps include language that if there is a policy that allows time for naps and rest, that a child care center may not withhold sleep, and even if a parent is requesting that. Then from line 1.6 through the end of the page, that language is all related to the natural elements and materials. We added that in my committee during markup with an amendment brought by Senator Bolden, and it where it was placed was in an area with other requirements for providers, and this is a permissive section, and so council just is moving it to a better place within the article, and it doesn't change the language at all. Then on page 2, there's a provision that modifies the social media accounts section of the policy development that's required for child care centers. Lines 2.3 through 2.5 relates to a concern about shared bathrooms in child care centers, and it removes a couple lines that were giving child care centers some pause and adds a different requirement that they need to develop a risk reduction plan that includes how to correctly supervise these restrooms that have multiple entrances. Lines 2.6 and 2.7 relate to clarifying that infants who are able to independently sit up and can hold a bottle and feed themselves, that they are allowed to do that. Lines 2.8 is where the family child care changes begin, and 2.8 through 2.12 relate to a provision that states what the requirements are for supervision of school-aged children. There have been concerns about that current language. This adds some more clarification and clarifies more about how electronic devices can be used to support supervision. Lines 2.13 through 2.17 relate to the variance process. We've had a lot of discussion in the committee about variances and whether the responsibility should rest with counties to provide them, as it does today, or with the department, which is the proposed change. And what I'm doing here is recommending that we just revert to the language that the department proposed, and also clarifying that the department, upon receipt of a variance request, the commissioner must make a determination on the variance request within 30 business days. There may be more work to do on this provision, but I would like to move forward with this, and then we can continue to have discussion about how to make sure that the variance process does improve and become better for family child care providers. The next section, 2.18 through 2.22, relates to when providers need to submit a new application if they are changing their license type. And it provides greater clarity so providers will know exactly when a new application is required and when it's not required. Then on 2.23 and 2.24 relate to, currently the bill has a provision that providers must have a policy related to firearms, and this removes that requirement. Then starting on 2.25 through the end of the page and into the next page, you can see the same language about natural elements, and it's again just moving that language to a different part of the article. Then on line 3.24 and 3.24, that also relates to the language relating to firearms. Instead of upon admission, this would insert the language before providing care. Providers would need to notify parents about the presence or absence of firearms. Line 3.25 and 3.26 and 27 is an update to the community-based child care section, which is at the very end of the article. And this would allow for an entity, if a facility could accommodate up to 6 licenses, this would allow them to do that as long as the program is located in a site that does not have an R2 residential occupancy designation. That was language that was worked out with DCYF and the fire marshal. And that brings us to the end of the amendment, and I'd be happy to answer any questions.
Any questions on the A67 amendments? Senator Coran.
Thank you, Mr. President, and thank you, Senator Wiklund. I think we've made some significant progress in the accommodation for our in-home daycares based on what the agencies have attempted to do and all of the work that's gone on for the last almost 5 years. And so we appreciate all those accommodations. I think we've done a good service to all of our daycares. We still collectively all have to figure out what is that process that allows us to grow more daycares in Minnesota, especially in home. But Mr. President and Senator Wiklund, I would like to move the A74 amendment to the A67.
Senator Coran moves the A74 amendment as an amendment to the amendment.
Thank you, Mr. President. What the amendment does is, Senator Wiklund...
hold on 1 second. The Secretary has to report it.
Senator Coran moves to amend the A67 amendment to Senate File Number 4612 as follows. Page 2, line 22, delete. This is the A74 amendment to the amendment.
Now, Senator Coran, to your A74, which is an amendment to the amendment.
Thank you, Mr. President. One of the areas of concern the reapplication for existing daycare providers when they move into a Class C license or within a Class C license. What this amendment does, or what the current underlying amendment did, was allowed for to eliminate the reapplication or to reapply if you're moving from one Class C license to the next level Class C license. What this amendment does is allows that same accommodation regardless of which Class C license that they move or migrate to, and it would remove the reapplication requirement. That's in the underlying amendment for Class C1, C2, 3, 4, and or 5. So, Mr. President and Senator Wiklund, I'd hope you would consider this a friendly amendment. Thank you, Mr. President.
Senator Wiklund to the A78, the A74 amendment to the amendment.
Thank you, Mr. President. Senator Coran, I think that this will accomplish, well, I guess I just raise a concern about if someone, what this seemed to imply is that if someone has a C1 license, that they would be able to move to a C3 license without having to reapply. And I guess, Senator Cran, I just would have a concern that there are different requirements for that in terms of the ratios. They're different, it's a different ratio structure. And so I'm just not sure if that should be accommodated. What is true is that if someone has a C3 license, they are able to move to a lower level if they have the ratio, keep the ratios, and they can come back to their C3 level. But can you maybe expound on why you think that this would work and not leave the licensor without some, missing information if someone moved from a C1 license to a C3 license, for example?
Senator Wiklund, are you asking Senator Coran to yield for a question?
I guess I'm putting that out there as my rhetorical question about whether this would be affecting a change that is more substantial than I can tolerate.
Senator Coran to the A74. We're on the A74 amendment to the amendment.
Thank you, Mr. President, and Senator Wiklund. I think we've all worked in our daycare providers. Believe this was one of the last priorities that would provide them with the flexibility and the latitude that they've sought since the beginning of the rewriting of all of those policies. And so I would like to still move forward with it. And so with that, Mr. President, I would request roll call and request a green vote. Thank you, Mr. President.
Roll call requested, roll call granted. Senator Wiklund.
Mr. President, I'm willing to accept the amendment, and I think I just need to make sure that I'm understanding what this accomplishes versus what I had intended, and we can continue to discuss whether there are other implications. So I'm willing to accept the amendment.
Senator Coran.
Mr. President, I withdraw the roll call. And
Roll call request withdrawn. For all those who desire to adopt the A74 amendment, say aye. Those opposed say no. The motion prevails and the A74 is adopted. Senator Wiklund, we are now on the underlying amendment as amended. Senator Wiklund.
Actually, I have no other comments, but I guess I would request a roll call.
Roll call requested, roll call granted. I was thinking of Senator Westlin there because I saw the look on her face. All right, any other discussion on the underlying amendment? Seeing none, the Secretary will take the roll on the A67 amendment as amended. Members, please vote so we can move expeditiously. Senator Househouse, for those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Carlson votes aye.
Senator Carlson votes aye.
Senator Pa votes aye.
Senator Parr votes aye.
Senator Latz votes aye.
Senator Latz votes aye.
Senator Murphy votes aye.
Senator Murphy votes aye.
Senator Marty votes aye.
And Senator Marty votes aye.
And one more, Mr. President. Senator Mohammed votes aye.
And Senator Mohammed votes aye. Senator Jasinski, for those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Coleman votes aye.
Senator Coleman votes aye.
And thank you, Mr. President. Senator Weber votes aye.
Senator Weber votes aye. Senator Dornick, are you planning to vote? All senators having voted who desires to vote, the secretary will close the roll. There have been 56 ayes and 9 noes. The amendment as amended is adopted. Senator Wiklund. I am now going to Senator McEwen.
Thank you very much, Mr. President. I would like to offer the make sure I get my number right, the A69 amendment.
Senator McEwen offers the A69 amendment. The secretary will report the A69 amendment.
Senator McEwen moves to amend Senate File Number 4612 as follows. Page 253, after line 27, insert. This is the A69 amendment.
Senator McEwen to your A69 amendment.
Thank you very much, Mr. President. Members, the A69 amendment is a healthcare worker retention amendment. As we are all aware, we have seen huge consolidations within the healthcare industry, specifically at our hospitals and care centers throughout the country, and here in Minnesota as well. In particular, we have recently received news that an out-of-state entity, Sutter Health, one that prides itself on integrating more AI into healthcare, is looking to acquire one of the largest healthcare systems in our state, Allina Health. And they're seeking to do so without giving workers any assurances that they will honor their union, their collective bargaining agreement, or that they will actually keep hospitals and service lines open. So, members, due to the incoming federal health care cuts from H.R. 1 at the federal level, which we have heard already discussed today, the entire health care system is about to have the rug ripped out from underneath it. We know that when corporations get cash-strapped, including big health systems, they're more likely to explore mergers and acquisitions. Study after study shows that these mergers, which ultimately create more consolidation in our healthcare system that is bad for healthcare accessibility and affordability for patients, are also bad for workers. Several years ago, Minnesota did take some steps when they passed legislation that was, by the way, bipartisan in both bodies, to protect patients and communities from potential catastrophic mergers. But while that law gives some consideration to workers, it does not go far enough to protect them. And as mergers become more and more likely because of H.R. 1 cuts to healthcare funding, the urgency is here now to act. So, members, the Healthcare Worker Retention Amendment would require any successor healthcare entity as part of a merger to retain existing employees for 120 days at the same or greater level of wages and benefits. It would provide just cause job protections. It would require job evaluations of all employees at the end of that 120-day period, and continued employment of all satisfactory employees. And it would require severance pay for any employees that aren't retained at any point during that 120-day period. So, members, this is just asking that when these mergers happen, people are given a period of buffer where they are going to be protected, where the collective bargaining agreements that they've entered into, that their current employment status is going to be honored during that period. And really what this comes down to, because it protects all of the people who would be working in that healthcare system, doctors, nurses, PAs, janitors, everyone who's working in that system during that time. What this really comes down to is about preserving and maintaining the quality of care standard that we expect in the state of Minnesota. So members, with that, I ask for your support, and Mr. President, I request a roll call.
Roll call requested, roll call granted. Senator Abler.
Well, thank you, Mr. President. I stand in support of this amendment, and I wish we didn't need this amendment. I wish that when any company buys another company, they would honor the agreements that have been well debated and bargained for, and an agreement that people have come to. And there's this federal supremacy clause or something that says that they can just do whatever they want, which just seems entirely wrong. And I have one major Alina project in my district and one nearby, and interest in all of those. And even though Alina says we're going to be, don't worry, their word will not be binding, even despite their best intentions. And so for the nurses I represent, the workers at Alina sites near and around my district, I think they deserve the protection and the confidence that what they have already agreed to, and a bargaining is a give and a take, and a balanced approach. The contracts were fair, hard fought, but done in sincerity. I think those should be recognized, Mr. President. And this is actually much more limited than I would have done, but if it's the best we can do, then I suggest we do that and make a statement that a contract needs to matter in Minnesota, wherever you come from. So thank you, Mr. President.
Senator Rasmusson.
Thank you, Mr. President. Would Senator McEwen yield for a question?
She will yield for a question. Senator Rasmusson.
Thank you, Mr. President. Thank you, Senator McEwen. Is this language in your amendment, has that been introduced as a bill this session?
Senator McEwen to the question.
Thank you, Mr. President, and thank you, Senator Rasmusson, for that question. It has not. No, I do not believe it has.
Senator Rasmusson.
Thank you, Mr. President. I'm going to rise, Mr. President, to a point of order under Rule 35 and prepared to offer advice.
Advice. Senator Rasmusson rises as a point of order pursuant to Rule 35.12.
Thank you, Mr. President. The amendment before the body is not germane to the underlying bill. This amendment is in regards to labor law. It's a labor bill, and if this would have been introduced as a bill, Mr. President, it would have been referred to Senator McEwen's committee, the Labor Committee, where these questions could have been vetted. But if you look at the language, it's all about worker retention and protection. And it's about collective bargaining agreements. And it's about enforcing those obligations. And Mr. President, that's very clearly a labor bill. The bill before the committee is the Health and Human Services Omnibus bill. And so, Mr. President, I'd ask for you to be consistent with your rulings that this amendment would introduce to a substantially different subject than is in the underlying bill.
Senator Wiklund.
Mr. President, advice, I would say this is part of the Department of Health statutes, and it is very related to topics in the bill, hospitals, hospital healthcare workers. I would say it is germane.
Any other discussion? Senator Rasmusson, you'll be the last person that we'll hear from before we vote.
Thank you, Mr. President. Just would offer some final advice. And I would just ask for consistency, Mr. President. And anyone in the body can have amendments that are drafted into certain sections of law, but you have to look at the actual content that is in this amendment. So I would just ask, Mr. President, however you rule on this point of order, that you're consistent when amendments are offered. Thank you, Mr. President.
Thank you, Senator Rasmusson. If I could be given a minute. After hearing the advice, after talking to the front desk, also looking at our rules, the point of order is well taken. Senator Hochschild.
Thank you, Mr. President. I'd like to introduce the A76 amendment.
The Secretary will report the A76 amendment.
Senator Hochschild moves to amend Senate File Number 4612 as follows. Page 248, after line 13, insert. This is the A76 amendment.
Senator Hochschild, to your A76 amendment.
Thank you, Mr. President. This is a straightforward amendment regarding the helium rulemaking provisions already in the underlying HHS bill. As members will remember, we started the initial rulemaking process during the 2024 legislative session, and this is a continuation of that ongoing work. This amendment primarily reflects technical changes developed in coordination with the agency and incorporates some regulatory guardrails and other provisions that were included in earlier versions of the bill. It ensures that the focus of the MDH rulemaking is only for regulations of gas wells related to helium and CO2. It also clarifies that no production can move forward until rulemaking is complete and the legislature authorizes permits and fees. This is really about just making sure that the helium framework can continue. And with that, Mr. President, I ask for member support. Thank you.
Members, any other discussion on the A76 amendment? Seeing none, all in favor of adoption of the A76, say aye. All those opposed say no. The motion prevails. The A76 is adopted. Senator Bowden.
Thank you, Mr. President. I would offer the A65.
Senator Bowden offers the A65 amendment. The Secretary will report the A65 amendment.
Senator Bolden moves to amend Senate File Number 4612 as follows. Page 74, after line 12, insert. This is the A65 amendment.
Senator Bowden, to your A65 amendment.
Thank you, Mr. President. And members, I am offering this amendment on behalf of another member who cannot be here, but I do support it. The amendment before you addresses the extended foster care program by updating its reporting requirements. Specifically, it requires an annual report to the legislature on how many youth are accessing the program and the reasons why they exit. This is a straightforward step to ensure that we have the data needed to assess the program's effectiveness and utilization, because the reality is we cannot improve a program if we are not tracking its outcomes. Preliminary data suggests that this program may be underutilized, even as the young people it serves are aging out of the system and facing significant vulnerability. If we want to better support them, we need a clearer understanding of how this program is functioning today. I also want to note that the Department of Children, Youth, and Families has reviewed this amendment, provided technical assistance, and confirmed that these reporting requirements are feasible and can be implemented with no additional cost. It is a modest, no-cost, common-sense step forward to better understanding, better policy, and ultimately better outcomes for the young people we are responsible for supporting. And I would appreciate members' support for this amendment.
Any other discussion on the A65? Senator Wiklund?
Thank you, Mr. President. Yes, I support this amendment. It has been worked on with several members' input and with the department, and I see it as a real positive step we can take to address the concerns of foster youth in Minnesota.
Any other discussion? Seeing none, all in favor of adoption of the A65, say aye. All those opposed say no. The motion prevails. Senator Dibble.
Thank you, Mr. President. I would like to offer the A47 amendment.
The Secretary will report the A47 amendment.
Senator Dibble moves to amend Senate File Number 4612 as follows. Page 48, line 1, delete notwithstanding paragraph and insert. This is the A47 amendment.
All right, to your A47, Senator Dibble.
Thank you, Mr. President. The A47 is an amendment that makes a technical correction to ensure that individuals involved with the Center for Victims of Torture have access to state-funded Medicaid coverage. Mr. President, members, while we respond to mandates that result in fewer people with access to health care, this is an important group to include so that we make sure we protect as many people as possible here in Minnesota. Mr. President, I'll ask for a roll call.
Roll call requested, roll call granted. Any other discussion on the A47? Senator Wiklund.
Thank you, Mr. President. I see this. This is a friendly amendment. It brought to our attention that this paragraph was missing, and so I appreciate being able to to add it to the language.
Senator Rasmusson.
Thank you, Mr. President. Would Senator Dibble yield for a question?
Senator Dibble, will you yield? He will yield. Senator Rasmusson.
Thank you, Mr. President. Thank you, Senator Dibble. Senator Dibble, I'm not as familiar with this program as you are. Could you tell me, who, with your amendment, who would now be covered that's not covered, and the effect of that?
Senator Dibble.
Thank you, Mr. President. Thank you, Senator Rasmusson. Yes, this would be clients at the Center of Victims of Torture who receive their treatment and their services, much of which is billed to Medicaid. Obviously, these are people who have experienced torture and are living here in an effort to, living here, part of our community, and are seeking those services to recover from torture that they've experienced.
Senator Rasmusson.
Thank you, Mr. President. Would Senator Dibble continue to yield?
Senator Dibble, will you yield? He will yield. Senator Rasmusson.
Thank you, Mr. President. Thank you, Senator Dibble. Senator Dibble, wouldn't this amendment include costs because we're going to be covering more individuals with a public program that otherwise wouldn't be covered?
Senator Dibble, to the question.
Thank you, Mr. President. I'll look to Senator Wiklund to possibly help me with some of these answers, but as I understand, these are folks who are currently covered, who receive these services to be treated for torture, billed, through the Center for Victims of Torture, and as Senator Wiklund indicated, in error, this particular paragraph was left out. Thank you, Mr. President.
Mr. President.
Senator Rasmusson.
Thank you, Mr. President. Would Senator Wiklund yield for a question?
Senator Wiklund, will you yield? She will yield. Senator Rasmusson.
Thank you, Mr. President. Thank you, Senator Wiklund. Senator Wiklund, I don't know if you heard the conversation that Senator Dibble and I were having, but just wanted to get your feedback on the costs associated with the A47. As described, this would extend coverage to more individuals, and so to me that means that there would be a cost with it, but I wanted to understand if you viewed this amendment as adding cost to your bill.
Senator Wiklund, to the question.
Mr. President, Senator Rasmusson, this is something that it was left out by mistake. It is an existing provision that is in statute, and it was put in place. As far as I can tell from the information I've been provided, it's been in place since 2003, and so it doesn't add cost. It was just inadvertently left out of the drafting of the language. So we just want to make sure it is included because it's helping a small group of people that need to have access to health care, and it's literally a life-saving ability for them to access this health care.
Senator Rasmusson.
Thank you, Mr. President. Would Senator Wiklund continue to yield?
Will you continue to yield, Senator Wiklund? Yes. Senator Rasmusson.
Thank you, Mr. President. Thank you, Senator Wiklund. And Senator Wiklund, is the cost for this amendment included in the fiscal note for the bill?
Senator Wiklund.
Mr. President, it's not a new provision, so it's not something that's newly would be called out. It's something that exists in our current program today and was just missing from the language drafted for the bill. So it would not have been called out in a fiscal note because it's an existing provision that's in statute.
Mr.
Senator
President.
Rasmusson.
Thank you, Mr. President. I'd rise to a point of order under Rule 7.4 and prepared to offer advice.
Advice.
Thank you, Mr. President. Advice. Under Rule 7.4, it states that an amendment to an omnibus appropriation bill, which we have in front of us here today, may not increase the net appropriations. And it's my understanding that from how this was described, that this would have a cost by including more people. And so I'd ask that you find the amendment out of order.
Senator Wiklund.
Mr. President, this is an existing eligibility category that is covered in the forecast. It is not something new that is being added to this bill that would change that.
Senator Rasmusson, you rose for a point of order under 7.4. Is that correct? Last bit of advice, and then I will rule.
Thank you, Mr. President. Advice. I would just again ask to be consistent here. It's my understanding that this bill, this amendment would have a cost because it would cover more individuals, and so just ask that you be consistent with how you rule on this amendment. Thank you, Mr. President.
After listening to advice, your point of order is not well taken. We are on the Dibble amendment. Any other discussion? Seeing none, all in favor of adoption say aye. Oh, I'm sorry. Sorry about that. He requested a roll call. Roll call, requested roll call granted. The secretary will take the roll. Members, please vote. Senator Rasmusson, Senator Hotshot, for those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Carlson votes aye.
Senator Carlson votes aye.
Senator Pa votes aye.
Senator Pa votes aye.
Senator Murphy votes aye.
Senator Murphy votes aye.
Senator Marty votes aye.
Senator Marty votes aye.
Senator Mohammed votes aye.
Senator Mohammed votes aye.
Senator Omar Fateh votes aye.
Senator Fateh votes aye.
Senator French votes aye.
Senator French votes aye.
And Senator Latz votes aye.
And Senator Latz votes aye. Senator Jasinski.
Thank you, Mr. President. Senator Abler votes aye.
Senator Abler votes aye.
Senator Coleman votes no.
Senator Coleman votes no.
Senator Weber votes no.
Senator Weber votes no.
Mr. President, Senator Miller votes no.
Senator Miller votes no. Senator Pratt, are you voting? There we go. All senators having voted who desires to vote, the secretary will close the roll. There being 35 ayes and 31 noes, the A47 Dibble amendment is adopted. Senator Bowden.
Thank you, Mr. President. I would offer the A51 amendment.
Senator Bowden offers the A51 amendment. The secretary will report the A51 amendment.
Senator Bolden moves to amend Senate File Number 4612 as follows. Page 35, after line 21, insert. This is the A51 amendment.
Senator Bowden to the A51 amendment.
Thank you, Mr. President. Members, this is a straightforward amendment that makes a statement. It says that it is the state's medical assistance policy to protect access to health care for the Affordable Care Act expansion population by, as soon as legally possible, ending the measures that are put in place that we are being forced to adopt by the federal government because of the passage of H.R. 1. There are things in this bill that will mean that people will lose access to their health coverage and thus their health care. It is going to harm people. We are being forced into doing that because of the passage of H.R. 1 at the federal level. The federal government is forcing us to change our policies that will lead to people being kicked off insurance that will harm people. So this statement says that as soon as we can legally possibly stop doing those things, we will do so because we want people to be covered. We want people to have access to the care that they need and deserve. So that, members, is what this amendment would do, and I would ask for a roll call.
Any discussion? Roll call requested, roll call granted. Senator Rasmusson.
Thank you, Mr. President. Would Senator Bolden yield for a question?
Bolden, will you yield? She will yield. Senator Rasmusson.
Thank you, Mr. President. Thank you, Senator Bolden. Senator Bolden, if the language you're proposing here in this amendment goes into our state statute books, what effect will it have?
Senator Bolden, to the question.
Thank you, Mr. President. Senator Rasmusson, as I stated in my intro, the effect it would have, it would mean that as soon as is legally possible, if and when the federal law changes, that we would, that our policies would change here at the state level, that we would follow the policy to ensure that the people that are losing coverage because of those federal laws that we are being, forced to align with would then be covered. It is a policy statement stating that our, the policy of our state is to protect the care of these folks.
Senator Rasmusson.
Thank you, Mr. President. Would Senator Bolden continue to yield?
Senator Bolden, will you yield? She will yield. Senator Rasmusson.
Thank you, Mr. President. Thank you, Senator Bolden. And so I'm looking at your amendment, page 1, starting at line 10, going on to line 11 and 12, where it states the commissioner must follow section 256B.0562 subdivisions 5 and 6 to prevent increases in health care coverage loss and uncompensated care for providers. Could you tell me what that section, that reference, what that would require the commissioner to do?
Senator Bolden.
Thank you, Mr. President. Yes, Senator Rasmusson, that points to pages 42 and 43 in the bill that is before us, which has language that directs the commissioner, again, as if and when policies and laws change at the federal level that would allow us to revert back to our current process of allowing coverage for these folks, then that would be the trigger that would happen. The commissioner would be, it's that contingency language that would allow us to change our policies based on what is occurring at the federal level.
Senator Rasmusson.
Thank you, Mr. President. Would Senator Bolden yield for another question?
Senator Bolden, will you yield? She will yield. Senator Rasmusson.
Thank you, Mr. President. Thank you, Senator Bolden. Senator Bolden, could you point me to where in the underlying bill that is again? I know you mentioned a page number and I just didn't catch it. I want to make sure I'm looking at the same language you are.
Senator Bolden, to the question.
Thank you, Mr. President. Pages 42 and 43.
Senator Rasmusson.
Thank you, Mr. President. Thank you, Senator Bolden. And I guess I'm just confused by this amendment because it sounds like in the underlying bill, there's already contingent language that if federal law were to change, that the Department of Human Services would be able to revert back to not having work requirements or community engagement requirements. And so again, Mr. President, would Senator Bolden yield for a final question?
Senator Bolden, will you yield for a final question? She will yield for a final question. Senator Rasmusson.
Thank you, Mr. President. Thank you, Senator Bolden. So it's my understanding that this amendment that you're offering is simply a policy statement. It actually doesn't affect anything under law or really change even anything in the underlying bill. Is my reading of that correct?
Senator Bolden, to the question.
Thank you, Mr. President. It is a policy statement, and I believe it is important for us to underscore the value and the policy. Again, we are making changes in this bill that certainly as a majority, we would rather not be making, but we are being forced into doing so because of a bill, H.R. 1, that has been passed at the federal level. So it is important to bring forth that value and having this policy statement in place so that if and when those changes can occur, that they will.
Senator Rasmusson.
Thank you, Mr. President. And I would say there's a couple of reasons to vote against this amendment. One would be as it's really a policy statement that has no impact on any Minnesotan beyond what the underlying bill has. And then I would also say that to me, it's really important that we get more Minnesotans working and that we are able to help Minnesotans find opportunities for employment or community engagement. And I think that especially given the budget challenges that we have at the state level, the budget challenges that we have at the federal level, I don't want to see us go backwards on making sure that we have a pathway to work and community engagement for Minnesotans. And I think if you were to go ask Minnesotans, do they think there should be work requirements for adults without children on medical assistance, I think they would say yes. Because a lot of the Minnesotans that I talk with, they have health care coverage that is more expensive and offers less than medical assistance offers, even though they're employed, paying taxes, and paying for a health care plan either through MNsure or through their employers. So I think there's a couple reasons to vote against this Bolden amendment, and that's why I'll be voting no today. Thank you.
All right, Senator Kroon.
Thank you, Mr. President. Policy statements, there's a long standing bipartisan opposition to putting policy statements into our statute books. Policy statements are just what somebody thinks about a bill. Typically, our statute should be reserved for substantive things that require something to be done or prohibit something from being done, things of that nature. We all can make policy statements on our own time through various mechanisms and platforms that we all have. We don't need to be littering up our statute books with policy statements for political purposes. The people of Minnesota expect better than that. There's a lot of serious, important work that this chamber has to do, and we shouldn't be wasting our time littering up our statute with meaningless policy statements.
Senator Pratt. Senator Lucero.
Thank you, Mr. President. Wondering if Senator Bolden would yield for a question.
Senator Bolden, will you yield for a question? She will yield for a question. Senator Lucero.
Thank you, Mr. President. Thank you, Senator Bolden. And I was listening to the dialogue between yourself and Senator Rasmusson, and I have the bill and the amendment here. And I just was wondering if you could clarify, in the course of that exchange, you had referenced something to the effect of, we're being forced into this, and you, in my understanding of the dialogue, you didn't like that we're being forced into this, and hence you're trying to revert back. Could you please clarify again what exactly the amendment is doing, why you are offering this amendment, and what your priority or your position is in regards to what we're being forced into?
Senator Bolden, to the question.
Thank you, Mr. President. Senator Lucero, so this amendment, as was stated, is a policy statement. The intention is to be very clear of what our policy and intention is as a state. It is to protect, as it says, to protect access to health care for the Affordable Care Act expansion population. I think it is important to be clear what our policy and what our stance is there, and to be clear as it points to then the contingency language, that as soon as legally possible, that we could change our practices here in the state. You asked about, my referencing what we are being forced into. I would characterize it that way. Because of H.R. 1 passed at the federal level, we are being forced into changing our state policies in a way that I wish we were not. I believe healthcare is a human right, and people should have access to the care that they need and deserve. The impacts of the changes that we are being forced to make because of the HR 1 will mean that people will lose access to their healthcare coverage. It will mean that people will lose access to their healthcare. I believe that is wrong, and I believe that as soon as it is legally feasible for us to revert back to the status quo of who we are covering today, right now, that we should do so. And so the intention of this amendment is to be clear with that policy statement that is the intention of the state of Minnesota.
Senator Lucero.
Thank you, Mr. President, and thank you, Senator Bolden. If she would yield for one more question.
Senator Bolden, will you yield for one more question? She will yield for one more question there, Senator Lucero.
Thank you, Mr. President, and thank you, Senator Bolden. So you had just mentioned that you believe healthcare is a human right, and therefore you're offering this amendment to remove the work requirements as soon as possible. Can you help me understand your position then, as healthcare is a human right? Do you believe that healthcare is an unalienable right, as referenced in the Declaration of Independence when you use that term, healthcare is a human right?
Senator Bolden, to the question.
Thank you, Mr. President. What I mean by that is I mean that everyone should have access to the care that they need and deserve. Healthcare, I believe, is a human right that should be accessible to everyone, regardless of income, regardless of zip code, regardless of race, that everyone should have access to that care. We could build a healthcare system that does that. We could build a healthcare system that is focused and centered around people's care instead of profits for insurance companies and corporations and CEOs. And I'm committed to that work, and I will continue to build towards that. That's not the system we currently have right now, and what is occurring at the federal level is moving us farther away from that. And so, again, this as a policy statement makes it clear that as soon as we can, as a state, not go back to, as soon as we can as a state change from what we are being forced into at the federal level at this point in time, we will do so.
Senator Lucero.
Thank you, Mr. President. Thank you for the clarity. And Minnesotans are watching. They're listening. And for those Democrats that believe that this is a human right, again, we have a blurring of the distinction between citizens and illegals. A human right is something that the Democrats are falsely advocating for that would result in taxpayers funding illegals, and in this case, they're going so far as to say there shouldn't be any requirements, including work requirements, prerequisites, that would require the recipient to actually engage in efforts. They want to have no conditions, no requirements, no obligations, this is Democrats now, that would get in the way of taxpayers that are already crushed with funding and paying for their own families, that remove all strings, all requirements to force these already crushed taxpayers to pay for those who don't want to have requirements to work. I oppose this amendment. Thank you, Mr. President.
Senator Port.
Thank you, Mr. President. I am sort of blown away by the conversation that we're having here. First, I want to say that there was the insinuation made that work requirements, these additional paperwork requirements, because, Mr. President, work requirements already exist. This bill is forcing us to just double the amount of time that people have to fill out paperwork about them. There was an insinuation that this work requirement, paperwork requirement, is the pathway to work and community engagement. Give me a break, Mr. President. This is paperwork designed to make it more difficult for people to have access to the health care that they need. That is, full stop, what this bill does, what HR 1 does. We are being forced here in Minnesota to take on those requirements, not through the way that we've done it before when there's been federal changes in law that have taken multiple years to implement, that have worked with our community or our state agencies. This is a moment when we're not just looking at the penalties in the bill, but other threats of up to $3 billion a year that the federal government is saying, we're just going to take that from you. We don't have to give you a reason. If you don't do everything we want, we're just going to take it from you. That has never been the way that we have instituted new federal policy in states. Mr. President, this bill sucks for me to vote. I don't want to vote for this bill to pass because I don't want to kick people off of their health care. But we have to, because if we don't, that population of adults who are going to, be at risk of losing their health care because of these new requirements expands to everyone on MA, because that is the threat that the federal government is using against us. So we're going to have to vote to pay for this unfunded mandate from the federal government to provide less service to fewer people and have it cost Minnesotans more. So I really appreciate Senator Bolden's amendment today that says we are doing this because we are required to in order to protect children who need access to health care, to protect food assistance, to protect housing assistance. But we are with the people of Minnesota. That's what this amendment that Senator Bolden has says. It says, we don't like this any more than you do, and we will, at the earliest moment possible, get you back on your health care. And it's a pretty simple statement. I think there's broader discussion on the morality of this bill in general, but I think Minnesotans need to know that we are fighting for them, that we care about them, and that we understand this bill is not good for them, but we are doing the absolute best to plug the holes that this federal government has shoved at us and threatened us with the loss of billions of dollars if we don't comply.
Members, any other discussion? We are now going to Senator Westrom.
Thank you, Mr. President. Would Senator Bolton yield for a question?
Senator Bolton, will you yield? She will yield. Senator Westrom.
Mr. President, Senator Bolton, we've heard this great discussion about having a policy if we're going to use taxpayers' money. That's your neighbor's pocket that government is reaching into to put in the general fund to give to somebody else. Your amendment appears to be wanting to revert back to the policy of giving away free health care with your neighbor's money, even if an able-bodied adult doesn't want to work. Senator Bolton, that's my question. Why do you think it's so important that an able body that could work doesn't have to work and do something for free health care?
Senator Bolden, to the question.
Thank you, Mr. President. Senator Westrom, I'm going to just take a step back and reiterate some of what Senator Port just shared, and also just again say this amendment is a policy statement and speaks to what the policy and the stance and intent of the state of Minnesota is, given what we are being forced into do. As we are being, as these new paperwork reporting requirements are being pushed upon us, that does not equal, we already have work requirements. That does not equal more people going to work. I will say in Minnesota, this population is about 220,000 people. Estimates are that about 70% of this population already work. And it will just be more paperwork. It is more hoops for them to jump through for the purpose of having them lose their health care. That is the intent of this at the federal level. They know that people are going to fall through the cracks. They're not going to be able to keep up with the intense paperwork reporting requirements again and again and again. So even people who are eligible are going to lose coverage because of this. And so as a state, this is saying We want people who are eligible to be covered. We want to revert back to the status quo where there currently are work requirements, but we are not putting extra red tape and hoops for people to jump through in front of them for the sole purpose of ensuring that some people are going to fall through the cracks.
Senator Westrom.
Mr. President, thank you, Senator Bolton. Would you yield for another question?
Senator Bolton, will you yield? She will yield. Senator Westrom.
So, Senator Bolton, you just told us that most of these people are working, and that's good. But you still want to revert back to the old ways, if possible, as quick as possible, which doesn't require and doesn't ask those adults that are able-bodied without children to work before we're going to hand out welfare to them. So why do you want to revert back to that policy for these able-bodied adults without children to not have to work and still get free handouts from the government and the taxpayers that are paying it?
Senator Bolton, to the question.
Thank you, Mr. President. I'm not sure how many more ways I can say it. Adding additional paperwork requirements for people is not value add. It is simply putting red tape and barriers in front of people that will mean them losing their health care. I don't want that. I want this would, revert back to the status quo where, as you said, right now, 70% of folks are working. People want to work. And us putting, or the federal government putting barriers in front of them to have to fill out endless paperwork is not helpful and does not help them meet their goals or their needs or ensure that they can have the health care that they need.
Senator Westrom.
Mr. President, Senator Bolton, thank you for that answer. I will help interpret it for the rest of the body here, because what I heard you say was for the 30% of able-bodied adults without children that can work, you don't want to make them work, and that's red tape if we make them work. Now that is Democrat thinking we're hearing on the floor, that red tape now equates to work. If we're going to require that before you get welfare from the taxpayers that's come out of your neighbor's pocket and in many cases maybe your pocket. So Senator Bolton, thank you for that honest answer at least. It has to be a little interpreted because you're doing a good job of kind of double talking here. 70% of the people on welfare are working. Your amendment would say, let's not keep that policy in place for the other 30% that don't want to work for whatever reason. They're capable, able-bodied adults. They want free welfare, free health care that most of our constituents work their butts off to provide. Whether it's self-insurance through their own business or the company they work for. They work hard for that benefit. That's very expensive. And your amendment here is wrong-headed. It is trying to revert back to the bad policies of getting free welfare through free health care that everybody else is paying for while they're also paying taxes, so this group of people doesn't have to work even though they're capable adults and could work. It makes no sense. Vote no on this amendment. And Senator Bolton and the rest of the Senate, start having a little more compassion for the constituents you claim to be fighting for. You know, sometimes that little nudge in life is what gets you off the couch, kicks you in the butt a little bit, and all of a sudden you find the gratification of a hard day's work, the accomplishment, the gratification, the fulfillment of being tired at the end of the day, a paycheck that you earned, money in your bank account, and you feel good about yourself. When you're not expected to work, your expectations continue to spiral down. I have worked on many policies in the disability arena. And one of the things that kept coming back over and over in some of our work on the Ticket to Work, Social Security panel, from many in the disability community, because of all the handouts and welfare that have been given to folks on disability, many times trapping them into a lifestyle of dependence. If they try to work, there's a cash cliff, they lose everything. But the bottom line came down in most every conversation is it's time to raise your expectations. It's time to raise your expectations of people with disabilities. They can work. And the same would be true here. We're not even talking a capable, able-bodied that might have a legitimate disability. We're saying capable, able adults without children that don't even have to work to get their free health care or free welfare. It's time to raise our expectations, unleash the shackles of welfare that puts people in a spot where they don't get off the couch and go work and feel the gratification and the accomplishment that comes along with a good, hard day's work and the paycheck to boot at the end of the day. Raise your expectations. Vote no on this bonkers policy that just continues to show us how the Democrats want to just stay on this trend of fraud with welfare dollars and wasteful policies that they want to revert to, that we're trying to get out of by having some work requirements if you're an able-bodied adult. We can raise our expectations here, vote no on this amendment, and let's move in the right direction for all Minnesota citizens and taxpayers.
Senator Maye Quade.
Thank you, Mr. President. I'm just going to reground us in reality. While 70% of Minnesotans on Medicaid work, that's the total of Medicaid recipients. I think 94% of non-disabled, non-elderly, non-children Medicaid recipients in the state of Minnesota work. But let me explain why work reporting requirements are so harmful. Because, Mr. President, you can't pass a bill that cuts $1 trillion from health care to give it to tax breaks to billionaires without kicking people off health insurance. And the way that work reporting requirements do it is that they require people every single month to log that they worked 80 hours that month. Now, I know a lot of people in this chamber haven't had the privilege of working shift work or being at the mercy of your boss or the flow of customer bases, but I have very recently. And I know that while I can get 3,000 hours in Q4 during Thanksgiving and Christmas, I can get very few hours in Q1 when people aren't shopping as much. Is it my fault that I'm on Medicaid and because I have to certify every single month that I'm working 80 hours that I didn't get 80 hours? No. Further, Mr. President, I have a lot of family members who are farmers. Ask me or tell me, Mr. President, how a farmer in December is going to certify that he worked 80 hours to continue to receive his Medicare cover or Medicaid coverage. That is how work reporting requirements kick working people off of their health care, and that is the point. The one big billionaire tax cut bill was meant to kick people off their health care and do it by putting up paper barriers every single freaking month. And then they're going to make us pay for it to give fewer people health care. Our counties have to hire hundreds more people to give fewer people health care so more people can get sick. Congratulations, worst bill in history that's ever been passed. And now we're stuck here holding the bag. We either have to cut 250,000 Minnesotans off of health care or put in peril 1.3 million. It is terrible what Republicans in Congress have made us do here today. And so I'm so grateful to Senator Bolden that those of us who are responsible enough to know that we have to pass these terrible work reporting requirements that will kill people, Mr. President, at least those of us in this chamber that get the opportunity to say that work reporting requirements are evil and cutting people's health care to give tax cuts to billionaires is evil. We get the chance to do that here. Vote green.
Senator Mann.
Thank you, Mr. President. 62,000 Minnesotans are going to lose their health care coverage because of the increased cost in the individual market. Another 140,000 Minnesotans are expected to lose their Medicaid coverage because of these new, unrealistic, and cruel federal requirements. They want to make sure that people with low incomes, undesirable people, undeserving people, do not get health care. They cut the annual enrollment period and ended automatic enrollment. That is what we are talking about today. The single purpose is to kick people off of their health care. So do not let yourself be lied to and be told that this is not the goal. This amendment says that as soon as we can remove these ridiculous federal requirements and give people their health care back. And you just heard Republicans say that they don't want to do that. Rewind the tape, Mr. President. Multiple Republicans just said they don't want to give back health insurance to 140,000 Minnesotans. And then they say that we are the ones who need to have compassion because people feel better about themselves when they have to work for their child to get insulin, which is the richest thing I think I've heard on this floor yet. This is unbelievable. The argument they keep using is that we are giving away free health care. What free health care? There is no free health care in America. If you don't understand how health care works in this country, you don't have to say anything. You don't always have to talk. Thank you, Mr. President.
Senator Dibble.
Thank you, Mr. President. Mr. President, members, everyone knows that H.R. 1 was designed solely to throw people off of health care to save hundreds of millions of dollars. That is the point of H.R. 1 and all of the ridiculous demands it makes of people who are working and in many cases paying for part of their health care. Everyone who can work is working. It is estimated, Mr. President, that H.R. 1 is going to, quote, save $1 trillion over the coming years. And what is that $1 trillion for? For tax cuts for billionaires and corporations. Everyone knows that's what H.R. 1 is. So I welcome all of my Republican colleagues to continue to stand up and defend that bill. It doesn't unleash or free anyone. It yanks health care away from people who need it. And yes, health care is a human right, and health care is something that we should all have a right to expect. The fact that we don't even share in that knowledge that we take care of one another, that's the whole point of insurance. That's the whole point of why we pull together in health care. 7.5 million more uninsured people by 2034. They are going to, 6.5 million of those are going to lose their coverage directly. Another are going to lose if you look at the effects on the ACA marketplace. These are the ridiculous barriers that have been put in front of people, only designed to take their health care away from them. That's the point of H.R. 1. It's not designed to empower anyone. It's designed to save $1 trillion to give it to millionaires and billionaires. That's the point of the bill, and we all know it, and that should not be the policy of this state. People losing their coverage because twice a year they have to fill out a bunch of paperwork, even if they are working or engaged in community engagement. If they simply fail to fill out their paperwork, report sufficiently in the ways and manners that are demanded of them, they lose their health care. They have to redetermine their eligibility every 6 months. The paperwork is more complex. The income verification, much, much more complex, and if there's a slightest variation, fluctuation in your income, you're out. You lose your health care. You lose your eligibility for having modest savings. If you're paying some premium, some cost share, if you miss even by a couple of hours your payment, you're out. People can be barred from re-enrolling for a period of time then. There's no retroactive coverage. We know the effect that that's going to have on our clinics and hospitals. If someone shows up, they're eligible, and none of their retroactivity is it recognized for health care that they need. Direct cuts to federal Medicaid funding. And it goes on. Reduced support for the expansion populations, which we're talking about right now. Low-income single adults. Restrictions on those who are medically frail, which we'll have a conversation about in just a minute. The burdens that we're putting on our counties that are going to drive up property taxes. Increased administrative demands and a refusal to support them in those demands. Mr. President, I hope my comments and others invite more Republicans to stand up and defend H.R. 1, because you know what's going to happen? People know this is mean-spirited. They're going to lose their health care. Their neighbors are going to lose their health care. Their families are going to lose their health care. Clinics and hospitals all over Minnesota, particularly in greater Minnesota, are going to close because of this. That's what's going to happen. That's what's happening here. I thank Senator Bolden for her amendment. That should be a statement that we can be proud of making as a policy of the state of Minnesota. Thank you, Mr. President.
Members, any other discussion before I go to the author of the amendment, which is Senator Bolden? Senator Hauschild.
Thank you, Mr. President and members. I concur with everything that's been said on our side of the aisle here, but I just want to give the unique perspective as a senator from the most rural district in the state. Because the big, beautiful bill, which is the biggest oxymoron I've ever seen in legislative history, is a wrecking ball to rural Minnesota and greater Minnesota. When you think about the fact that a disproportionate amount of Medicaid recipients are in our rural communities, and this bill guts that for those members, for those residents. You consider the fact that these working requirements are harder on rural residents. We have less job opportunities in greater Minnesota. We have seasonal work that isn't always readily available when trying to apply for the worker requirements that are demanded by H.R. 1. We have transportation issues, many times hours of distances that are required to get to a job in the first place from some of our rural and isolated areas in the state. You add on top of it that we have challenges with broadband and cell service all across my district. Members, I cannot tell you the number of times I have been driving in my district in places that aren't even that rural, where I lose service and I drop a call with other senators, with colleagues, with agency staff, because I simply can't get through with the cell service that we have in northern Minnesota. This bill will disproportionately impact those rural residents. That's on top of the devastating cuts that it will have on our rural hospitals. We already know that H.R. 1 and the big, beautiful bill will close hospitals in the United States. And where will those hospitals be? Will they be in our cities? Will they be in our wealthy coastal cities all across the country? No. They'll be in tiny towns all across northern Minnesota, central Minnesota, and greater Minnesota. That will be the impact of this bill. And who gains from these working requirements? Who gains from the change in wealth in the bill, the H.R. 1 and big, beautiful bill? The wealthiest Americans who might have a cabin or a second or third or fourth or 10th home in a rural community or a lake home. But I guarantee you that 90% of those folks live in big coastal cities in the United States. So this is the biggest wealth transfer away from greater Minnesota and rural America to the global elite that live in our biggest cities. That is what this bill does. It guts our health care, it guts care for rural residents, and it transfers that wealth to the global elite all across the United States. So we're making a statement about that bill. We're making a statement that these work requirements disproportionately impact districts like mine and districts like many of you across the aisle. So you should join us and support this resolution from Senator Bolden. Thank you, Mr. President.
Senator Bolden, you are the last voice we're going to hear before we vote on the A51 amendment.
Thank you, Mr. President. Well, this discussion has been illuminating. I encourage everyone to vote green. If not for the reason that you want everyone to have health care, I would encourage you to talk to your hospitals. They hate H.R. 1. They hate the impact that this is going to have on them because of some of the reasons that have already been discussed. It is going to mean that people lose access to their health care. And guess what? When people lose access to health care coverage, they still need health care. But they put it off maybe for a little bit longer. And so instead of going to a clinic appointment, they end up in an emergency room. And guess what? Care in an emergency room is a heck of a lot more expensive than care in a clinic. When people are sicker, it is more expensive. And so that care will still be provided. It will be more expensive. And the levels of uncompensated care for hospitals, and in particular rural hospitals, is going to increase. Hospitals know that. They do not want this. Talk to people at your counties. They know that the burden this is going to have to administer. And I will also just say everyone who is eligible for Medicaid will be at risk for having their health coverage taken away, whether or not the work requirement applies to them, whether or not they prove their compliance or exemption status or not, because the administrative burden of implementing the work requirements strain the county's ability to do so. As was said, they're having to hire hundreds more people. We are paying more to do less. None of it makes any sense. And so this is a simple statement that says, here in Minnesota, we want people to have health care. And as soon as we can move away from the harmful, dangerous policies that the federal government is forcing upon us, we should do so. Vote green.
The Secretary will take the roll on the A51 amendment. Senator Jasinski, for those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Abler votes no.
Senator Abler votes no.
And thank you, Mr. President. Senator Coleman votes no.
Senator Coleman votes no. Senator Hoschow, for those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Carlson votes aye.
Senator Carlson votes aye.
Senator Pa votes aye.
Senator Pa votes aye.
Senator Murphy votes aye.
Senator Murphy votes aye.
Senator Mohammed already voted. Senator Fateh votes aye.
Senator Fateh votes aye.
Senator Pappas votes aye.
Senator Pappas votes aye.
Senator Putnam votes aye.
Senator Putnam votes aye.
And Senator Frentz.
Senator Putnam had already voted.
Okay. And Senator Frentz votes aye.
And Senator Frentz votes aye. Senator Hoschow.
Thank you, Mr. President. Senator Marty votes aye.
Senator Marty votes aye. Senator Jasinski, those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Holmstrom votes no.
Senator Holmstrom votes no.
Senator Wiesenberg votes no.
Senator Wiesenberg votes no.
Senator Liskey votes no.
Senator Liskey votes no. All senators having voted who desires to vote, the secretary will close the roll. There being 34 ayes and 32 noes, the A51 amendment is adopted. Senator Utke.
Thank you, Mr. President. I would offer the A55 amendment.
Senator Utke offers the A55 amendment. The secretary will report the A55 amendment.
Senator Rutke moves to amend Senate File Number 4612 as follows. Page 215, after line 4, insert. This is the A55 amendment.
Senator Utke to your A55 amendment.
Thank you, Mr. President. We will jump to a different section of the bill here. This involves Article 9, Section 5, and it concerns the Hennepin Healthcare Stabilization Grant. The A59 changed a little bit about the way I was looking at it because Subdivision 3 talked about all the requirements for the grant monies, etc. Some of that has now been removed. So, per this amendment, it says that grant funds received under this section must be used to preserve regional and local access to essential healthcare services, including emergency care, inpatient, hospital care, maternal care, obstetrical care, behavior and mental health care, and primary care and clinic services. We are making sure that the monies that we are providing, that our taxpayers in Minnesota are providing, are used for health care. I'm offering the amendment for several reasons. First, we all know about the failure of the HCMC board, health board, and that the Hennepin County Board of Commissioners had to assume operational responsibilities. But even more concerning for me is what I have read in various articles that claim that HCMC was spending approximately $50 million a year on non-essential social and climate justice programming, DEI initiatives, identity-based training, climate activism, and more. Basically, go woke, go broke, and they did. HCMC is very important to our entire state, so I do want to see them be successful again. That is in all of our best interest, whether we're metro, rural, and in fact in rural, we probably even are more so. Anybody that has a serious injury, a burn, etc., they come to HCMC. So we want them to be working at the top of their game. But if we are investing the taxpayer money in this stabilization effect, there must be no more social or climate justice programming. HCMC must again focus on their mission of serving all Minnesotans with world-class health care. This is a common sense amendment that just says if we are going to fund grants to HCMC with taxpayers' money, the money will be used for essential health care services. Members, I think this is, as I've said a number of times, it's common sense, and I ask for your support. Thank you.
Senator Wiklund to the A55 Utke amendment.
Thank you, Mr. President. Would Senator Utke yield for a question?
Senator Utke, will you yield? He will yield. Senator Wiklund.
Senator Utke, or Mr. President, Senator Utke, it looks like the language is very similar or the same as what we've included in the hospital stabilization grant program, and we were hoping that that would, guide hospitals to continue to provide the access that they do today. I guess, do you see that when the words regional and local access, do they make sense in your allowable use of these grant funds? It just seems like this is specific to Hennepin County Medical Center. and I'm not sure that that wording makes sense.
Senator Uckey, to the question.
Thank you, Mr. President. And I was trying to catch some of the details here. Senator Wiklund, could I respond with a little bit of a question? You're saying that what I proposed you've already included. Am I correct in what I heard?
Senator Wiklund, to the question.
Mr. President, Senator Udke, I'm saying it's included in the previous grant program for the hospitals, not the specific program or not the specific grant to Hennepin County.
Senator Uckey.
Okay, thank you, Senator Wiklund. So I guess I'm hearing that this is already included, so that we don't need it. Is that correct? I guess if Senator Wiklund would
Senator Wiklund.
Mr. President, Senator Udke, I guess I would draw your attention to on page 214, section 5, where the subdivision 1 is establishment, and it talks about the Commissioner of Health must award a grant to Hennepin Healthcare to stabilize HCMC operations. And it does say, preserve access to essential services at HCMC that support the healthcare needs of the communities served by HCMC and the state of Minnesota. And I also would draw your attention to, in the accountability requirements, there is a requirement that they develop a long-term, a strategic plan for long-term fiscal sustainability that would have proposals to ensure the continued operation of critical specialized services by HCMC that are essential to Minnesota's comprehensive statewide hospital network. So I guess it seems like in two places we're kind of reinforcing already what we want them to do with the funding and how we want it to support, preserve access and support the healthcare needs.
Senator Uckey.
Thank you, Mr. President, and thank you, Senator Wiklund. I do see where what you're referring to on page 214. They are very similar. I guess with that, I could, Mr. President, we got a multitasking up there. But Mr. President, with that, then at this point, I would withdraw the A55 because we're similar. We're not exact language, but we're working on the same mission here, so thank you.
The A55 amendment is withdrawn. Senator Dibble.
Thank you, Mr. President. I would like to offer the A49 amendment.
Senator Dibble offers the A49 amendment. The Secretary will report the A49 amendment.
Senator Dibble moves to amend Senate File Number 4612 as follows. Page 40 after line 27, insert. This is the A49 amendment.
Senator Dibble to your A49 amendment.
Thank you, Mr. President. Before I forget, I would like to request a roll call.
Roll call requested, roll call granted.
Thank you, Mr. President. This would add to the list of those who are recognized as needing to be exempt from all of the tripwires and hoops and barriers to continuing to receive their health care, which we discussed a few minutes ago on the Bolden Amendment. Those who have HIV and or AIDS. Mr. President, it is important that we get this right. For people living with HIV, even a brief disruption in care can be devastating. Interruptions in treatment can reduce the effectiveness of medications and jeopardize viral suppression with very serious implications for individual and for public health. Mr. President, members, at the same time, many people with HIV and AIDS face persistent stigma, discrimination, health-related barriers to employment. So these realities are exactly why those medically frail exemptions exist, to ensure that people with serious issues, complex conditions are not pushed out of coverage because of bureaucratic hurdles or work reporting requirements that fail to reflect their actual experience, their day-to-day experience. Mr. President, I would encourage a green vote.
Members, a roll call has been requested and a roll call has been granted on the A49. Any other discussion before we vote? Senator Pratt.
Thank you, Mr. President. Mr. President, as I understand this amendment, it would allow more people to remain on medical assistance and therefore change the appropriation. I would like to find that the amendment is out of order due to Rule 7.4.
Senator Pratt brings a point of order pursuant to Rule 7.4. Senator Dibble.
Thank you, Mr. President. Well, once again, here we are, back to the previous discussion, where members think it's perfectly fine to deny needed health care for those who struggle and those who need it. But, Mr. President, I'll just point out that this simply clarifies in a list that already exists. If you look on page 40, clarifies that those with a serious or complex medical condition would continue to include people with HIV and AIDS, so that we are sure that there is no interruption in their health care, so they don't suffer the consequence that I just described that is quite serious for their own health care. Mr. President, it's important to understand why this is so important. I won't debate the merits anymore, but I'll just say that it's a part of the list that we see on line 40, paragraph 4, and including those with serious or complex medical condition would include those with HIV and AIDS. Thank you.
Thank you, members, for the advice. I'm going to call Eric Nauman. Will you join me at the dais, please? After soliciting advice and reading the statute, the point of order is not well taken. Senator Dibble, we're on your A49. Any other discussion on the A49 amendment before we vote? Seeing none, the Secretary will take the roll on the A49 amendment. Members, please vote so we can move expeditiously. Senator Hoschow, for those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Carlson votes aye.
Senator Carlson votes aye.
Senator Pa votes aye.
Senator Pa votes aye.
Senator Fateh votes aye.
Senator Fateh votes aye.
Senator Pappas votes aye.
Senator Pappas votes aye.
Senator Port votes aye.
Senator Port votes aye.
Senator Johnson Stewart votes aye.
Senator Johnson Stewart votes aye.
And Senator Gustafson votes aye.
Senator Gustafson votes aye. Senator Jasinski, for those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Abler votes aye.
Senator Abler votes aye.
Senator Johnson votes no.
Senator Johnson votes no.
And Senator Coleman votes no.
Senator Coleman votes no. Senator Hochschild.
Thank you, Mr. President. Senator Marty votes aye.
Senator Marty votes aye.
And Senator Murphy votes aye.
And Senator Murphy votes aye. All senators having voted who desire to vote, the secretary will close the roll. There being 36 ayes and 30 noes, the A49 Dibble Amendment is adopted. Senator Coran.
Thank you, Mr. President. I'd like to move the A72 amendment.
Senator Coran offers the A72 amendment. The secretary will report the A72 amendment.
Senator Coran moves to amend Senate File Number 4612 as follows. Page 190, delete subdivision 7. This is the A72 amendment.
Senator Coran to your A72 amendment.
Thank you, Mr. President. The A72 amendment is a section in the changes to the in-home child care providers as it relates to firearms. And so we've made great progress on a variety of issues, still not solving the problems. And what this amendment does is really, based on all the conversations we've had, there is no agreement. There's a lot of contentious issues, and there's plenty of work to be done around firearms that reside in in-home daycare. What this amendment does is really moves it to restore what's currently in law or where the rules reside. So what this does, it deletes the old repealer, inserts a new repealer, leaving the current firearm regulations in rule. The only family child care regulation that would remain in rule is Minnesota Rule 9502.0435, subparagraph 5. All others would be repealed and later inserted with modified versions into statute. This leaves what currently regulates family child care providers as we work on what the solution is, something that is actually practical and would achieve the stated goals. As it stands today in the language, it does not. And so, Mr. President and Senator Wiklund, I hope you would consider this as a friendly. And Mr. President, I'll wait for Senator Wiklund. Thank you.
Senator Wiklund to the A72 amendment.
Thank you, Mr. President. Senator Coran, I agree. This is an area that has, had a lot of discussion, and we haven't really, I don't think we've gotten to the point of resolving all the concerns and resolving in a way that makes the policy practical. I do think that, my amendment earlier today did remove quite a bit of some of what was contentious. But I guess, if this ends up staying in rule and everything else is put into statute, I'd have some concerns about the workability for providers of that situation, since what we were trying to do is to move everything, modernize the language, and move everything to statute. But since today, I know that we've been working in good faith on trying to come up with the best possible policy language that's workable for providers. I guess for today, I will accept this amendment and hope that we can continue to have the discussion to see if there's a way that we can have everything in statute and not leave one rule outstanding. So I would accept this.
All right, all those in favor of the A72 amendment, the adoption of the A72 amendment, say aye. All those opposed say no. The motion prevails. The A72 is adopted. Senator Coran, for your next amendment.
Thank you, Mr. President. And I'd like to move the A100 amendment.
Senator Coran offers the A100 amendment. The Secretary will report the A100 amendment.
Senator Coran moves to amend Senate File Number 4612 as follows. Page 264, after line 18, insert. This is the A100 amendment.
Senator Coran, to your amendment.
Thank you, Mr. President. What this amendment does is really starts to look at and at least identifies opportunities as it relates to natural medicine. We have a medicinal cannabis program today, for which I'm a big supporter of. What this is around the psilocybin mushrooms, if you want to say, but psilocybin. And what this one does is it looks really to expand on all the health conditions and the opportunities that this medicine has proven, or at least shown, to treat a wide variety of substances, substance use disorder, emerging evidence for PTSD, chronic pain, OCD, eating disorders. And with the movement at the Capitol, President Trump signed an executive order on April 8th to expand in access to psilocybin or psychedelic medicines, expedite review of applications to the FDA and new drug approvals for synthetic pharmaceuticals of versions of psilocybin, and allowing $50 million to support state access programs that contribute to the state-federal partnership about real-world evidence to accept medical uses or accepted medical uses of psychedelics like psilocybin mushrooms. This bill would create a supervised medical program, not broad legalization, not recreational use, and not decriminalization. It would provide access to medical supply, which is tightly controlled to track and trace and tamper-proof packaging, only be accessible to registered patients and registered suppliers. Only Minnesota residents 21 and over would be allowed with an actual real physician making the prescription. All treatment sessions would be done under supervision of licensed medical health professionals and with medical monitoring on site in case of emergencies. Doesn't involve a change in scope of practice for licensed health practitioners working within the program, but remains oversight for addressing complaints and enforcement of the penalties for appropriate, unethical, and illegal behavior. This is not a long-term commitment by the state, but it's really a 3-year program pilot program that will evaluate whether natural psilocybin mushrooms can help alleviate symptoms of qualifying health conditions without causing broader issues to the public health and safety. While allowing those struggling with difficult-to-treat conditions, it would be really the right to try and promising new therapy in a supervised setting. The legislature would evaluate it after 3 years, and if passed, Minnesota would be the 4th state in the country to expand access to psilocybin through state-regulated therapy. When we think about natural medicines and the great promise in the work that's been done so far, with President Trump reclassifying cannabis, that research can move forward, which is wonderful. The psilocybin, I'm not for these synthetic forms of psilocybin, but in our state, the natural form of psilocybin. In addition to, there's a huge movement from ibogaine, again, another psychedelic treatment, which has shown great promise, and has the state of Texas put forth $100 million to help move that medicine through the FDA approval process. Those show great benefit. And so with that, Mr. President, I wanted to bring it up on the floor, and I will withdraw the amendment, but from a conversation perspective, I think it's well worth our time to consider before the final bell tolls on our last day that we consider and find a location for this. It doesn't require any funding. It would require us to apply for the existing funding at the federal level and participate in that program. And so with that, Mr. President, I will withdraw the A100. Thank you, everyone.
The A100 has been withdrawn. Senator Heisman.
Thank you, Mr. President. I'd like to offer the A44.
Senator Heisman offers the A44 amendment. The Secretary will report the A44 amendment.
Senator Heinzman moves to amend Senate File Number 4612 as follows. Page 256, after line 28, insert. This is the A44 amendment.
All right, Senator Heisman.
Thank you, Mr. President. Members, this amendment adds coverage for restorative reproductive medicine. As written, the bill could steer recommended treatments that are most profitable instead of most necessary, that would actually diagnose and treat patients in front of them. Infertility is not often the root problem. It's a symptom, and conditions like endometriosis, polycystic ovary syndrome, hormone imbalances, and blocked fallopian tubes are more often than not the real medical issues. Yet this bill largely bypasses treating those conditions and instead funnels women into a one-size-fits-all approach. Women need and deserve a good diagnosis and treatment. This amendment corrects that and ensures coverage for care that actually investigates and treats the root cause of infertility, and it gives women more options, not fewer. It respects the fact that every patient is different and that there is no single solution that works for everyone. Let's fix this oversight, adopt the amendment, and give couples struggling with infertility the care they deserve. Thank you.
Senator Maye Quade.
Thank you, Mr. Chair. Members, I'm going to urge a no vote for several reasons. The first, as someone who has used infertility treatments, I promise you nothing makes a fertility doctor happier than to find out you have a blocked fallopian tube to fix it. I had dye blown through my fallopian tubes before I tried to conceive my daughter. Second, PCOS, hormone imbalances are all things that are looked at, tested for, and gone through in infertility treatment processes. In fact, Mr. President, more than 70% of infertility treatment is actually information. And so I really, really urge members to vote no, because it is so important that we let individuals and their medical professionals explore their medical options for treatment of infertility. That can include anything from information to medication. I myself had to take thyroid medication, Mr. President, in order to get pregnant, to IUI, IVF. What this amendment would do would be limit what infertility treatment could be, and particularly it focuses on women when men are half of the infertility factor in straight couples. So I urge a no vote and urge you to keep it the way it is. Thank you.
Senator Wiklund.
Mr. President, I rise in opposition to the A44 amendment. I think, for the reasons that my colleague has put forward, as well as I'd like to recognize that this language has not gone through the mandate review process, the 62J process. The language that is in the bill today has gone through that mandate review process, so we wouldn't know costs of possible defrayal costs that are needed. Plus, it looks like it is would be covering medical assistance, and we don't have any cost information about what the impact would be to our medical assistance program. So I urge members to vote no.
Senator Klein.
Mr. President, request a roll call.
Roll call requested, roll call granted. Senator Rasmusson.
Thank you, Mr. President. Would Senator Maye Quade yield for a question?
Senator Maye Quade, will you yield? She will yield. Senator Rasmusson.
Thank you, Mr. President. Thank you, Senator Maye Quade. Senator Maye Quade, I'm looking at the amendment here, and the language clearly states that this would require coverage and make sure that health plans provide coverage for a host of reproductive medicine. And Senator Maye Quade, you said here in debating the amendment and asking members to vote no that this would limit patients' access to reproductive medicine. Could you explain where in the amendment you see that?
Senator Maye Quade, to the question.
Thank you, Mr. President. Senator Rasmusson, what I said, it was limit access to infertility treatments because it outlines specifically what could be covered, but what isn't covered is the treatments then to treat infertility. So that is what this would limit, this amendment. What's already in the bill covers all treatments for all kinds of infertility, regardless of their origin or source.
Senator Rasmusson.
Thank you, Mr. President. And I want to be clear that this amendment doesn't take anything out of the bill. It actually just adds in coverage for restorative reproductive medicine. And so this is going to enhance and expand the coverage that would be available to people who are looking to receive these types of services. And so I can't find anywhere in this language where it would limit what Minnesotans would have access to or health coverage for, and I didn't hear any pointing out of language in the amendment from Senator Maye Quade's response. And so I will be voting yes for this amendment. I appreciate Senator Heinzman offering this so that Minnesota families will have access to restorative reproductive medicine. Thank you, Mr. President.
Any other discussion before we go to the last voice that we'll hear? I want to go to Senator Maye Quade. If you have a follow-up, Senator Maye Quade.
Thank you, Mr. President. And to Senator Rasmussen's previous point, everything that is within this amendment is already covered under what is already in the bill, and then all of the treatments for infertility. So this is both unnecessary and doesn't conform to the process, which I know Senator Rasmussen is very interested in the 62J process, and I believe has never supported an amendment that hasn't gone through that process if it has come to this floor. Today would be a break from that. But it also is new language that would cover different things and cost money. So we already are helping Minnesotans get treatment and diagnosis for infertility, and it covers everything what's already in the bill.
Senator Lucero.
Thank you, Mr. President. Thank you, Senator Heinzman, for offering this amendment. This is a deeply personal issue. It's a topic that far too many couples are wrestling with: infertility. Thank you, Senator Rasmusson, for asking the question, and I appreciate your remarks, Senator Maye Quade. I think you're wrong. I think you're misreading this, and I'm saying that out of all due respect. The Heinzman amendment to the amendment is actually expansive. It's not limiting. It's adding to the options that would be available under the underlying bill. Is this an amendment to the amendment? Just a flat-out amendment, I think.
You are on the A44 amendment.
Amendment, okay. So I'm correcting myself. It's the Heinzman amendment, not an amendment to the amendment. And so as I'm looking at this, just one example, I'm looking at line 1.12 of the amendment. It says treatments such as natural procreative technology. I don't know why, but I have continued to encounter and hear stories from a growing number of couples that are wrestling with this, including myself and my wife. I don't know what the root cause is and why this is an issue that's happening in society. I don't know if it's the food, the diet. I don't know if it's the pharmaceutical industry that's a contributing factor. I don't know what's going on, but something is happening to men and women that is resulting in infertility. And it's increasing. And again, it's deeply personal. It's frustrating. It's hurtful. It's disappointing. It crushes dreams. It crushes bank accounts. Those that are wrestling with this have a really tough time with the process, with the options, having to take mortgages. The continuum of infertility care is not just IVF. It's the end of the continuum, but there are many, many options that are explored by couples leading up to IVF. Why is IVF generally the end of the continuum? Because it is tens of thousands of dollars. It can include weeks or months of injections, pills, preparing the body for the process. And as such, in our case, trying to do it domestically here it's financially prohibitive. So in our experience, we did 2 rounds of it, both unsuccessful. But instead of spending, I think at the time it might have been $40-ish, $50,000, I think, per round, we had to go international to do it. We went to Barbados. And the injections, all of the shots and all of the chemicals that lead up to it are part of the process, we had to purchase from, I think it was Turkey for the second round. I can't remember the first round, because it's cost prohibitive. So again, this is a really tough issue to discuss. And I know everything I just shared isn't necessarily relevant to this, but I'm putting it out there because I'm very appreciative of expanding the options here. And again, I'm appreciative of Senator Heinzman trying to expand. That's why, again, with all due respect, Senator Maye Quade, I'm not sure that you're reading this correctly. Because we want to provide options if we're going to go down this path. If we're going to go down this path of coverage for IVF, we have to take a more expansive view and recognize that the infertility continuum is more broad, and that's what this amendment does. And so since we're going to go down this path, that's why I'm in favor of this amendment. So independent of what happens at the outcome of this amendment or the underlying language in this bill, Mr. President, members, I don't know how in tune you are. Obviously, people that are not wrestling with it may not be as in tuned on this issue. But those that are wrestling with this and those that have wrestled, you know, the ears are sensitive when hearing others that are wrestling with it. And when I see all of the different stuff that's going on throughout society, different ads for this, different ads for that, the term infertility continues to come up, the ears pick up on it, and again, it's increasing. So something is happening, and regardless of what happens with the outcome, we're going to have to deal with this in these conversations.
Senator Lucero, I'm sorry, did you ask me something?
No, but I'm just pausing for a moment.
Okay, thank you.
I'll finish with this. Those that are wrestling with infertility or have experienced the IVF one of the most agonizing times is the period between, I don't want to say operation, but the procedure, and then there's that waiting time to know, first, if there was a successful conception, and then second, if the implantation of the egg in the uterus was successful. Because the procedure has to happen, and then there's several days or a week or two that go by to know if that was even successful. And it's agonizing. And then after the 3 to 6 months leading up to the procedure, then the procedure itself, then having to wait that 1 to 2 weeks after the procedure, agonizing, praying to find the results and it's negative, it's really hard. So just sharing that, I'm with those that, and I understand the struggles of those that are dealing with this. It's an important topic, and if we don't resolve it here, and I'm not convinced that the language is perfect in the bill, but again, we're going to have to deal with this because it continues to become an increasing issue for far too many in our society. So thank you, Mr. President. Thank you, Senator Heinzman, for just letting me share a few thoughts.
Senator Uckey.
Thank you, Mr. President, and thank you, Senator Heinzman, for the A44 amendment and what it does. I was just standing up to clarify some comments that I'd heard earlier on when it talked about the underlying bill and having full coverage. And the part that I was going to point out happens to fall on page 255, where what's in there only is covered by large group health plans. It's a very small, limited number of people. So this amendment does expand and give these additional coverages, which have been just talked about. And, you know, if we want to look at it in a more broad version, definitely support the A44 amendment.
Members, any other discussion on the A44? Senator Mann.
Thank you, Mr. President. This amendment is a terrible amendment for women's health. The language in the bill already covers diagnosis and treatment of infertility. What this amendment does is that it limits the choices that women have to do that, to these very specific things. I also find it very interesting that in this amendment, we have fertility awareness-based methods for family planning, which is a form of birth control. But the people that are going to vote yes on this are going to be the same people who voted no to cover birth control. And lastly, I'm also fascinated by the fact that people will vote yes for this without it going through a 62J process. When we had a bill to cover pap smears for women so they don't die of cervical cancer, and the number one pushback we got from that was it didn't go through the process. But it's okay to take an amendment that limits health care for women and not put it through the process and vote yes on it. So please, members, vote no.
Members, any other discussions? Senator Holmstrom.
Thank you, Mr. Chair and members. I rise because I'm a little confused as we talk about this. The two arguments against it are that it's already included in the bill and that including it in the bill is somehow harmful to women. So it can't be both. Either these treatments are covered or they're not. And because there's that confusion, I have to support this amendment because it should be clear that if we're going to be wading in these waters, we should give young families every single opportunity possible and make sure every avenue is open to them in their search and in their pursuit of having a family, of having children. As many of you know, IVF treatments are contentious. It's not an issue that our society has settled on. We know we want more children, but we haven't honestly wrestled with the bioethical concerns of IVF. This amendment gives those parents who may not feel comfortable, who may have a righteous, moral opposition to IVF and the bioethical concerns of it, an avenue to be covered to explore other options first. And I think that as we, as a society, don't even have answers to these questions yet, we should make sure that we are offering everybody opportunities and avenues that don't have as many bioethical concerns, that maybe don't have the religious and moral implications that IVF does. It seems obvious to me that we should clarify this today, so I ask you all for your support of this amendment, and I thank Senator Heinzman for bringing it forward.
Senator Heinzman, your last voice we'll hear before we vote. Senator Heinzman. Senator Liskey.
Thank you, Mr. President. Mr. President, will Senator Maye Quade yield for a question?
Senator Maye Quade will yield. She will yield. Senator Liskey.
Thank you, Mr. President. Thank you, Senator Maye Quade. I heard you state that a lot of this language would be duplicative, and then I heard Senator Mann say that this would be limiting. I'm still trying to figure out which is it. How is this amendment, based on how I read it, it's adding more coverage, which is kind of surprising. As we heard, we get chastised over whether we want to cover more things or less things and how members vote. And the reality is so here we are offering a more coverage option, and we're getting chastised for past experiences and past votes, and yet we're offering an amendment like the A44 to expand coverage. So can you help me understand, does the current language prior to the amendment cover family planning, possibly fertility coaching, things that don't directly involve the uterus? Because based on my interpretation, this currently only covers uterine health and those types of things.
Senator Maye Quade, to the question.
Thank you, Mr. President. I am so happy to be asked and help answer. So the first thing I'll note is that what is currently in the bill is not related only to uterine-related things. I think that's what was used. It's not uterine-based. It is related to the diagnosis and treatment of infertility, which is a person's failure to establish a pregnancy, carry a pregnancy, but the reasons why somebody can't establish a pregnancy or carry a pregnancy can be related to either the person with the uterus or the person with the sperm, or a person without it. Maybe they had cancer or had an accident. Okay. Second, in the bill, if you look on 255.3, this current section only applies to large group health insurance. And the reason that is, Mr. President, is because we had to spend hundreds of millions of dollars to backfill what the federal government cut, so we couldn't expand it to all health plans, but it's currently related to large group. The amendment that we have before us is all health plans. Now, many people in Minnesota do not have access to infertility treatment through their insurance, and I want to say again that infertility treatment is primarily information. It is very rarely surgical intervention or IVF. But when it is, it's very expensive for the individual. And there are currently health plans in the state of Minnesota that do offer infertility treatment care. But if we add in what is in this amendment, we could run the risk of limiting those health plans to just what is in here. And what is in here is that you can do educational resources on restorative reproductive medicine, which is basically just how to have sex better and have a baby when you do it. That's not going to be the case for every couple who's experiencing infertility. I take the couple where the gentleman had cancer and he no longer has a sperm count. Maybe he froze it, maybe he didn't, maybe they have to use a donor, but there's no amount of counseling where fertility-based awareness methods are going to help them conceive a child. And so what we run the risk of, in addition to the fact that this costs money that we did not budget for in this bill, is that we could have the effect of limiting coverage to health plans in Minnesota that already have more coverage than this. And that is why I'm asking members to vote no.
Senator Liskey.
Thank you, Mr. President. Thank you, Senator Maye Quade, for the answer. I guess I'm trying to understand what the opposition is to, again, increasing coverage. I see how you could imply that maybe this would limit those other plans. I'm still trying to figure out how they would. The amendment, from my reading, wasn't doing that. Obviously, maybe that means the language needs to be improved, but I think the purpose of the amendment was to increase coverage, not just for IVF, but to increase all sorts of family planning and health around infertility. So with that, I urge a yes vote, and maybe we can get that fixed. But I think the subject of and the intent of the amendment is very clear, that we want to include not just IVF and not just necessarily health around the infertility under IVF, but also all forms of infertility. And with that, I urge a green vote.
Senator Heisman, your last voice, then we're voting.
Thank you, Mr. President. I will still urge a green vote because this simply expands the coverage that is covered for those that are suffering with infertility, because not everyone is experiencing the same reason for their infertility, they need to have multiple options. So please vote green.
Mr. President.
Senator Wiklund.
Mr. President, I rise to a point of order. This amendment violates Rule 7.4, Condition 1. It's not, it increases the net appropriations from a fund for without a corresponding increase in net revenue. This would impose costs on our medical assistance program that are unknown. It would impose costs on our Minnesota Care program that are unknown. It also would impose costs on our CGIP program, which are unknown, and then there could also possibly be defrayal costs to the state. And so I rise to a point of order on that basis.
All right. I am looking for fiscal staff. All right. We're going to wait one moment for fiscal staff, and then we'll go from there. After talking to staff and also looking at the rules, the point of order is well taken. We'll now go to Senator McEwen.
Thank you very much,
President.
Mr. President.
I've already recognized Senator McEwen. Senator McEwen.
Thank you very much, Mr. President. Members, I would like to offer the A101 amendment.
Senator McEwen offers the A101. The Secretary will report the A101.
Senator McEwen moves to amend Senate File Number 4612 as follows. Page 253, after line 27, insert. This is the A101 amendment.
Senator McEwen, to your A101 amendment.
Thank you very much, Mr. President. I have been working over the last hour and a half or so with staff. We took the vote that was taken on my previous amendment, the A69, seriously and looked for perhaps a more appropriate place where the amendment that I had previously offered could be placed. So, Mr. President, members, this is in content the same amendment that I had offered earlier. However, we have placed this now in Chapter 144, which I believe is the most appropriate place for it to be. And with that, members, I ask for your support and I stand for questions. And I ask for a roll call.
Senator Rasmusson.
Roll call.
I'm sorry. Senator McEwen, were you finished?
I'm sorry, Mr. President. I would also request a roll call.
Roll call requested. Roll call granted. Senator Rasmusson.
Thank you, Mr. President. I would rise to a point of order under Rule 35.2 and prepared to offer advice.
Offer advice, 35.2.
Thank you, Mr. President. The amendment that Senator McEwen is offering is not germane to the bill, and I'll just restate what I said before. If you look at subdivision 5, it says worker retention and protection. Again, this is about labor requirements and labor regulations. And then if you go and look at subdivision 7, just like I listed in my previous point of order, it talks about collective bargaining agreements. This amendment, when Senator McEwen first offered it, was about labor regulations, and it is still about labor regulations. Just because you find a different chapter to stick it into doesn't change the actual language in the underlying amendment. I'd ask that you find this amendment to be out of order. Thank you, Mr. President.
Last advice, Senator McEwen.
Thank you, Mr. President. In offering advice on this question of germaneness, I would offer to you, Mr. President, that this is the definition of germaneness. I would also point you, Mr. President, to a bill that we had heard previously, the Keeping the Nurses at the Bedside Act. That act similarly had some labor provisions in it. It was geared toward keeping nurses at the bedside. However, that bill had primary jurisdiction in Health and Human Services for good reason, because it really is about the continuum of care, the quality of care, having to do with the conditions within our healthcare centers, as this does also. So while this could have made its way to labor, the primary jurisdiction for this bill is Health and Human Services, and it to the rule of germaneness 35.2, it is substantially of the same subject. It is also the same purpose of the overall bill. So I would ask, Mr. President, that you do find this germane.
Last, before I rule, Senator Rasmusson.
Thank you, Mr. President. Advice. I would just, again, ask for consistency in the rulings when it comes to germaneness, including on this amendment. Thank you, Mr. President.
After getting advice, the point of order is not well taken. Senator Rasmusson.
Thank you, Mr. President. That's disappointing. And if you look at it, and Mr. President,
Senator Rasmusson, if you start arguing, then your appeal to the president is not going to work. Senator Rasmusson.
Thank you, Mr. President. No, I'm not appealing the ruling that you've offered here today, and I heard laughter from the amendment author. And I think, Mr. President, it's unfortunate when it's very clear to me, Mr. President, that there are different germaneness rules depending on what party you're a part of in this body. And, Mr. President, in this amendment, there is nothing that changed substantially in the language. And so, Mr. President, I would ask that you apply that same standard to members of the Republican caucus when we offer amendments on this floor, because that has not been the standard this session. It has not been how our party's been treated when we've offered amendments. And so if you want to have different germaneness rules for the majority party versus the minority party, I recommend you put that in the rules, because it seems like I'm missing an update to mine, Mr. President.
And Senator Rasmusson, I'll be happy, as I do always, I'll be happy to talk to you offline. Senator McEwen, we are on the A101 amendment, and we are ready to vote.
Thank you very much, Mr. President. And I just wanted, for the record, to make sure that Senator Rasmusson and the body know that I had been perhaps laughing. I was just talking to my colleague, Senator Abler, about a different matter, and it in no way was meant to be directed toward the consideration of the body at that time. So I apologize if the timing was not appropriate for having that side conversation. But members, thank you for the discussion. I ask for your support, and thank you.
The Secretary will take the roll on the A101 amendment. Members, please vote. Members, please vote. Senator Hauschild, are you doing the remote voters? Senator Hauschild, those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Carlson votes aye.
Senator Carlson votes aye.
Senator Pa votes aye.
Senator Pa votes aye.
Senator Marty votes aye.
Senator Marty votes aye.
Senator Fate votes aye.
Senator Fate votes aye.
Senator Pappas votes aye.
Senator Pappas votes aye.
Senator Port votes aye.
Senator Port votes aye.
Senator Gustafson votes aye.
Senator Gustafson votes aye.
Senator Putnam votes aye.
And Senator Putnam votes aye. Senator Jasinski, for those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Coleman votes no.
Senator Coleman votes no. All senators having voted who desires to vote, the secretary will close the roll. There have been 35 ayes and 31 nays. The A101 McEwen Amendment is adopted. Senator Lucero.
Thank you, Mr. President. I'd like to offer the A79.
The Secretary will report the amendment.
Senator Lucero moves to amend Senate File Number 4612 as follows. Page 215, line 23, delete end. This is the A79 amendment.
Senator Lucero.
Thank you, Madam President. The A79 would add to the section of the bill on page 215 in regards to HCMC, the accountability section. This would add a requirement that HCMC quarterly report on how much charity care the hospital is providing to illegal immigrants. I would encourage a green vote, and I ask for a roll call.
There will be a roll call. Discussion. Senator Wiklund.
Members, I rise in opposition to the amendment. You know, if it were just asking us to add total spending on charity care as defined, but it's not, and I have no idea what records are kept on, you know, charity care spending. This would be an onerous request, and I ask members to vote no.
Further discussion, Senator Maye Quade.
Thank you, Madam Chair. I would offer an oral amendment to the amendment.
Senator Maye Quade offers an oral amendment. Would you state the amendment so the Secretary can report it?
Thank you, Madam President. On line 1.6 of the amendment, put a period after parenthesis B and delete everything after. And I would request a roll call, Madam President.
The Secretary. Yes, I'm going to say that. I was just going to ask you. There'll be a roll call. Mr. Bodden, do you have the amendment that you can report?
Senator Maye Quade moves to amend the A79 amendment as follows. Page 1, line 6. Delete the second comma and everything following the second comma and insert a period.
Senator Maye Quade.
Thank you, Madam President. That is my amendment to the amendment, and I ask for a green vote.
Further discussion? Seeing none, the Secretary will take the roll. Senator Halstrow?
Thank you, Madam President. Senator Carlson votes aye.
Carlson votes aye.
Senator Pa votes aye.
Senator Pa votes aye.
Senator Marty votes aye.
Senator Marty votes aye.
Senator Port votes aye.
Senator Port votes aye.
Senator Putnam votes aye.
Senator Putnam votes aye.
Senator Kupek votes aye.
Senator Kupek votes aye.
Senator McEwen votes aye.
Senator McEwen votes aye.
And Senator Champion votes aye.
Senator Champion votes aye. Senator Jasinski, we'll wait. Senator Jasinski.
Thank you, Madam President. Senator Coleman votes no.
Coleman votes no. Okay. Secretary will close the roll. There being 34 ayes and 32 nays, the amendment to the amendment is the Maye Quade amendment to the amendment is adopted.
Madam President.
Senator Lucero.
Thank you, Madam President. I'd like to offer an oral amendment to the amendment.
Senator Lucero, if you would state the amendment, I'll have the secretary reported.
Thank you, Madam President. On line 1.6, after paragraph B, insert comma and insert expended on illegal immigrants, period. And I'd like to ask for a roll call after that's reported.
There'll be a roll call. Mr. Secretary, will you report the amendment?
Senator Lucero moves to amend the A79 amendment as follows. On page 1, line 6, after paragraph B, insert comma, expended on illegal immigrants.
Further discussion? Senator Maye Quade.
Thank you, Madam President. I wonder if Senator Lucero would repeat the oral amendment to the amendment.
Senator, I'm going to ask the secretary to do that. Mr. Secretary, will you report again the amendment to the amendment?
Senator Lucero moves to amend the A79 amendment as follows. Page 1, line 6, after paragraph B, insert comma, expended on illegal immigrants.
Senator Maye Quade.
Thank you, Madam President. I'm wondering if I could get this in writing, please.
Your request is granted. You'll receive a written amendment.
Thank you, Madam President.
Madam President.
Members, we are waiting for the request to be fulfilled. And I understand now it will be, it has been, and will be presented to Senator Maye Quade, and copies made. I'm sorry, to Senator Lucero.
Point of order, Madam President.
State your point of order.
Madam President, can I draw your attention to Section 401 of Mason's? Frivolous and improper amendments. Under Section 4, an amendment identical with one previously decided on the same proposal is not in order. I submit to you that the Lucero Amendment undoes what we have previously decided on as a body, and I ask you to rule it out of order.
Madam President, advice.
Thank you for your patience, members. Senator Lucero, if you could offer it, then we could have a more appropriate discussion.
Thank you, Madam President. I'd like to offer the A104 amendment to the amendment.
The Secretary will report the amendment now as written before us.
Senator Lucero moves to amend the Lucero A79 amendment to Senate File Number 4612 as follows. This is the A104 amendment to the amendment.
Senator Lucero.
Thank you, Madam President. Okay, so just for procedure here, Senator Westrom behind me suggested I perhaps have to withdraw my previous oral amendment. So if I need to do that, I would like to do that now. Okay.
Go right
I see
ahead.
a nod from the...
No, yeah, well, I'd like to point out to you that he's not an elected official, and he's not standing where I am, is he? Where is Senator Pratt when I need him? Senator Lucero.
Thank you, Madam President. And I believe you made eye contact with Senator Klein. So if he's going to make a motion, I will perhaps pause and allow him to make the motion.
Senator Klein.
Thank you, Madam President. Thank you, Senator Lucero. I once again draw your consideration to Section 401 of Mason's, subsection 4, and submit to you that this is an amendment identical with one previously decided on the same proposal, and it is not in order.
So, Madam President, advice on that when you're ready.
Go right ahead.
Thank you, Madam President. The previous amendment to the amendment was to delete the words provided to undocumented citizens. My amendment, the A104, is to add the words expended on illegal immigrants. So the previous amendment, the Maye Quade amendment to the amendment, was to delete, mine is to add, and the 4 words that the Maye Quade amendment to the amendment deleted are different than the 4 words I'm adding. Therefore, Madam President, I submit to you that these are not identical. They're far from identical. They are radically different language and amendments. And I would ask you to rule the Klein motion not well taken.
Advice, Madam President.
Senator Rasmusson, and then I'm going to rule.
Thank you, Madam President. I appreciate the opportunity to offer advice. And I would, again, go to Section 401 that Senator Klein mentioned, where it states in Part 4, an amendment identical with one previously decided on the same proposal is not in order. The Lucero amendment is not identical. It is different. And I would also, Madam President, point you to Mason's Section 398, Section 3, where it says, if an amendment is inconsistent with one already adopted, it is not within the power of the presiding officer to rule it out of order. It is a matter for decision by the body. And so, Madam President, I would say that while this amendment may be inconsistent with the amendment that Senator Maye Quade offered, striking similar language, though not identical, I would say this is a question for the body to decide, and would ask you to find the point of order not well taken.
The Klein point of order is well taken.
Madam President, I'd like to make a motion to overrule the ruling of the President, and I would ask for a roll call.
There'll be a roll call.
Madam President, advice to the body.
The question before us is to appeal the decision of the President. A green vote upholds the ruling of the President. A red vote denies it. Senator Rasmusson.
Thank you, Madam President. Advice to the body on this question. I think we're getting confused about the rules here. When we had a member of the majority party offer an amendment that was identical in terms of language, that was allowed to be voted on twice. And now when we have an amendment that is different, that is not identical, and Mason's very clearly says that this is a matter for the decision of the body, this amendment isn't able to be brought forward. And so I'd ask that members vote red to overturn the ruling of the President and make sure that we have consistency here in the Senate. Thank you.
Secretary will take the roll. Senator House-Child.
Thank you, Madam President. Senator Carlson votes aye.
Carlson votes aye.
Senator Pah votes aye.
Senator Pah votes aye.
Senator Marty votes aye.
Senator Marty votes aye.
Senator Port votes aye.
Senator Port votes aye.
Senator Putnam votes aye.
Senator Putnam votes aye.
Senator McEwen votes aye.
Senator McEwen votes aye.
Senator Champion votes aye.
Senator Champion votes aye.
And Senator Clark votes aye.
Senator Clark votes aye. Senator Jasinski.
Thank you, Madam Chair. Senator Coleman votes no.
Senator Coleman votes no. Secretary will close the roll. There being 34 ayes and 32 nays, the decision of the President is upheld. Further discussion on the A79.
Madam President,
Senator Lucero.
I will withdraw the amendment.
I'm sorry, say again, sir? Oh, withdraw the amendment. The amendment is withdrawn. Senator Westrom.
Madam President, I would offer the A78 amendment.
Secretary will Report the amendment.
Senator Westrom moves to amend Senate File Number 4612 as follows. Page 215, after line 4, insert. This is the A78 amendment.
Senator Westrom.
Madam President, I would ask for a roll call.
There will be a roll call.
Madam President, members, I've passed out an article on your desk to help deal with this situation at HCMC and the severe financial distress they are in, asking for taxpayer bailout for their operations to survive. Members, I don't mind helping people out when they're trying hard and they've fallen on tough times and they're a huge benefit to their area and our state. Like you could argue for HCMC when it comes to trauma care and some of the significant serious health care conditions that even rural hospitals end up sending patients to. But members, when they're asking for a bailout from the taxpayers and then operating like they have been with no common sense, with wasteful policies, spending money on things that really aren't core to their mission to be able to serve the Hennepin County medical needs and the rest of the state in the critical access, the critical conditions that hospitals across the state send to HCMC. Let's keep the main thing here. But members, if we're going to give them a bailout with some taxpayer dollars, they're going to have to help themselves first, or this is going to go the wrong way and fleece a lot of taxpayers, waste taxpayer dollars that could do much better things and maybe should be going towards another facility that can focus on health care and not DEI, not social and climate justice, as the recent boards that have been operating this have been mistakenly doing, to the tune of $50 million, as you'll read in this article that's on your desks. The article talks about a doctor without common sense is dangerous to their patient. A hospital run by people without common sense will go broke and quite possibly hurt a lot of people. Go woke, go broke. It's as simple as that. And members, I'm here to tell you that is bad medicine. Bad medicine. Like the Bon Jovi song that says, "Bad medicine is what I need." There's no doctor that can cure my disease. Folks, this kind of bad medicine is not what we need. They could balance most of their budget deficit by getting rid of these DEI programs for the 2026 deficit. A $50 million projected deficit is what the article discusses. And yet there's nothing in this bill, if we're going to give them $150 million, that requires them to help themselves. They just continue with this bad medicine and hope they're going to get better. That ain't going to work. So, Senators, we have some tough medicine. Might not taste the best, but it's going to help cure their disease. And the first step is get rid of the bad medicine, this go woke, go broke mentality that they have adopted at Hennepin County Medical Center. They're on this bad medicine kick, and they want us to kick in more to support their bad habits. and buy them some more bad medicine? No, I don't think so. So members, vote yes. Let's give them tough love, tough medicine that doesn't taste great, but it's going to help cure their disease and get them on the right path, focused on recovery, becoming healthy, and being able to function as a trauma center, as critical medical needs that we need across the state. But if they don't make this turnaround, and they don't have the common sense to do it, we don't need to invest taxpayer money in them. We need to let them solve it themselves and solve our problems elsewhere in the state, because this bad medicine is not going to do it long term. And so I urge a green vote. Let's stop this go woke, go broke mentality that they've displayed at HCMC and give them the ability to get on a healthy track with good medicine. And they got to start by helping themselves first, like any patient in recovery. Vote green.
Thank you, Senator Westrom. Further discussion on the A78. Senator Wiklund.
Thank you, Madam President. I urge members to vote red on this amendment. Vote no. I don't know, there could be a lot of reasons that I can see why this would be a bad idea to add to the bill. I'm not sure that one could make a case that some of these initiatives are helping people, and I don't want to put these conditions on the grant. We already have numerous provisions in here that require reporting. We have, as we discussed earlier, we have goals for the use of the money to, continue the work that they are already doing. We've already stated that they have many specialized functions that we want to see continue, and this amendment would just be get in the way of successfully continuing to meet those goals. So, members, I urge you to vote no.
Yes. Further discussion, Senator Gruenhagen.
Well, thank you, Madam President. Yeah, I rise in support of this amendment. Members, I'd urge you to review the letter that from the Center for the American Experiment that Senator Westrom distributed. I mean, they're spending $10 million on climate resilience. Hey, we need the Hennepin County Medical Center. They are a teaching hospital. They have been a great blessing to our state and our healthcare system. But members, what we see with this DEI is that, this whole idea of where doctors, more and more doctors have become employees of healthcare facilities. And when they do, the next thing you know, we are micromanaging them in terms of the treatment, in terms of the ideas that they have to promote, rather than allowing them to be the professional and the medical doctor that they were trained to be. So I do think when you spend $50 million, which is equal to their current deficit, on these political ideologies rather than on medicine, that there should be a strong admonishment in any taxpayer money that we give to the Hennepin County Medical Center that that money cannot go to the DEI or the Go Woke, Go Broke philosophy. Again, we have infused a political agenda into our healthcare system and micromanaged the doctor, what they think, say, and do, and that only produces bad medicine, in my opinion, not good. And you are limiting the doctors what they can say and do and what they're supposed to be promoting versus addressing the sickness and disease that they have with their patients. So members, I urge a green vote, and let's allow them to use that money for a doctor-patient relationship to treat diseases and healthcare problems that actually exist. Please vote green. Thank you, Madam President.
Further discussion, Senator Holmstrom.
Thank you, Madam President. Members, I urge a green vote on this. Vote yes, because Minnesotans understand how important HCMC is to our state. We understand that in everyone's worst day, in your family member's worst day, we need to have this center open. We need to have these opportunities for health care available to the people of Minnesota. But what we don't need are policies that are targeted at politics being funded with their tax dollars when their tax dollars are already so abused, when their tax dollars are already all they can afford and more. HCMC has recently spent $10 million on climate resilience training. They've planted 70,000 square feet of urban vegetable gardens and taught 27,440 residents about the impacts of clean energy and climate change. That's not what we should be spending tens of millions of dollars of taxpayer money on. If you want to use your corporate profits in those endeavors, I encourage you to waste your money how you see fit. But when you have gone broke, when you have expended your ability to pay your own staff, and you're asking the taxpayer to show up and help you, you need to set your politics aside, have some humility, and understand that if we write the checks, we write the rules. The rules should be that we're not encouraging political speech through taxpayer dollars. Again, I ask you to vote no, and I'll remind you that this is the same system that spent over $7 million last year on their executive staff. They can afford to be adults and do their jobs with health care as the priority and not politics. Thank you.
Further discussion on the A78 amendment? Seeing none, Senator Westrom, did you have a final comment?
Madam President, members, he who pays the fiddler calls the tune. And if we're going to ask the taxpayers to pay the fiddler, here known as HCMC, we're going to wrap it with tough love, but a cure that will get them on the right track and stop this track of DEI, social and climate justice that has become such a big policy that they have spent tens of millions of dollars on at HCMC and continue to, while they are going broke at the expense of all the patients across the state. I repeat, a doctor without common sense is dangerous to their patient. A hospital run by people without common sense will go broke and possibly hurt many people. Their woke climate and social equity agenda at HCMC that is wasting tens of millions of dollars needs to stop first before we give them $1 more million of bailout. As I said, the Bon Jovi song, "Your Love is Like Bad Medicine." Bad medicine is what I need, the lyrics go on to say. And it goes on further to say, there is no doctor that will cure my disease, in those lyrics by Bon Jovi. Shake it up. Yeah, that's what we need to do here, folks. Shake it up, like the bad medicine song. Stop the bad medicine that's being prescribed at HCMC through the DEI programs. Give them medicine that will cure their disease. Even though it's tough therapy, tough recovery, like most medical patients have to go through. You have to get up, take 1 foot at a time, stretch, you experience some pain, and this will be painful, but not nearly as painful as going woke and go broke, which is the path they are on now. Stop the bad medicine at HCMC. Vote yes before we give them any taxpayer dollar bailouts.
Secretary will take the roll on the A78 amendment. Senator Hillschild.
Thank you, Madam President. Senator Carlson votes no.
Senator Carlson votes no.
Senator Pa votes no.
Senator Pa votes no.
Senator Marty votes no.
Senator Marty votes no.
Senator Port votes no.
Senator Port votes no.
Senator McEwen votes no.
Senator McEwen votes no.
Senator Champion votes no.
Senator Champion votes no.
Senator Clark votes no.
Senator Clark votes no.
Senator Dibble votes no.
Senator Dibble votes no.
Senator Latz votes no.
Senator Lance votes no.
Senator Fate votes no.
Senator Fate votes no.
Senator Putnam votes no.
Senator Putnam votes no.
Senator Johnson Stewart votes no.
Senator Johnson Stewart votes no. Senator Jasinski.
Thank you, Madam President. Senator Coleman votes aye.
Senator Coleman votes aye.
And thank you, Madam President. Senator Miller votes aye.
Senator Miller votes aye. The Secretary will close the roll. There being 32 ayes and 34 nays, the motion is not adopted. Further discussion. Senator Heinzman.
Thank you, Madam President. I offer the A102 and request a roll call.
The Secretary will report the amendment, and there will be a roll call.
Senator Heitzman moves to amend Senate File Number 4612 as follows. Page 256, after line 28, insert. This is the A102 amendment.
Senator Heisman.
Thank you. Members, my previous amendment had some opposition due to the language of all health plans. This amendment should be one we can all support. This change in this amendment only applies to all large group healthcare plans except for CGIP. We need to give women and men, it was said that this only is an educational tool for women. It also, if you look at the amendment on line 2.3, identifies male factor infertility as well. Yes, there are men and women that deal with infertility. We should be providing the tools necessary for couples to deal with that infertility, not just IVF treatment, but for all of these treatments as well. Please vote green.
Further discussion on the A102 amendment. Senator Wiklund.
Thank you, Madam President. Again, I would oppose the amendment, although it has been narrowed in terms of the markets it applies to. I believe that the reasons have already been enumerated as to why this amendment is not something that we should add to the bill. The coverage that we have included is comprehensive, and we should leave that language and not adopt this additional language.
Further discussion? Senator Heitzman, did you want to make another comment?
Thank you. The current bill does not include restorative reproductive health. That is a basic health that women deserve access to. Please vote green.
The Secretary will take the roll on the A102 Heitzman amendment. Senator Houschild.
Thank you, Madam Chair. Senator Carlson votes no.
Carlson votes no.
Senator Pa votes no.
Senator Pa votes no.
Senator Marty votes no.
Senator Marty votes no.
Senator Port votes no.
Senator Port votes no.
Senator McEwen votes no.
Senator McEwen votes no.
Senator Champion votes no.
Senator Champion votes no.
Senator Clark votes no.
Senator Clark votes no.
Senator Dibble votes no.
Senator Dibble votes no.
Senator Latz votes no.
Senator Latz votes no.
Senator Fate votes no.
Senator Fate votes no.
Senator Putnam votes no.
Senator Putnam votes no.
And Senator Johnson Stewart votes no.
Senator Johnson Stewart votes no. Senator Jasinski.
Thank you, Madam President. Senator Coleman votes aye.
Senator Coleman votes aye.
And thank you, Madam President. Senator Miller votes aye.
Senator Miller votes aye. Secretary will close the roll. There being 32 ayes and 34 nays, the motion does not prevail and the amendment is not adopted. Further discussion? Is there further discussion on Senate File 4612? The Secretary will give the bill its third reading.
Senate File Number 4612, a bill for an act relating to state government, modifying provisions relating to the Departments of Health, Human Services, and Children, Youth, and Families.
Third reading. Further discussion on Senate File 4612. Senator Abler.
Well, thank you, Madam President and members. I was gone for part of the thing, but I did monitor it while I was gone, and I appreciate the debate. The topic is crucially important, and there's one thing I'd like to mention in the bill, and then I'll offer some comments on the bill at large. And I'm going to just say ahead of time, I wish I could support the bill because I truly support the Hennepin County part that's in there. I'm very happy in our committee we were able to show a strong support for the effort of actually taking cash and putting it into the Hennepin County project and other hospitals which are in grievous peril. Not anything to do with any federal changes, just having to do with the current state of affairs in Minnesota. The federal changes are looming, and that is going to be a real challenge with budgets coming up as well. I will be happy to comment on, or sadly comment on. There are proposals, I think even Madam President, in your committee, about trying to get a sales tax to fund Hennepin County Medical Center. I do not believe those are tenable, but I could be wrong. There's been married 45 years, Madam President. I've been wrong more than once, I've been reminded, when I thought I was in good shape. But I think on this one, I'm in pretty good grounds that for sure the 1% is not going to pass. I don't think it would pass the Senate, and I can't imagine it would come close to passing in the other body. Even the smaller taxes don't really generate enough money, and I think to that topic, and I've mentioned on the floor before when I offered my amendment on the 340B bill, which was related because of hospitals in trouble, I think across the state that people would agree that that Hennepin County, North Memorial, regions, all those hospitals across the state that are facing a disproportionate share of people on state and federal programs are unable to pay the bills. And we can debate how we got there, but the fact is we are here. And I think that even given the looming deficit, that is one place we should dip into the till and spend some money, I think in the range of $300 million, which this bill has. And I was happy that as it left our committee, there was broad agreement on a bipartisan basis about that. And for that, on that part of the bill, Madam President and members, I do wish success that this bill goes to. And I could talk about more things. I will talk about, wouldn't it be nice if we could raise mental health rates for $45 million? Wouldn't it be nice? That's the Beach Boys song, Madam President. If we could help the county SNAP costs to the tune of $271 million, because it's an issue. Wouldn't it be nice if we could have $45 million to, we're Senator Champion, to work on the African American Family Preservation Act, which I support and have supported all the way along. Wouldn't it be nice if we could have $18 million for food shelves and $25 million for the county IT? But Madam President, there is only $25 million of real money in this bill on the savings side. And there's $757 million in general fund spending. And so this bill is a wouldn't it be nice bill. And so in committee, I asked the chair of the committee, I said, is this some of your stuff? No, it's our caucus priorities. And so, Madam President, I appreciate that we know what the priorities of your caucus are and of the DFL, and I don't even fault them specifically. And so it's good you have a way to state your priorities. I don't have a bill to put my priorities in. My priorities would be to help people, the frail elderly, to help people with disabilities, to help keep hospitals open, to make sure that people have access to health care wherever possible, that we would do some reforms to actually reduce health care costs and to keep it more affordable, instead of layering more money into programs that don't work and bringing more people in at costs that are not meeting the expenses. But I don't get a chance to have that bill, Madam President. And so I vote yes on a lot of bills, but I just cannot vote yes on this bill because I don't remember the exact number, Madam President. You probably do remember the exact number. We're something like facing $3 billion in deficit in the upcoming biennium, plus a structural imbalance. And so if it's $3 billion, Madam President, this will add 25% more cost over the next 4 years to that deficit. And the very things that I read off, wouldn't it be nice, are actually going to be put at more risk. And there'll be more hospitals at risk, more programs at risk, more food shelves at risk, more mental health at risk. And at some point, Madam President and members, we have to find a way to understand how to live within our means. The state budget is going up every year in growth, and you know that better than anybody, Madam President. It goes up a few billion, $3 billion a year. If we could get back to the point of living within our means, we actually could protect all the things we think are so important. When I was faced with fighting a deficit of $6 billion, you were here with me, in 2011, I used the standard essential, important, and nice about how I judged. And none of the nice programs weren't nice, good programs that people would appreciate. But at some point when the budget happens, both at the federal, as the deficits face us, at the federal level, where they have lost total control on a bipartisan basis. They have, I don't know how they're even thinking that $39 trillion makes any sense and growing. But at least in Minnesota, as we are forced to balance a budget, we have to find a way to decide what is important to Minnesotans and what's important to them. And so I will recommend the Hennepin County piece and urge all the leaders as we sit down at the end when I don't know how this budget's going to go, that we decide we're going to pay for what's truly important and find a way to get back on a glide path to a sensible budgeting which keeps Minnesota intact and truly, Madam President, the star of the North. Thank you.
Senator Bolden.
Thank you, Madam President. I am going to be voting yes for this bill, but I am not happy about it. I wish we had a different bill. I wish we were able to focus on expanding care for Minnesotans and transforming our healthcare system to one that is centered on care for people instead of profits. But instead, we are doing the work to mitigate the harm that is coming our way from the federal government. And I want to thank Chair Wiklund for all of her work to put together a bill that is in the best shape as we can possibly make it to do that, because Minnesotans need our help. And that's what this bill does. It tries to mitigate some of the harm, it tries to plug some of the holes as the federal government is putting a wrecking ball into our budget and stripping health care from thousands of Minnesotans. Because of H.R. 1, 140,000 Minnesotans are going to lose access to health care coverage. And we are being forced into aligning with what the federal government, has passed in H.R. 1 and the processes they are saying we must align to, or we risk losing $3.3 billion and care for many, many more thousands of Minnesotans. So we do not have a choice in the matter. And so I appreciate the work of this bill to try to mitigate some of that harm. I also appreciate the funding in the bill for food security, which is an increasing crisis. 1 in 5 Minnesotans are food insecure, 20% of people, and that number is increasing. We have seen visits to Minnesota food shelves steadily increase. Last year, there was 9 million visits to food shelves across our state. Because of H.R. 1, $135 million is being lost in SNAP funding for people. So I want us to really think about what this means in Minnesotans' lives. Because of what is happening at the federal level, people will be sicker. They will not be able to seek health care. They will be hungry. It is harming Minnesotans. And so with this bill, trying to plug some of those holes, trying to protect people as best we can, it will help some Minnesotans. I am worried about the folks who are still going to fall through the cracks. And so we have more work to do, but I'm grateful for the work that we can do with this bill, and we'll be voting green. Thank you, Madam President.
Senator Holstrom.
Thank you, Madam President and members. I will be voting no on this bill. It will not be on the merits that there's nothing good in this bill. There are some things that are worth doing. It will be on the merits that we have a 300-page monstrosity in front of us. This bill has a 13-page description of what's in it. There is a 2-page title. This is not how we should legislate. I would ask my fellow members to let us know if they've read all 300 pages of this bill, but I think we know the answer. We asked for reasonable measures to be put in this bill. Taxpayers are being asked to fund the political failings of HCMC. They've spent $50 million blowing it on DEI political speech. They're asking us to cover that bill. We said, okay, we'll stop spending money on politics, just spend money on helping people. We were told no. We said, okay. They said, pay for IVF for everybody. We said, okay, well, we're willing to have that conversation, but we want to make sure that all fertility options are available to young families who are struggling, who might have issues beyond what the bioethical problems are that we can address through IVF. And they said, no, we're not willing to have that conversation either. So this is a bill that has been explained to be a 300-page list of Democrat priorities. I find this to be unconscionable. And I think that if people at home are honest with themselves, they'll find it to be unconscionable too. This isn't how we should be legislating. I ask you to take a stand against it today and vote no.
Further discussion by members before I call on Senator Wiklund. Senator Pratt. Oh, I'm sorry. I had indicated Senator Green first, and then I will call on Senator Pratt. Senator Green.
Thank you, Madam President. Generally don't talk on these bills, but there's some statements made that I think I have to clear up. I just listened to some folks talking about this bill plugging holes. This bill doesn't plug any holes. This bill is like trying to fill a bucket full of holes. The holes were drilled in this by the majority party over the last 3 to 4 years. We had a chance to fix this with $18 billion surplus, but instead we look at daily more evidence of fraud across the state. Nothing was fixed. Nothing was fixed. And now we've got over $700 million that's going to add to the deficit coming up in the next years. And we just keep pouring money into a bucket and we haven't fixed the holes. A child knows you can't fill a bucket that's full of holes. And so really all I got to say, this is not good legislation, and it's not a proper way to legislate. We need to fix problems before we keep spending state taxpayer dollars.
Senator Pratt.
Thank you, Madam President. Sorry about that.
Okay.
You know, it was, I was here in 2013 when we first passed Medicaid expansion. It was a partisan fight. It was bitter. It took a long time. Expansion costs per adult in Minnesota were over $9,800 per person. That's the second highest in the country. We heard a lot about how H.R. 1 was designed to hurt low-income Americans. We heard that families with children were going to lose their coverage. Madam President, that's just not true. Coverage remains if you are employed at least 80 hours a month, 20 hours per week, or you volunteer at that same level. You maintain your coverage if you have children under 14. You also contain coverage if you are in school or in a work program or a combo of any of the above. What we're talking about primarily, Madam President, are able-bodied Minnesotans without children. And yet, we saw Democrats increase the state budget by 40%. They told us they were going to tax only the richest Minnesotans, but we increased the gas tax, which is hurting low-income families. We increased the sales tax in the metro by 1 percentage point, which is hurting low-income families, or hitting them even harder than wealthy families. And now we're hitting the tab fees, and people who are barely making it are having a hard time keeping their car on the road to get to work. Back to health care. You know, Minnesotans overwhelmingly support the idea of a work requirement. 71% in one of the recent polls that I saw. Madam President, Minnesotans and Americans are compassionate people. We want to help people out of poverty. We just want them to help themselves.
Further discussion before I call on Senator Wiklund? Senator Murphy.
Thank you, Madam President and members. I want to begin by thanking Senator Wiklund and the members of the Health and Human Services Committee for putting together a very important proposal during a very challenging time because of what the federal government has delivered to Minnesota in H.R. 1. And we're already seeing the impacts of H.R. 1 on HCMC and in this budget, and those impacts are going to last for another decade or so. And we've got a real problem. I wouldn't call it a bucket with holes. We just have a real problem, and we're going to have to reckon with it if we want Minnesotans to have health care across the state of Minnesota. But I want to respond to something that the former speaker had to say about 2013 and the expansion of medical assistance that actually happened as the result of work that happened in the prior year and a half, when a former governor line item vetoed the entire general assistance medical care program, the entire thing. The then Commissioner of Human Services, Cal Ludeman, of course many of us know Cal Ludeman because he went on to be the secretary of this body, called that population the poorest of the poor, the sickest of the sick. And the reason why we were able to fund a replacement for that cruel veto of then Governor Pawlenty was because Minnesotans said those people deserve care. They were veterans who did not have access to the VA. They were people with chronic mental illness, people with chronic physical illness, people with substance abuse disorder, people who were living without shelter. And they were here at the Capitol. They were here and they were testifying. So this argument that people in this population are able-bodied and they should just go back to work is false. It was false then, and Minnesotans said, no way are we going to let them go without. And it's false now. It's false. And I am grateful for the language that was put into this bill to make sure that we are doing all we can, including removing the harmful work requirement if we have the opportunity to do it, because what it is going to mean is less coverage for people. I was there when it happened. I was not new. And it might have been bitter for you, but it wasn't bitter for me. Please vote yes.
Senator Wiklund.
Thank you, Madam President. I appreciate the discussion today. It's been a good discussion. I think we've heard and learned more about what the projected impacts are of H.R. 1 on our state. This bill, to me, represents a practical and a real way to address these concerns. And it does so by, we are reacting to stresses that we prefer not to be facing. We are addressing immediate risks. We are doing in the short term what we can to protect essential services. And we're trying to live up to our values, which is that people should have access to health care. They shouldn't be denied access to health care because they weren't able to submit documentation on time. This bill, it provides support to help our hospitals. We know that hospitals across the state are hurting. It's already being felt in places all across our state. I had a handout distributed about a hospital, Riverview Health in Crookston. Back in January, they discontinued home health care because of the impending lack of resources due to the H.R. 1 impacts. This is going to be felt across our state. We need to do what we can this year with the resources we have available this year to address these needs. We also fund IT systems modernization work that the counties feel is essential. It's essential to begin this work this year so the workload doesn't dramatically increase. Labor costs will increase dramatically as well, and that burden will be felt by property tax payers. We also are substantially addressing food insecurity that would be felt if the federal government's cuts to SNAP were to be put in place. So I feel that we've done the best we can to address really important needs in our state at this time, and I hope that you can support the bill. Before I close, I would like to say that a bill like this is the result of a lot of work by a lot of people, and I want to thank my staff Anna Burke, and Haley Ryan. I'm sorry, I'm emotional.
Take your time.
Our dedicated fiscal staff, fiscal analyst Dennis Vessel, our council. We have to have 3 for my committee: Erica Heichel, Allie Hoffman-Litchie, and Nolan Hodala. Our dedicated researchers, Emily Spiteri and Bryce Hinkst. Thank you all so much for the work that goes into a bill like this. So, members, I would appreciate your support today, and I'm really happy that I'm able to present this bill today on the floor. Thank you.
Secretary will take the roll. I don't see Senator Housechild in the, okay, thank you very much. I see now Senator Bolden has her hand raised. Senator Bolden, on behalf of the remote voters.
Thank you, Madam President. Senator Carlson votes aye.
Senator Carlson votes aye.
Senator Pa votes aye.
Senator Pa votes aye.
Senator Marty votes aye.
Senator Marty votes aye.
Senator Port votes aye.
Senator Port votes aye.
Senator McEwen votes aye.
Senator McEwen votes aye.
Senator Champion votes aye.
Senator Champion votes aye.
Senator Clark votes aye.
Senator Clark votes aye.
Senator Dibble votes aye.
Senator Dibble votes aye.
Senator Latz votes aye.
Senator Latz votes aye.
Senator Fate votes aye.
Senator Fate votes aye.
And Senator Housechild votes aye.
Senator Housechild votes aye. Senator Jasinski in a moment. Senator Jasinski.
Thank you, Madam President. Senator Coleman votes no.
Senator Coleman votes no.
Senator Miller votes no.
Senator Miller votes no. The Secretary will close the roll. There being 34 ayes and 32 nays, the bill is passed and its title agreed to. The next bill on special orders is House File 4188. Senator Klein.
Thank you, Madam President. And before I introduce the bill, I wonder if I could offer the A1 amendment.
The Secretary will report the amendment.
Senator Klein moves to amend House File number 4188 as amended pursuant to Rule 45 as follows. Page 17, line 24, delete of commerce. This is the A1 amendment.
Senator Klein. Senator Klein.
Madam President, this will put the bill into Senate language and will also make some semantic changes that are in front of the body in the A1.
Discussion on the A1 amendment. Seeing none, all those in favor, please say aye.
Aye.
Opposed, say no. The motion prevails and the amendment is adopted.
Madam President, thank you, body, for considering Senate File 4365 or House File 4188 that is in front of us. In the Finance Committee, the finance elements of this bill have been taken out, so this is a purely policy bill in front of us, and I'll briefly walk through its major provisions. There is technical and non-controversial language from the department that passed through our committee without objection or concern, and I'm glad to speak to those items individually if there are questions from the body. There are individual and bipartisan legislative initiatives included in this bill. Section 10 is a Senator Maye Quade provision that requires that utilization review organizations cannot use artificial intelligence to make an adverse determination for coverage of benefits. Section 12 is a Senator Bolden provision that requires coverage requirements for home care nursing services by prohibiting health plans from imposing quantity limits on such services. I know many of our constituents with severely disabled children and family members have written us in support of that provision. In Article 4, Section 1, Senator Duckworth has a trusted contact program for banking to protect our seniors. Section 3 is a Senator Hemmingson-Yager provision prohibiting virtual currency kiosks. Section 6 is a Senator Maye Quade provision prohibiting nudification. Section 7 is a Senator Draheim provision that prohibits in the state of Minnesota pharmaceutical advertising direct to consumer. Section 11 is a Senator Dibble provision that prohibits the sale of dogs and cats with some stores grandfathered in. Section 13 is Senator Maye Quade's prohibition on minor access to chatbots. Article 6 is a Senator Rasmusson bill, which he worked on extensively, modernizing language around telecommunications and that industry. And then, Madam President, Section 35 is Senator Duckworth's provision on meat raffles. And the Section 36 is the 340B language that we have already passed off this Senate floor. So that is the bill in brief, members, and I'm open to questions or amendments.
Amendments, Senator Dames.
Well, thank you, Madam Chair. I just wanted to offer the A6 amendment, which will be dealing with reinsurance. And just give you a little background. We've had reinsurance now since, I believe it was 2018 was the first year that it went into effect. It's worked very well. It's been one of the things that has worked well, both with the majority being Republican and the majority being Democrat. Just this past year in 2025, the department made the evaluation that the reinsurance saved 47% in cost of premium. If we didn't have reinsurance in 2025, the cost of premiums in the individual market would have went up about 47%. Amazingly enough, this is not in the bill to be renewed for future years. As of now, the reinsurance is set to run through 2027. The A6 amendment would change that so there would be a continuous, the reinsurance would be continuous, and the parts of reinsurance would also continue. One of those pieces that would continue would be the assessment to the insurance providers for the cost of reinsurance. The amount of the blink on would start at $50,000, the same as it is now, and go to $250,000, the same as it is now. And the assessments would be picking up 80% of that. The Minnesota Comprehensive Health Association, that association would still be responsible for the reinsurance. They would be responsible to work with the providers to collect the to collect the amount they'd have to have for the assessments. And so the reason I'm bringing the A6 forward is hopefully we can get the votes to put this on this bill so that we have reinsurance in the future and we know where it's going to be, know how it's going to be paid for. And so with that said, I'd ask for a green vote on the A6 amendment to move the reinsurance to this bill.
Secretary needs to report the amendment first.
Senator Dames moved to amend House File Number 4188 as amended pursuant to Rule 45 as follows. Page 5, delete Section 2 and insert. This is the A6 amendment.
Senator Dames, did you want a roll call? There'll be a roll call. Further discussion of the Dames amendment? Senator Wiklund.
Thank you, Madam President. I rise in opposition to the Dames Amendment. There are quite a few reasons that I can think of that we shouldn't be passing a reinsurance bill this year, and we should let the legislature that comes back next year, let them do their work to analyze and assess what would be best to go forward with. We already have taken care of next year. And some of the key reasons that I don't support this being added to the bill today is that we don't know what the market is going to look like next year. The current program is authorized for another year. We don't have to take action on this today. It isn't urgent. With impacts from H.R. 1, as we have discussed, and my colleagues have expressed concerns about the individual market and how many people will be not participating in the individual market anymore. The failure to extend the enhanced federal tax credits is still having an impact, and it won't be possible to assess the impact until late in the year. The enrollment in the individual market and the risk mix in the market, it could change significantly by next session. We shouldn't set this program on autopilot. We shouldn't put it any closer to being on autopilot until we have that fuller picture. The best policy solutions that we might come up with might be different than what we have today. So we know that the program costs have grown significantly over time, and we need to have the legislature that is in place next session needs to do the analysis of whether spending additional general fund money is the way that we want to proceed, or do we want to look at any other policy solutions. This reinsurance hasn't been a panacea for us. We have had to contribute significant general fund allocations to it, and it's just not, it doesn't make good sense to put this amendment on Senator Klein's Commerce Bill this session. Next year's legislature or legislators should have that opportunity to reevaluate and decide what is best to address concerns in the individual market and look at the big picture. So I urge members to vote no.
Further discussion, Senator Gruenhagen.
Well, thank you, Madam President. Yeah, I rise in support of this amendment for several reasons. Some of them were stated by Senator Dames, but I would add a couple of comments. A little over a year ago, I was invited by the Minnesota Hospital Association to a Zoom meeting with 4 outstate hospitals and 2 in-state hospitals. And one of the reasons we want to keep the private market a little bit more reasonable on premiums, if we didn't have the reinsurance, premiums would jump 30, 40%. And on top of that, the reimbursement rate of private insurance is much greater than government programs. And members, this is what we have to understand. When I was on the Zoom meeting with those 6 hospitals, 2 metro, 4 outstate, they all said the same thing, that when they have a patient come in on Medicaid or Minnesota Care, for every $2 of expenses, they get reimbursed about $1. So they lose money, okay, on Medicaid and Minnesota Care. On Medicare, they get about $1.50 average for every $2 of expenses. So they still lose money, but not as much. On private insurance, they get on average $2.50. So they actually make money. The problem with our healthcare system, or one of the main problems, is you're getting more and more government reimbursement where they're losing money and less private insurance. And the reinsurance bill guarantees or to some degree, that we will have a private insurance market, both in group and individual. The other thing to understand, members, is this, is that hospitals and doctors have always lost money on government reimbursement historically, all right? And they've made it up by cost shifting to the private insurance. And when we had 77 million baby boomers in the workforce, and fewer people on government insurance, it worked pretty well. You still had premium increases, 10 to 15% or 8 to 10%, but they were more manageable. Today, we have the baby boomers retiring, they're on Medicare, hospitals are losing money on reimbursement for their health care, and we have a growing number of individuals on Medicaid and Minnesota Care, where they're also losing money. So part of and of course, what do the hospitals do? They cost shift to the 340B plan to try to make up the money that they're losing on the government health care plans. I mean, or they cut back on staffing, and now we have the nurses want a nurse ratio for patients, or they don't admit a patient. So you see what's happening, members? The more and more government reimbursement, the more and more shortages that our healthcare system has. The reinsurance plan will at least give some measure of stability to the private market. So we should adopt this measure or amendment for the sake of our healthcare system. If you want to see less hospitals and clinics close and at a better reimbursement rate from the private market. The other thing I would just share is that I lost my train of thought. Okay, that's probably enough. Okay, vote green for healthcare stability, members, okay? And a decent reimbursement rate for your doctors and hospitals. It won't solve all our problems, but it is a step in the right direction. Oh, I remember. What the reinsurance plan does at $50,000 of loss to $250,000, it steps in for the insurance companies and pays 80% of the cost. So it tempers the amount of claims and ultimately tempers the rate increases in the private and small group market. So members, please vote green on this amendment. Thank you, Mr. President.
Thank you, Senator. Any other discussion on the A6 amendment? Any other discussions on the A6? If none, we're going to the author of the amendment, Senator Dames, for the last voice you will hear before we vote. Senator Dames.
Well, thank you, Mr. Chair, and thank you for your comments, Senator Wiklund. I do appreciate it. There always are differences of opinion, and but I'm going to let the facts speak for themselves. If we take a look at, like I said, when this was implemented in 2018, it done everything it was supposed to do and everything we thought it would do, and actually more. And we're seeing, if we follow that every year, we see that it's worked better and smoother. It was quite interesting because some of the Democrats at the national basis tried to get this to be one of their national platforms for reinsurance is one of their national platforms for health insurance. The program has worked very well every year, and like I said, we got through 2025 and we actually had a 47% reduction in premium because of it. And I think it's time that we put this in on a continuous basis. There's always reasons that you shouldn't and always reasons that you could and should, but I'd appreciate a green vote so we get this done and have this set so that in the future we know where we're at, and changes can always be made. If something goes wrong, we can always make some changes. Thank you, members.
Thank you, Senator Dames. The Secretary will take the roll on the A6 Dames Amendment. Members, please vote. Senator Jasinski, for those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Coleman votes aye.
Senator Coleman votes aye.
And thank you, Mr. President. Senator Miller votes aye.
Senator Miller votes aye. Senator Hochschild, those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Carlson votes no.
Senator Carlson votes no.
Senator Pa votes no.
Senator Pa votes no.
Senator Marty votes no.
Senator Marty votes no.
Senator McEwen votes no.
Senator McEwen votes no.
Senator Clark votes no.
Senator Clark votes no.
Senator Dibble votes no.
Senator Dibble votes no.
Senator Latz votes no.
Senator Latz votes no.
Senator Fate votes no.
Senator Fate votes no.
Senator Gustafson votes no.
And Senator Gustafson votes no. Senator Housley, are you going to vote? All senators having voted who desires to vote, the secretary will close the roll. There being 29 ayes and 37 nays, the A6 amendment is not adopted. Senator Dames, it's my understanding you have another amendment. Senator Dames.
Well, thank you, Mr. Chair, and I have the A4 amendment.
Senator Dames offers the A4 amendment. The secretary will report the A4 amendment.
Senator Dames moves to amend House File Number 4188 as amended pursuant to Rule 45 as follows. Page 9, delete Section 4. This is the A4 amendment.
Senator Dames, to your A4 amendment.
Well, thank you, Mr. Chair. And the reason that I'm having this amendment is to delete, on page 9, delete Section 4. What Section 4 does is it allows people that have a Medicare supplement, and let's say that their company goes broke or goes out of business or goes insolvent, they would have the option to purchase a Medicare supplement from another carrier at any point in time after that person went insolvency, even if it was out of the 6-month period where they could select insurance. Also, what was added to this is that they could buy the extended plan, and they would be able to do that without having priorly had an extended plan, and they could do it without underwriting. And so this has caused quite a concern, because if we're going to bring these people in and they can go from the basic plan that they may have had and go to a basic plus an extended plan without underwriting, it's going to drive the cost. So with that, I'd like to have this stricken so that we don't drive these costs up. We're going to have a lot of issues in the future with health insurance, and so I don't think we need to be adding things now to drive the costs that we don't need to do. So I'd ask for a green vote.
Thank you, Senator Dames. Senator Klein.
Thank you, Mr. President. I request a roll call.
Roll call requested, roll call granted. Any other discussion on the Dames amendment? Senator Klein.
Thank you, Mr. President. Members, the specific language that's being deleted, the new language, is on page 15 of the bill. And you can see that that is targeted to a very small population, people whose plans were terminated in the year of 2025. And so these are specifically people who were on UCare when that entity unfortunately went bankrupt and now need to shop around and find an alternative Medicare supplemental plan. We thought we would give them a safe landing. This is an important provision for a modest population of people, and we're going to ensure that they have access to Medicare supplemental plans through no fault of their own, which they lost. Members, please vote no, red on the amendment.
Senator Wiklund. Nothing? Okay. Any other discussion before I go to the author of the amendment before we vote? Seeing none, Senator Dames, to your A4 amendment.
Well, thank you, Mr. Chair. And the reason I'd ask for a green vote on this is currently, under current law, if a company goes insolvent or goes broke, the people that had a policy with them can buy the basic plan back. So they're not being shut out of the marketplace. They're just being given an opportunity to purchase things that they didn't previously have. And that is where the issue is in driving the cost. So I'd encourage a green vote.
A roll call was requested and a roll call was granted. The secretary will take the roll on the A4 Dames amendment. Members, please vote so we can move expeditiously. Senator Hushaw, for those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Carlson votes no.
Senator Carlson votes no.
Senator Pa votes no.
Senator Pa votes no.
Senator Marty votes no.
Senator Marty votes no.
Senator McEwen votes no.
Senator McEwen votes no.
Senator Clark votes no.
Senator Clark votes no.
Senator Dibble votes no.
Senator Dibble votes no.
Senator Latz votes no.
Senator Latz votes no.
Senator Fate votes no.
Senator Fate votes no.
And Senator Gustafson votes no.
And Senator Gustafson votes no. Senator Jasinski, for those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Coleman votes aye.
Senator Coleman votes aye. All senators having voted who desires to vote, the secretary will close the roll. There being 30 ayes and 35 nays, the A4 Dames Amendment is not adopted. Senator Dames, it's my understanding you have one more amendment.
Thank you, Mr. Chair. I have the A5 amendment.
Senator Dames offers the A5 amendment. The secretary will report the A5 amendment.
Senator Dames moves to amend House File 4188 as amended pursuant to Rule 45 as follows. Page 24 after line 26, insert. This is Amendment A-5.
Senator Dames, to your A5 amendment.
Well, thank you, Mr. Chair. And the A5 amendment, it extends out the implementation until August 1st of 2028 from August 1st of 2026. What this amounts to is in 23, when Minnesota passed it, they'd have open enrollment for people at beyond the normal 6-month period, which was currently required. There was some concerns about the cost of doing this. And so in 2024, it didn't get implemented, but what they did do is they put together a group of folks to deal with the department to come up with some ideas. One of the things, or what they came up with, is some premium increases for the people who would exercise this right. And they found that in 2025, when they were going to implement that, they found that they realized that it was going to be a very costly process as far as premium, and it would drive the premiums up. And again, they would have an issue with people that would be transferring that hadn't had any underwriting applied to their transfers. So it was delayed in 2025 and moved to 2026, and still we're in the same position to where it's not going to be helping anybody other than they're going to pay an assessment in order to make that move, and it goes anywhere from 15% increase in premium to 35% increase in premium. And the concern is that it's going to, again, drive the premiums up in the marketplace. And so we're just asking to delay this for 2 more years to make sure we get this right so that we don't be driving these premiums up and putting people in positions to where some of the insurance they need isn't going to be purchasable because of price. So I'd appreciate a green vote.
Senator Klein, to the A5 Dames Amendment.
Thank you, Mr. President. I request a roll call.
Roll call requested, roll call granted. Senator Klein.
Mr. President, Senator Dames has accurately described the history of this provision. If you have neighbors or family members who are on Medicare Advantage who want to go to a Medicare supplemental plan, you will find that they are quite concerned about how that is possible to do. And when we opened it up to all age groups 3 years ago with no pre-existing conditions, there were concerns raised by the Department of Commerce that would escalate premiums dramatically in this market. We studied it for a couple of years. Last year, in a bipartisan way, we came to a compromise which did expand opportunities to enter the Medicare supplemental market up to age 70. It created some penalties to slow down that transition. And that was the deal that we reached to balance the concerns of seniors who want to move from Medicare Advantage to Medicare supplemental plans and plan stability, which we as a legislature are responsible for. I stand by the compromise that we made last year. The Dames Amendment would wipe it out altogether and create no opportunities for people to move to Medicare supplemental plans, deeply opposed by the American Association of Retired Persons and other organizations, and I urge a red vote.
Any other discussion before we go to the author of the amendment before we vote? Seeing none, Senator Dames, to your A5 amendment.
Well, thank you, Mr. President, and I want to make one clarification here. It would not wipe it out altogether. It would just extend the date out till 2028.
Thank you. Now, we will, the secretary will take the roll on on the vote for the A5 amendment. Please vote. Senator Hochschild, for those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Carlson votes no.
Senator Carlson votes no.
Senator Pa votes no.
Senator Pa votes no.
Senator Marty votes no.
Senator Marty votes no.
Senator McEwen votes no.
Senator McEwen votes no.
Senator Clark votes no.
Senator Clark votes no.
Senator Dibble votes no.
Senator Dibble votes no.
Senator Latz votes no.
Senator Latz votes no.
Senator Fate votes no.
Senator Fate votes no.
And Senator Gustafson votes no.
And Senator Gustafson votes no. Senator Jasinski, for those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Coleman votes aye.
Senator Coleman votes aye. All senators having voted who desire to vote, the secretary will close the roll. There have been 30 ayes and 34 nays. The A5 Dames Amendment is not adopted. Senator Rasmusson.
Thank you, Mr. President. I will offer the A7 amendment.
Senator Rasmusson offers the A7 amendment. The secretary will report the A7 amendment.
Senator Rasmusson moves to amend House File 4188 as amended pursuant to Rule 45 as follows. Page 64, lines 5 and 16. This is Amendment A-7.
Senator Rasmusson, to your A7 amendment.
Thank you, Mr. President. Senator Seeberger has a provision in the bill in Article 7 that relates to virtual currency custody services for credit unions here in the state of Minnesota. In committee, we had a discussion around whether you would have the credit unions serve as a custodian or a fiduciary, and the amendment before the body would clarify that the credit unions would act in a custodial capacity for the virtual currency. I've talked about this with the credit unions, and they are fine with this clarification and would hope that this will be a friendly amendment. Thank you, Mr. President.
Senator Klein, to the A7 amendment.
Mr. President, Senator Rasmussen, the amendment is friendly.
Any other discussion on the Rasmusson A7 amendment? Seeing none, all those in favor of adoption say aye. All those opposed say no. The motion prevails and the A7 is adopted. I'm now going to Senator Grutenhagen.
Oh, thank you, Mr. President. Yeah, I have the A8 amendment.
Senator Grutenhagen offers the A8 amendment. The secretary will report the A8 amendment.
Senator Gruenhagen moves to amend House File 4188 as amended pursuant to Rule 45 as follows. Page 17 after line 30, insert. This is Amendment A-8.
Senator Gruenhagen, to your A8 amendment.
Oh, thank you, Mr. President. Members, I consider this a very, very important amendment in regards to individual health insurance, all right? I just want to give a couple examples here of what we're facing. Not only high premiums and high deductibles, but I had 2 public school teachers stop in to my office and explain the crisis in healthcare that they're facing on the group side. I'll share with you their information. In the last 3 years on a family plan, the premium went up $6,650 for a 3-year period. So the total family plan premium right now for the public school teacher is $22,196, members, okay? If you take a higher deductible, the premium went up $5,121 in the last 3 years. Their total annual premium is now $15,380. Now, both of the public school teachers, one was elementary, one was middle school, said that the premium increases that they're experiencing this year is not only eliminating their raise on their salary, they're actually going backwards. And both of them said the same thing. If something doesn't change, we're quitting education. And I think that would be a travesty. They both seem conscientious and wanting to do what's best for the children. Secondly, we have this huge bureaucracy to micromanage the doctor-patient relationship. And what I mean by that, we created this huge federal bureaucracy a number of years ago. The state created a huge bureaucracy to deal with the federal bureaucracy. And then the insurance companies and the hospitals created huge bureaucracies to deal with the state and federal bureaucracy, all in the effort to micromanage the doctor-patient relationship. The result is you now have non-doctor bureaucrats deciding if, when, and how much health care you get. Now, I have a personal experience in my insurance agency. One of my agents started limping around in the office, and pretty soon the pain got so much in his knee that he decided to go to the doctor. Well, when he went to the doctor, they discovered that he had a torn meniscus. And so the doctor said, you need surgery on that. Well, they submitted it to the insurance company, and the result was the insurance company denied it. So a week or 10 days later, the pain got even worse, so he went back to the doctor. They submitted it a second time to the bureaucracy. And the result was they denied the surgery again. So about a week to 10 days later, he could hardly walk. He said, I gotta go to the doctor. So he goes to the doctor, and between him and the doctor, they submit it the third time, and he finally got approved for knee surgery for his meniscus. Think of that, members. It wasn't the doctor and the patient. It was this bureaucracy deciding if, when, and how much health care you get. On top of that, the networks are narrowing. You got fewer and fewer choices as far as your health care access is concerned. So what my amendment does, it changes the dynamic. You become in charge of your health care, and you select the provider of your choice. Now, this has been, this idea came from a committee that I was on of both active and retired doctors, including insurance individuals. And they're trying to empower the patient. So you don't need a bureaucrat telling you if, when, and how much health care you could get. You can go to the doctor of your choice. So members, I would ask that this could be added to the Commerce Omnibus Bill. I've talked to some of you and shown you the bureaucracy, but it's vitally important that we address this. I think we need an ongoing conversation because I explained to you before on a previous amendment the vital need for private insurance. It reimburses at $2.50 on average for every $2 of expenses. Hospitals and doctors lose money on government reimbursement. So we need to empower the patient. Finally, I know many of you, especially on the floor here, are concerned about the abuse of executives in the health insurance industry, all right? And what you have to understand, the bureaucracy allows the executives to milk the healthcare system for their own financial benefit. So I had one person tell me that one executive here in the state got an over $80 million bonus. If you don't want that to happen, then you want to support this amendment so that people are empowered, they get the health care they need, and the doctor is not micromanaged by a bureaucracy. The last two things I'll share is that we have a study out there you can find on the internet. By 2030, we're going to be 2,260 doctors short in the healthcare system of Minnesota. Members, I'll say that again. We're going to be according to this study, we're going to be 2,260 doctors short. Now, the Star Tribune a few years ago, and I cut the article out, did a survey of doctors, and what they found, how many of them were satisfied with the current micromanagement by the bureaucracies, or they were getting burned out. And according to their study, 51% of the doctors were burnt out on the system because they're being micromanaged by the bureaucracy. So members, we need to empower patients. We need to empower the doctor and the patient. Let the patient seek the care he needs. I think you're going to see a 20% to 30% reduction in premiums, and also as far as deductibles. There is a mandate. It's just an option that insurance companies would have to offer. They'd still offer the other plans. The other thing, it conforms to no underwriting and the underwriting of Obamacare. So there's no problem there. So members, I ask for a green vote. And we've got to try some experiments on this because the current system is not sustainable. Thank you, Mr. President, and please vote green, and I ask for a roll call.
Roll call requested, roll call granted. Senator Klein.
Thank you, Mr. President, and thank you, Senator Gruenhagen, for each of the last 4 years offering an amendment on reference-based pricing, and each time approaching me personally to try to explain why it is important and why it is an option in our current healthcare delivery market. I acknowledge the correctness of Senator Gruenhagen's concern that healthcare costs for everybody are way out of control, and I honor the fact that he comes forward with solutions every single year. Once again, this year, I will be voting no on reference-based pricing. I think it is not a workable solution to the complexities that we have in our healthcare delivery system, and it would destabilize our current delivery system and create accessibility issues for Minnesotans. So I will be a no. This is my 4th year working with Senator Gruenhagen on this, and members are certainly free to vote how they personally feel on this issue. The chair will be a no.
Senator Liskey.
Thank you, Mr. President. Mr. President, I, as well as Senator Klein, have been working hard on this with Senator Gruenhagen every year I've been here. It was an interesting topic I heard back in my first year, and I connected with it because it's an elegant or interesting way to approach healthcare and healthcare costs. We have an issue, right? I sit on Health and Human Services with some great colleagues, and we complain about the same things. The cost of healthcare are going up. Health insurance costs are going up. Health insurance seems to be the bad guy a lot of times with their contracts, with their prior authorizations. I was and have been a co-author on the prior authorization elimination bill. This reference-based pricing approach, as Senator Gruenhagen was talking about, will not be the only option. It is a mandate to be offered, and for a roundabout way, it would be like a pilot program. Not everybody would switch to this program. Not everybody would be required to have this. It would be an option. It would be a mandated option, so the insurance companies have to offer it. But with that being said, you would still be able to choose on the private market whether you entered this contract or not. And so I hope that we've, interested a lot of parties as we listen to what it is, because without changing the healthcare system as we are now, without maybe destabilizing the system we currently have, we will never have change. And so without that change, without that option to be able to see what the change would look like, we will be facing the same argument next year and the year after that. So with that, I urge a green vote just for the discussion, just for the chance to see what a new option would look like. Thank you.
Senator Friends.
Thank you, Mr. President. Thank you, Senator Gruenhagen. I share Senator Klein's support for you looking at new ideas, but I have a question, Mr. President. Would Senator Gruenhagen yield for a question?
Senator Gruenhagen, will you yield? He will yield. Senator Friends.
Thank you, Mr. President. Senator Gruenhagen, did I understand you to say there would be no underwriting in this option? And if so, would you not be concerned that everyone who's really sick would go into one of these plans and the next month rack up hundreds of thousands of dollars of care? Thank you, Mr. President. Thank you,
Senator
Senator
Gruenhagen,
Gruenhagen.
specifically to the question. Senator Gruenhagen.
Oh, thank you, Mr. President. Thank you for that question, Senator Friends. The thing is, we can't change the federal laws in regard to Obamacare as far as the individual market. So we can't have underwriting. It would have to conform to the Affordable Care Act, which I call the Unaffordable Care Act, unfortunately. But those are federal statutes, and that would have to change at the federal level to open that up. But I do think it would give an additional option for people to secure health care that they are in charge of rather than this bureaucracy. I hope that answers your question.
Senator Friends, any other discussion before we go to the author of the amendment before we vote? Seeing none, Senator Gruenhagen, you are the last voice we will hear before we vote. Senator Gruenhagen.
All right. Thank you, Mr. President. Thanks for the discussion. Members, I do believe there's solutions. Again, this idea came out of a group of retired and active doctors, most of whom were sick of being micromanaged by this huge bureaucracy. Again, the bureaucracy, in many cases, milks the healthcare system. We know the abuse that we see in terms of bonuses to some insurance executives and hospital CEOs. I could give you more examples on that. If you don't like that, we have to break the mold. We have to empower the patient with the doctor to solve their problems and to seek the care that they really need rather than a narrowing network and being like my agent in my office, being declined twice when his doctor said you need surgery on that meniscus, and finally the third time. Think of the wasted time for the people reviewing this, the doctor filling out forms. We've got to find a way around this, and we need individual health insurance and individual or group health insurance that reimburses doctors and hospitals at a rate that actually they make money on rather than losing money. So members, please vote green. Let's keep this conversation going and see if we can't come up with a positive solution. Thank you, members.
The Secretary will take the roll on the A8 amendment. Members, please vote so we can move expeditiously. Senator Hochschild, those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Carlson votes no.
Senator Carlson votes no.
Senator Pa votes no.
Senator Pa votes no.
Senator Marty votes no.
Senator Marty votes no.
Senator McEwen votes no.
Senator McEwen votes no.
Senator Clark votes no.
Senator Clark votes no.
Senator Dibble votes no.
Senator Dibble votes no.
Senator Latz votes no.
Senator Latz votes no.
Senator Fate votes no.
Senator Fate votes no.
Senator Gustafson votes no.
Senator Gustafson votes no.
And Senator Port votes no.
And Senator Port votes no. Senator Rest, are you voting? Senator Jasinski, those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Coleman votes aye.
Senator Coleman votes aye. All members having voted who desires to vote, the Secretary will close the roll. There being 32 ayes and 33 nays, the A8 Gruenhagen Amendment is not adopted. Senator Nelson.
Thank you, Mr. President. Mr. President, members, I have the A2 amendment.
Senator Nelson offers the A2 amendment. The Secretary will report the A2 amendment.
Senator Nelson moves to amend House File 4188 as amended pursuant to Rule 45 as follows. Page 46, lines 4 to 15. This is Amendment A-2.
Senator Nelson, to your A2 amendment.
Thank you, Mr. Chair. The A2 amendment simply moves the supervisory policy provision from rule to state. That's the current law or the current bill in front of you. It is moving what is currently in rule regarding the supervisory policies provision, and it is putting it into law. Now, the A2 amendment would strike that language and reinsert the existing language. There has been some questions on this, and I believe we should keep it in rule rather than law and save the discussion here for a further day. I've discussed this with Senator Klein earlier in the session, and I think it would be best if we could strike this language, keep it in rule, and discuss it another day. And with that, though, I will offer the A3 to tell you why. I'll give you an example of why that's important.
Senator Nelson offers the A3 amendment as the amendment to the amendment. The Secretary will report the amendment to the amendment.
Senator Nelson moves to amend the Nelson A2 amendment to House File 4188 as follows. Page 1, delete line 4 and insert. This is Amendment A-3.
Senator Nelson, to your A3 amendment to the amendment.
Thank you, Mr. President and members. The A3 amendment, as I said, deletes those lines 5 through 14, and then this is the new language. It says that an investment advisor who does not have any employees, no employees, is exempt from written supervisory procedures, which are now required in rule. And this is just simply a matter of common sense. I am shocked that I had a constituent need to bring this to me. This just simply means if you are a sole proprietor, no employees, not a single employee, you do not have to write out supervisory procedures. Who are you supposed to be supervising? You have no employees. So I encourage a green vote for this common sense amendment.
Senator Klein, to the A3 amendment to the amendment.
Mr. President, I accept the A3 amendment to the amendment as a friendly, and then I will have comments on the underlying amended amendment.
All those in favor of adoption of the A3 amendment to the amendment say aye. Aye. All those opposed say no. The motion prevails. Members, we are now on the underlying A2 amendment as amended. Senator Klein.
Thank you, Mr. President. Will Senator Nelson yield?
Senator Nelson, will you yield? She will yield. Senator Klein.
Mr. President, this is department language, and typically they are kind of our authorities on this and why they would think it would matter or be more appropriate for law versus rules. Were you able to discuss this amendment with the Department of Commerce, and did they have a reaction?
Senator Nelson, to the question.
Yes. Senator Klein, I am so glad you asked me, because I was even wondering if I should talk about that discussion. But you asked me about it, and so I'm going to tell you about the discussion. Yes, I had a meeting with the commissioner and her director of affairs, I forgot his exact name, and we went through what this one particular constituent of mine had gone through as a sole proprietor writing supervisory procedures for employees that don't exist. And he, quite frankly, is very thorough, and he made quite a list of what had happened. And I will tell you what the Commerce Commissioner told me. Actually, I would just say there was an apology to me and a phone call apologizing to my constituent. I think this is just an example of perhaps why this should be in rule rather than law. It's easier to change rules than the rules than it is law. And in this case, the constituent did a very thorough job of documenting all of the phone calls, all of the emails, all of the letters, all of the unanswered communication. And I have not seen, actually, it's very rare that I've seen a commissioner apologize for something that had happened. This does not need to happen. There's just not a reason to have supervisory written procedures to supervise yourself. So just very simple. Thank you.
Senator Klein.
This is a friendly amendment.
Members, all those in favor of adoption of the A2 amendment, say aye. All those opposed, say no. The motion prevails and the A2 is adopted. Senator Liskey.
Thank you, Mr. President. Mr. President, I'd like to offer the A13 amendment.
Senator Liskey offers the A13 amendment. The Secretary will report the A13 amendment.
Senator Liskey moves to amend House File 4188 as amended pursuant to Rule 45 as follows. Page 31 deletes Section 6, page 122. This is Amendment A13.
Senator Liskey to your A13 amendment.
Thank you, Mr. President. Mr. President, the subject of nudification has come up before, and the discussion around data centers and what they can and can't do and what we should or shouldn't be able to do. And I do find it absolutely terrible that people are using AI technology to take images of people who are fully clothed and then turn them nude and then use them for, well, terrible things, whether they disseminate or whether they're keeping them for personal use. Either way, it's absolutely terrible, one of the worst things that could possibly happen. The problem that is currently, or was currently in the bill, if my amendment doesn't pass, is that it doesn't actually get after the person who's doing the bad acts. It only focuses on whether we can or can't get access to those datas and those types of programs. The issue is that it does only affect those within the state of Minnesota, and so being that a lot of those programs are online, all you need to use is a VPN to get outside of the state of Minnesota's boundaries, and those laws would no longer hold effect, meaning that those corporations would not be able to be held accountable for what someone in the state of Minnesota is doing. This change would allow us to go after the perpetrator and hold them accountable. It creates a crime, and it has a 2-year sentence and a up to $4,000 fine. So I urge a green vote. I would like a roll call on this. Thank you.
Roll call requested, roll call granted. Senator Maye Quade.
Thank you, Mr. President. Members, I'm going to respectfully ask a no vote, and I'll explain why. The very first reason is that this hasn't gone through judiciary, and part of the reason why the nudification bill exists the way it does is because a lot of people who are using nudification technology are themselves children. And so we are actually seeing, because of course, right, these nudification apps are geared, they're marketed to children to do other things besides nudification. It just happens to be a function on there. And so we are trying to cut this off at the source to make sure this technology is not accessible to Minnesotans, instead of allow Minnesotans to be victimized and then lock up people later. So I will mention to Mr. President, excuse me, and I'm glad Senator Latz is on the floor, creating a new crime without having really delved into what will this do, because this is not just adults, this is children that we're talking about. I also imagine we're looking at a pretty significant fiscal cost due to the increased penalties and the increased arrests and potential convictions. And so with that, Mr. President, I would ask members to vote no, though I do appreciate the attention to this matter.
Senator Latz.
Yeah, Mr. President, I literally just walked back on the floor from a negotiation downstairs, and I've got an amendment offered as I'm stepping onto the floor that creates new criminal penalties. I wonder if Senator Liskey would respond to a question.
Senator Liskey, will you respond to a question? He will. Senator Latz.
Senator Liskey, have you obtained a fiscal note on the what, if any, impact this amendment might have on our Department of Corrections?
Senator Liskey, to the question.
Mr. President, Senator Latz, no, I have not, as this is an amendment that I wrote this morning. Thank you.
Senator Latz.
Well, Mr. President, Senator Liskey, it's certainly worthy of consideration in the Judiciary Committee, but creating a felony on the fly without having more information, I think, would be a really bad process and could well be bad public policy. I'd encourage members to vote no.
Senator Wiesenberg.
Actually, I'm sorry, Mr. President.
Senator Latz?
I did have one other thing I want to do. I think this would have a fiscal impact, and I raised to a point of order to that.
Point of order, state your point of order.
I think this would throw the bill out of balance. I think it's 7.4. Do I have the right rule? Under Rule 7.4, I'd ask the President to rule the amendment out of order.
Any brief advice? Senator Weissenberg, advice? This is on the point of order now, Senator Weissenberg. If you want to wait a minute, and we'll see what happens here, and then you can certainly speak. Or what would you like to do, Senator Weissenberg?
Well, thank you, Mr. President. Maybe a point of parliamentary inquiry or clarification, I guess, to whoever can answer my question. We just heard there's a fiscal cost to Senator Liskey's amendment, and I'm just looking at this amendment. The bill.
Advice?
Well, yeah, I guess it's advice. So in the bill, there's already a fiscal note of up to $500,000 in fines. So there's already a monetary amount in this bill.
Advice, Mr. President?
Senator Rasmusson, advice.
Thank you, Mr. President. I would offer advice that you find the point of order not well taken, given the ruling earlier today on Senator Dibble's amendment that would have expanded coverage to a group of individuals, and that point of order that I made you found not well taken. And so I think that leads to a very strict reading of Rule 7.4 on that the amendment would have to increase net appropriations or reduce net revenue, and this amendment doesn't do that. It would ask that you be consistent with your ruling on Senator Dibble's amendment and find the point of order not well taken.
Mr. President, advice.
Okay, let's see. Since it's your amendment, but it's his point of order, all right, so let me see what his what he wants to do about his point of order. Senator Latz, were you standing to give advice?
Yes, Mr. President. Actually, I'm going to withdraw the point of order. It appears, even though it's called an omnibus policy and supplemental appropriations bill, there are no appropriations in the bill, so Rule 7.4 doesn't apply. So I'm withdrawing the point of order. I still think it's a bad idea since we don't know what costs it might add. I think it's a pretty good conjecture that it would. So it might throw a policy bill out of order, but I'll leave that to the body.
Point of order withdrawn. Any other discussion? Senator Pappas, we're on the A13 amendment. Senator Pappas.
Mr. President, on this last issue, I think that it'd be important for us to correct the titles on bills so that we know these are policy bills and not finance bills. Thank you.
Thank you, Senator Pappas, for that instruction. I'm sure that all the necessary parties heard you. Any other discussion on the A13 before we vote? This is Senator Liskey's amendment. So would you have one last comment before we vote, Senator Liskey?
Thank you, Mr. President. One final comment. Again, this green vote would be to say that anybody using these programs to create nude images, be it of adults or children without their consent, would be committing a felony crime and face 2 years and a $4,000 fine. A no vote would then imply that you do not believe this is a crime to rise to the level of a felony, and that is concerning to me, and so I hope and urge a green vote. Thank you.
The Secretary will take the roll on the A13 Liskey amendment. Members, please vote. Members, we are under a roll call vote, and the rules of the chamber requires us not to be at another person's desk. Senator Mohammed, we are on a roll call vote, and we're not supposed to be at another person's desk. Senator Johnson-Stewart. Senator Johnson-Stewart. Senator Hoschow, for those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Carlson votes no.
Senator Carlson votes no.
Senator Pa votes no.
Senator Pa votes no.
Senator McEwen votes no.
Senator McEwen votes no.
Senator Clark votes no.
Senator Clark votes no.
Senator Dibble votes no.
Senator Dibble votes no.
Senator Fate votes no.
Senator Fate votes no.
Senator Gustafson votes no.
Senator Gustafson votes no.
And Senator Port votes no.
And Senator Port votes no. Senator Jasinski.
Thank you, Mr. President. Senator Coleman votes aye.
Senator Coleman votes aye. All members having voted who desires to vote, the Secretary will close the roll. There being 31 ayes and 34 nays, the A13 Liskey Amendment is not adopted. Going to Senator Lucero.
Thank you, Mr. President. I'd like to offer the A14.
Senator Lucero offers the A14 amendment. The Secretary will report the A14 amendment.
Senator Lucero moves to amend House File Number 4188 as amended pursuant to Rule 45 as follows. Page 32, line 18, before penalties, insert civil. This is the A14 amendment.
Okay, Senator Lucero, to your A14 amendment, sir.
Thank you, Mr. President. This is similar to the Liskey amendment we just voted on, but I will explain the difference. First, this makes it a criminal penalty to perform the act, but not a felony. This makes it a gross misdemeanor. And then second, this retains the original underlying language of the bill, which is it prohibits the technology that would allow the capability to nudify images. So again, this criminalizes the act for the person that performs that heinous, again, act. So I encourage a green vote, and I would ask for a roll call.
Roll call requested, roll call granted. Senator Klein. Looks like he needs a little more time. Is there anyone else before we go to Senator Klein? We'll take Senator Liskey.
Thank you, Mr. President. Mr. President, Senator Lucero, I greatly appreciate this amendment. Unfortunately, we weren't able to pass my amendment to hold it at a very high level of crime. I look forward to green vote on this amendment, being that it still should be held to a very high level of crime, and I truly hope that everybody is a green vote on this.
Senator Latz.
Mr. President, once again, this is making criminal law, criminal penalties, potentially youth, as well as adults, possibly putting them into jail for up to 364 days with about 5 minutes of consideration on the Senate floor, without a fiscal analysis, without input from all the stakeholders that might be involved, including here all those involved in juvenile justice issues, as well as other stuff. There may very well be a value to criminalizing some of what is being offered in these amendments, but this is a lousy way to make criminal justice policy. Actually, I'd be a little bit embarrassed, frankly, if an amendment like this went on and then have to explain how we authorize putting kids in jail for up to a year based on a 5-minute conversation on the Senate floor. I'd encourage a no vote.
Senator Klein. Senator, okay, so there's no one else. Oh, I'm sorry, Senator Maye Quade.
Thank you, Mr. President. So, members, I will also echo what Senator Latz said, but I really want to lay out the timeline for this bill. This bill was introduced last year. It passed off the floor in a judiciary omnibus. It was heard again this year, and then it is in this omnibus and is a standalone bill and has also went through 2 committees in the House. If this is a real conversation we wanted to have about adding criminal penalties for using nudification technology, I have been here for a year and a half ready to talk about this, but today is not the day to say, hey, let's add a new criminal penalty without fully understanding the scope of what we're wading into, because at no point in time have we put this through any sort of process. So I'm going to say vote no, not because that this isn't an important conversation, but that's what it is a conversation. So let's have that conversation where it belongs. I will have it next year. I will bring the bill, but this is not the place to do it.
Senator Holmstrom, we're on the A14 amendment. Senator Holmstrom.
Mr. President, would Senator Maye Quade yield for a question?
Senator Maye Quade, will you yield? She will yield. Senator Holmstrom.
Mr. President, I'd like to know, as I wasn't here last year when this was first introduced, it's my understanding that this was originally part of the conversation of including the criminal penalty for the perpetrator of the crime as well. I just heard the opposite. Is it the case that no conversation was had to have the perpetrator be held liable?
Senator Maye Quade, to the question.
Thank you, Mr. President. The answer to the question, so as we developed this bill and work with stakeholders, and I have made sure that this bill has included my co-authors on both sides of the aisle, it really was to cut off this technology from being accessible so that there are no perpetrators. This is not the only state where we're looking at this. I think the federal government should absolutely do something about this. Other states are going to follow. The idea is to put this technology out of existence so that nobody has access to it anywhere, so that we aren't creating perpetrators, we aren't creating victims, we aren't creating the cost of locking people up. That is the purpose of the bill.
Senator Holmstrom, to the A14.
Thank you, Mr. President. What I didn't hear there was an answer to the question, but that's because I think we know what the answer is. It's just that this was discussed in judiciary. There was a conversation had about it, and once again it was brought up that because some teenagers may use this technology to create victims, we don't want to punish them. The Republican position on this is clear. If you're a perpetrator of a crime, whether you're 16, 22, or any age, we want to hold you liable to that crime. We want the victims to have a perpetrator be held liable to their crimes. I understand that there might be a fiscal cost to holding people accountable to the crimes, but that's what government does. That's what we expect government to do. We expect government to hold people accountable and provide public safety. This is what this amendment does. I understand we want to go after big tech companies. I understand that you want to create a boogeyman out of them, and I agree with you. If any tech company offers this technology to nudify somebody, they should stop. They should be held accountable. We should put them in their place, and this law will continue to do that. It just also tells victims that we care about you. What happened to you matters, and the perpetrator who made you a victim needs to be held to account, the same as the system that allowed them to do it. So I asked for a green vote, and I would expect anybody who routinely comes before this body to claim that they're an advocate for victims of sexual assault and victims of crimes like this would obviously be a green vote yet as well, but I don't speak for everybody, I speak for myself, and this is a very easy vote.
Senator Liskey, you were standing earlier. Okay. Anyone else before I go to the author of the amendment? Oh, Senator Latz.
Mr. President, it apparently is a Republican priority that was conceived at 11:39 a.m. today, even though they serve on all the committees that this bill went through. So this is a newfound commitment to criminalizing the conduct, apparently. Don't stand up here and moralize to us that the Republican priority is to criminalize this conduct when it was conjured up sometime today and put in written form, not brought up in any of the committees that this bill has gone through, including the Judiciary Committee, which has plenty of Republicans who are familiar with criminal law, including the Commerce Committee. I serve on both of them. This stuff didn't come up then. So don't pretend that your newfound sanctity here is holier than thou, and the Democrats are falling short because we didn't come up with the same idea today.
Senator Holmstrom.
Thank you, Mr. Chair. While I appreciate Senator Latz's lecturing, I would say that let's vote on the merits of the idea. Either perpetrators should be held to account for their crimes, or they shouldn't. That's what you're voting on. You're not voting on whether or not you were slighted because it didn't come before your committee. We're voting on whether or not this idea has merits. And I will bring up again that this was discussed before, and this wasn't an idea brought up this morning. It was drafted this morning. If you look at the House vote, you will very clearly see that there were members, or at least one, that voted against it for this very reason. Thank you.
Members, I know that we get really excited about things, but I just want to make sure that we're clear. Number one, under Rule 36, the member must speak only to the question under debate and avoid personalities. So saying people were slighted or anything, avoid those personalities. We are talking about policy, and you can eloquently debate that issue without trying to go someplace else other than debate. Senator Liskey.
Thank you, Mr. President. I had no intentions of rising again to speak on this, as I thought we had gotten through things, but more debate has been brought forward. I would like to point out that I serve on Health and Human Services and on Labor Committee. This subject did not come before my committees in this session, therefore did not have the opportunity to discuss these subjects. This is my first time being able to talk about it. I think that's the point of why we have discussion on the floor. We have the ability to debate amendments and the bills. Last I checked, that was the point of the floor. I could be wrong, but I think that was the purpose. And so with that, I again urge a green vote. I do believe that this is a good amendment with the intent to stop kids and adults from access to the nudification. Otherwise, like I said, if we don't have these types of crimes created, all that people will do is use a VPN to move around it. They can still access this software elsewhere. It does not require any changes, and it will just be a feel-good bill, and it will actually endanger those that you're attempting to protect, because those individuals will assume that it's against state law, think that they're safe, and then find out months later after something's happened to them that there was an easy way to skirt around the law. Thank you very much.
The last voice we'll hear from it will be, oh, I'm sorry, Senator Westrom. I didn't see you earlier. Senator Westrom.
Well, Mr. President, I was not planning to engage in this debate, but with what we heard from Senator Latz and the tongue lashing, I appreciate your reminding us of the rules and the holier-than-thou side that he referred to. I think the whole chamber should be holier-than-thou on this amendment. And Senator Latz, I'll give you a little reminder lecture about how the process does work, too. You've been here a long time, and I've been here a long time. Senator Liskey, you are right. You are 100% right. Amendments can come to the floor when you have good ideas. You haven't sat on the committee. Even if you have sat on the committee, that doesn't mean every idea comes to you while you're sitting on the committee and a bill is in front of you for 5 or 10 or 30 minutes for the first time. And when you're in committee, you're hearing about it from the author. That's why we have committees. But it's part of the process, not the whole process. This is much more the whole process, Senator Latz, than your committee that is jammed full of bills because it's such a big committee. We should do something about that probably, but that's another matter for another day. But the 5 or 10 or 30 minutes it has in committee is not the only time a bill has scrutiny or is subject to changing or amending or enhancing with good ideas like Senator Liskey's amendment. There's only 10 of us on the Senate Judiciary Committee out of the 67 senators, so 57 senators didn't get to hear the bill in Judiciary Committee, and this is their opportunity to offer an amendment because they've maybe heard of the bill coming through committee, they've read it when it's introduced, others might talk to them about it. There's a myriad of reasons people come up with amendments, so to question the motive of it being printed at 11:59 today, I think goes beyond the intention of Senate rules. But to remind you, to give you a little bit of a lecture and refresher in the Senate legislative process, there is nothing Senator Liskey is doing out of the norm or out of the bounds of what he should be doing to represent his district, to represent and improve a bill that's coming before him for the first time, just like every other senator in this chamber that hasn't sat on one of the committees it went through. And so let's not act so righteous and holier than thou because somebody offered an amendment on the Senate floor and you thought they should have offered it in the Senate Judiciary Committee. I'd vote green. I urge everybody to vote green on the merits of this amendment.
Hold on. For what purpose do you rise?
To raise a point of order.
State your point of order, Senator Latz.
Mr. President, I let Senator Westrom go on and on and on, addressing me directly in direct contradiction to the rules of the Senate body. But he knows those rules just as well as I do. And I didn't raise my point of response about when this should have been brought up until Senator Lucero, or I think it was Senator Lucero who said, the GOP thinks, ignoring that the GOP, including Senator Westrom, serves on the Judiciary Committee through which this bill traveled. Maybe he was gone the day this bill came through. But he had an opportunity, if the GOP's position was to criminalize this conduct, to offer an amendment in the Judiciary Committee. I've never disputed the ability of people to bring amendments on the floor if they're in order.
Senator Latz, Mr. President, advice.
You rose for a point of order, and I'm still waiting to hear the point of order so that I can react to that point of order. Senator Latz.
Mr. President, the point was that no member is allowed to address another member directly on the floor. They're to go through the president. Senator Westrom went on ad nauseum lecturing me in violation of that rules of decorum, and frankly, it's not the first time he's done so on this Senate floor.
Members, as a reminder, as a gentle reminder to all, because I've heard many different people do it, and I am going to be much more strict about it. All your comments are supposed to come through the president. I would like for you all to avoid making direct comments to each other or by name, because we're not supposed to do that. That is true. So this is a gentle reminder, because the whole reason for that rule is because it keeps down personalities, and then people don't start directly attacking each other, because that's not what we're supposed to do. So this is to all of us, not to any person in particular, because I believe that many of us have been in violation of that rule. So it's my job to make sure that I try to keep a close watch on that. So with that
Mr.
being
President,
said, Senator Lucero, your
point of parliamentary inquiry.
Please state your point of parliamentary inquiry.
I was going to rise to give you advice, but that's not, you've already done away with that. So my point of parliamentary inquiry is, how would I appropriately correct Senator Latz on two things, if I can't name him by name? First, falsely ascribing a comment to me that I didn't say. I rose and introduced the bill, so Latz right now is way out of order. Second, I am the one who introduced this amendment, and in his first remarks, he rose and said something to the effect of, the author of the amendment sits on the Judiciary Committee and conjured this up at 11:39 a.m. I don't sit on the Judiciary Committee. So he's flat out wrong again.
So
and third, to falsely ascribe that I conjured this up at 11:39, that's when this piece of paper was printed. So Senator Latz, being the senior member that he is way out of line and should settle down and get himself in order.
Hey, Senator Lucero. Members, I want you to cut it out, because I gently asked you all not to state each other's name, and do not use the rule as a way to violate the rule. Let me just remind us as members. Number one, Section 92. You asked a question. The question was, if I heard someone say a name or violate the rule, how am I supposed to do that? Number one, under Section 92, you are not supposed to interrupt a member. A member who is speaking may be interrupted only when some motion requires immediate consideration. After a person finishes, I think it's appropriate and okay to say, just as a reminder, I was not the one who said it. And in fact, if we stop each other from saying one person or another said something, then that wouldn't even be necessary. So stop using each other's names. You're supposed to come through the president. And I usually look at you when you are debating, unless someone is talking to me, in order to give you eye contact and respect. And by the way, you're only supposed to look at the president. I may not be the best looking guy, but I'm the guy who's up here right now for you to look at when you are talking and speaking. So let's please return to decorum. I would sincerely appreciate that. Senator Maye Quade.
Thank you, Mr. President. I just want to outline the process just so all members are very, very clear where this bill has been and at what point they have had an opportunity to give input. This bill was introduced in February of 2025. It was heard in the Commerce Committee. Senator Duckworth, this senator from Lakeville added his name to the bill. It was heard in the Judiciary Committee, and the senator from Bloomington, our HHS chair, added herself to the bill. We subsequently created 2 clone bills, so 7 more members of this body could become authors. This bill was heard and passed off of the Senate floor last May or April, where every single member of this body right now, except for 3, had the opportunity to read it and bring an amendment and didn't. Over the interim I worked on this bill, we brought it back. It went through every committee in the other body and passed off of the floor and was heard again in the Commerce Committee this year and is now here. I understand there are a lot of strong opinions about this bill. It is why I have it. It is why it's bipartisan, even the clones. But I want to remind members that we already made dissemination of non-consensual sexual deepfakes a crime in the state of Minnesota. But what still exists is the technology for people to make child sexual abuse material or to nudify other people. And it's the technology that is allowing people to commit the crimes. And if we don't turn it off, then people will continue to victimize other people because image-based sexual abuse is sexual abuse. And instead of trying to lock up every person, because I'm sorry, Mr. President, but of course a 12-year-old who has this available on his or her phone, yeah, they use it, because why would they think it's illegal? It was available on the app that turned them into a Lego. We have to go after where it actually is starting. That is why this bill is constructed this way, and I'm asking members to respect the victim survivors who are here in the gallery, and myself for doing the work exactly the way it is supposed to happen on a bill this serious and a topic this consequential. So I ask for a no vote on this amendment so we can continue to move through this bill and actually get to my standalone bill so it can become law. Thank you.
Members, remember we're on the A14 amendment and we are only supposed to debate what is before the body. Senator Abler.
Thank you, Mr. President. I am fully informed and ready to vote. Thank you.
Senator Lucero, you would be the last voice that we would hear before we vote because you're the author of the amendment. Senator Lucero.
Thank you, Mr. President, and thank you, members, for this very important topic. We continue to see technology advancing, and evil is real. Violations are real. Intrusions into privacy is real. Violence is real. And people that have the inclination to act on those intrusions, privacy violations, violence, are continuing to use technology to do so. And so working to limit the ability of this technology to perform these acts of intrusions and violations of privacy is important. But that's not enough, and hence the reason why this amendment is being offered. Not only do we need to work to limit the technology capabilities, but we also need to make it very clear in the state of Minnesota that the act, the individual who performs the act of intrusion, privacy violation, is also liable and a criminal act. And therefore, for members, this is a very simple amendment, 3 sentences. A person who intentionally nudifies an image or video of another, knowing or having reason to know that the subject of the image or video did not consent to the nudification, is guilty of a gross misdemeanor. If you agree that that should be a crime, then vote yes, vote green. If you disagree, that the nudification and violation of somebody's privacy should not be a criminal act, then vote no and vote red.
With that being said, the secretary will take the roll on the Lucero A14 amendment. Members, please vote so we can move expeditiously. And remember, when we're under roll call, you're not supposed to be at anyone else's desk, please. Senator Hochschild, for those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Pobb votes no.
Senator Pobb votes no.
Senator McEwen votes no.
Senator McEwen votes no.
Senator Carlson votes no.
Senator Carlson votes no.
Senator Clark votes no.
Senator Clark votes no.
Senator Dibble votes no.
Senator Dibble votes no.
Senator Fate votes no.
Senator Fate votes no.
Senator Gustafson votes no.
Senator Gustafson votes no.
And Senator Port votes no.
And Senator Port votes no. Senator Jasinski, for those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Coleman votes aye.
Senator Coleman votes aye. All senators having voted who desires to vote, the secretary will close the roll. There being 31 ayes and 33 nays, the A14 Lucero Amendment is not adopted. Before I go to the next person who is going to give us an amendment, members, I want to turn your attention to Section 124 of Masons. Specifically, it reads, number 1, in debate, a member must confine remarks to the proposal before the House and avoid personalities. Number 2, a member, in referring to another member, should avoid using the member's name, rather identifying that member by district, by seat, as the member who last spoke, or by describing the member in some other respectful, and I want to underscore, respectful manner. As a gentle reminder to all of us, no one in particular. Senator Maye Quade.
Thank you, Mr. President. I would offer the A11 amendment.
Senator Maye Quade offers the A11 amendment. The secretary will report the A11.
Senator Maye Quade moves to amend House File Number 4188 as amended pursuant to Rule 45 as follows. Page 27, after line 17, insert. This is the A11 amendment.
Senator Maye Quade, to your A11 amendment.
Thank you, Mr. President. The A11 amendment clarifies that price fixing through an algorithm is also illegal. We have a strong price fixing statute that prohibits price fixing, but what we have learned is that companies and corporations have started to use third parties to do the price fixing, which is also a conspiracy and is also illegal, but we have found in about half the states, without that clarification that we have here in this amendment, sometimes courts are saying, well, I don't know if it's price fixing. It absolutely is. It's driving up the cost of our goods, and it needs to be clear that it is illegal price fixing, and that is what my amendment does.
Senator Klein to the A11 amendment.
Thank you, Mr. President, and thank you, Senator Maye Quade, for sharing this amendment with me earlier today. Members, I think it's a really good consumer protection initiative. Other states have enacted this. I apologize to the members of the Commerce Committee that we didn't hear this as an introduced bill. That would be my only hesitation about it. But the chair will vote yes on this amendment, and I will ask for a roll call.
Roll call, requested roll call granted. Senator Rasmusson.
Thank you, Mr. President. Would Senator Maye Quade yield for a question?
Senator Maye Quade, will you yield? She will yield. Senator Rasmusson.
Thank you, Mr. President. Thank you, Senator Maye Quade. I'm looking at the amendment. Could you give an example of where one of these common pricing algorithms have been used and caused harm to Minnesotans?
Senator Maye Quade, to the question.
Thank you, Mr. President. It's a great question. Rent fixing is actually a really great place that this has happened. So landlords will actually give their apartments and the availability and the sizes and all that to a rent fixing algorithm. They will also enter into a coercive contract to enforce whatever prices the algorithm spits out to them, and then will get kicked out of the rent fixing scheme if they don't use those prices. And so we've had a number of lawsuits, including the state of Minnesota, but Arizona, I think there were like 15 states that were part of this lawsuit, and it has driven rent prices up significantly because they are price fixing, they're rent fixing. Pepsi was just recently found to be doing this, price fixing for the purposes of keeping Walmart's Pepsi prices the lowest among others. Amazon 3 days ago, it was revealed in a lawsuit that they are price fixing. I think the example that they used were canine supplies. So this is absolutely something that's happening, and we want to make sure that it's clear that price fixing, whether you're doing it with 2 or 3 people in a room or 2 or 3 people in an algorithm, is illegal.
Senator Rasmusson.
Thank you, Mr. President. And will Senator Maye Quade continue to yield?
Senator Maye Quade, will you continue to yield? She will. Senator Rasmusson.
Thank you, Mr. President. Senator Maye Quade, and I'm sorry if I missed this in your introduction, was this language introduced in a bill this session?
Senator Maye Quade, to the question.
Thank you, Mr. President. Yes, Senator, to the senator's question, I do have a bill about price fixing introduced. I believe this language is slightly different, but the intent is the same.
Senator Rasmusson.
Thank you, Mr. President. Would Senator Klein yield for a question?
Senator Klein, will you yield? He will yield. Senator Rasmusson.
Thank you, Mr. President. Thank you, Senator Klein. Senator Klein, is there any reason you didn't give this language or this bill a hearing in the Senate Commerce Committee?
Senator Klein, to the question.
Mr. Chair, Senator Rasmusson, no, there was no reason. It may have been an oversight or a lack of committee time availability.
Senator Rasmusson.
Thank you, Mr. President. And I think if my memory serves me correctly, we had committee yesterday and the Senate Commerce Committee, and so we could have had a chance to take a look at this and understand the implications of it for Minnesotans. One example that I have is, for repair shops, there are time guides that are oftentimes standardized and used across different repair shops. We could have companies that have marketing programs that have perhaps common pricing across different franchisees. And so I just would have appreciated the opportunity to hear from people who could have been affected by this language to understand how it might limit common commercial practices out there in the market. So just I'm concerned that I don't know if we have answers on that here today.
Senator Lucero.
Thank you, Mr. President, and I am wondering if Senator Klein would yield for a question.
Senator Klein, will you yield? He will yield. Senator Lucero.
Thank you, Mr. President. Thank you, Senator Klein. I'm not on the Commerce Committee, so I'm not immediately familiar with potentially some of these terms may already be in statute. So the first question I would have is there a definition for common pricing algorithm?
Senator Klein, to the question.
Mr. President, first of all, to the earlier question, I just want to say that this bill actually was referred to the Judiciary Committee, and that would explain why it was not heard in Commerce. And I would have to go to research to get to answer your question, Senator Lucero, as to whether there is elsewhere in statute a definition of common pricing algorithm.
Senator Lucero.
Thank you, Mr. President, and thank you, Senator Klein. If he would yield for another question.
Senator Klein, will you yield? He will yield. Senator Lucero.
Thank you, Mr. President. Thank you, Senator Klein. And the reason I'm asking you to yield, Senator Klein, is because you had risen and said that you would accept this language as friendly. So the question I have then, as the chair of the Commerce Committee, so obviously engaging in commerce would be up your alley. So when I'm reading the language, common pricing algorithm, the adaptive pricing is what jumps to my mind. And I'm thinking the most probably common usage of adaptive pricing would be airlines. So if we purchase our airline tickets, as we all know, there's a myriad of variables that go into an algorithm to determine a price at a point in time. So, Mr. President and Senator Klein, will this language prevent airlines as one example of adaptive or algorithmic pricing?
Senator Klein, to the question.
Mr. President, so the bill language specifically requires it to be a conspiracy between two or more persons. So I don't think that the language that we're looking at would apply to the airline example that's being raised.
Senator Lucero.
Thank you, Mr. President. As I'm looking at this language, if he would yield for another question.
Senator Klein, will you yield for another question? He will yield. Senator Lucero.
Thank you, Mr. President. Thank you, Senator Klein. So that I can understand and have clarity, can you please draw my attention where the conspiracy requirement is?
Senator Klein, to the question.
Mr. President, so this is new language onto an existing statute, and if you go to line 1.9, you can see the reference that I'm raising.
Senator Lucero.
Thank you, Mr. President. So then perhaps if Senator Latz, I can't see if he's in the chamber, if he would yield.
Senator Latz is not on the floor.
He's not, okay. Who is the vice chair there? I have no idea, but I'm gonna guess Senator Westlin, if she would yield.
The vice chair is Senator Umu Verbatim.
Oh, is she on the floor?
She is on the floor.
Would she be willing to yield?
Are you willing to yield? She is willing to yield. Senator Lucero.
Thank you, Mr. President. Thank you, Senator. Could you help me understand then the on line 1.9, as Senator Klein just drew our attention to the word conspiracy, can you help me understand, is that something that must be established as an element of the crime that would then prohibit this?
Senator Umu Verbatim to the question. We'll give you a moment.
Mr. President, could you ask, I'd like to ask Senator Lucero just to repeat the question one more time.
Senator Lucero, can you repeat the question one more time?
Thank you, Mr. President. So what I'm trying to get clarity in my understanding is when it comes to the enforcement of existing statute and the attempt to amend in then this additional language, I'm trying to understand how a prosecutor and or a regulatory agency establishes conspiracy. How do they engage in that effort? Is that common? Is it hard to establish, or wanting to understand how the prevalence, I guess, of that element of the crime when it comes to enforcement? Because I'm trying to understand the magnitude, if this were to become law, what the impact is going to be. So the question is, in regards to conspiracy as an element of the crime, is this a prevalently enforced or prosecuted crime currently with the existing statute?
Senator Umu Verbatim.
Thank you, Mr. President, and thank you, Senator Lucero, for the question. I'm following along, and I see conspiracy in the existing language. I guess this additional language in which would be in paragraph D wouldn't change that. I can't speak to how prosecutors are currently making those determinations. That might be a good question for the Minnesota County Attorneys Association. But we also have Senator Maye Quade on the floor, who worked on previous legislation and may want to add some additional comments. Thank you.
Senator Lucero.
Thank you, Mr. President, and thank you for that. So, Senator Maye Quade and I have had a conversation. I don't think it would be out of order to just share. I'm in agreement with the idea that, generally speaking, I do not want a pricing model and I don't want technology or algorithms that would allow for people to be charged differently based on some attribute that relates to them, whether it be their age, their political affiliation, their potential size of assets, their net worth, their means, their ability to pay. I don't want pricing, and I'm receptive and opposed to such a concept, and I believe that technological capabilities are going to allow that. As data continues to be harvested from us and profiles are being built on each and every one of us as individuals, that capability is a very real threat, and I believe it's a threat to commerce. What I'm concerned about, though, is that when I'm looking at this language and it says common pricing algorithm for the same or similar product or service, well, that is very broad. In the universe of products and services, obviously that can be anything. And among the anything in this universe of products and services then would be real estate. So I'm thinking, I already brought up the example of the airlines, and an algorithm is used. When it comes to real estate, you could have, in a development, you could have a substantially same or similar home that is built, and it might have two different prices based on an algorithm. And the algorithm might be looking at variables such as supply, demand, weather conditions. There's a myriad of things that go into an algorithm. And I think that I heard the word rent as part of the conversation here. When it comes to rent, that could be different from day to day based on those same variables. Supply, demand, interest rates could change from one day to the next. I mean, there could be events that happen in the local market that would influence that. And an algorithm in and of itself is not bad to help determine and weigh supply and demand in determining what a price should be for a widget or a product or service. And so what I'm concerned about, though, is an algorithm being used with those other variables that are not specific to the individual, not looking at some attribute or demographic of an individual. And that's what I'm concerned about, since this hasn't gone through committee, is my understanding, just listening to the conversation here, hasn't had a bill hearing. I don't want to inadvertently have an algorithm be prohibited from these other elements in society. And so therefore, I have concerns with the language. Thank you, Mr. President.
Senator Maye Quade.
Thank you, Mr. President. It's really important that people read the statute that the new language is going into. Minnesota already prohibits price fixing, which is a contract, combination, or conspiracy between two or more persons in competition. Underneath that, we are now saying using a common pricing algorithm to set or adopt prices or commercial terms for people who are in direct competition with one another in order to fix the price is unlawful. Mr. President, that already is unlawful, and I would argue it is a contract between two or more persons in a conspiracy. However, because an algorithm and the use of this third party to spit out the price and fix the price across the market to these individuals is not always seen. In half the states, they've said it is price fixing, and in half the states, we're like, well, it doesn't specifically say an algorithm. So we're just making it clear that it is price fixing. This is not touching an individual algorithm for how a company might set prices or terms or supply and demand. It is for when companies or people who are in competition with one another are price fixing across the market. That is what is already illegal. Using an algorithm to do it or getting 3 people together in a room to do it doesn't matter, it's still illegal. That is what this language does.
Senator Kroon.
Thank you, Mr. President. I'm just looking at 325D.53, which this adds to, and what the penalties and why this might have been referred to the Judiciary and Public Safety Committee rather than the Commerce Committee. I'm seeing violations of this chapter, 325D, or this section 325D.53, includes the following: civil penalties up to $100,000, criminal penalties, felony of up to 7 years, treble damages, injunctive relief, attorney general investigating authority, forfeiture of charter rights and privilege to do business, business entity violations passed through as violations to individuals, which means that not just a company could be liable. We're talking about directors, members, officers, managers, employees, or agents, and I could go on and on and on. I didn't even finish my list here. What I'm getting at, Mr. President, is a very serious bill that has very serious consequences if it is violated, including felony level, serious criminal violations, all sorts of other very serious penalties. And I certainly, it would be nice to hear from people that might be affected by this change in the law before we take the step of adding this serious level of penalties to something. And I'm not saying it's a bad idea. I don't know enough about it, Mr. President, but I just thought I'd rise and add those remarks. Thank you.
Senator Latz, your name was brought up earlier. Are you prepared to say something?
Mr. President, I don't know how my name was brought up, so I don't know if I should say anything or not. I understand there's some conversation about criminal consequences. I have the amendment in front of me, and it's not, as far as I can tell, I haven't really done the research, but as far as I can tell, it's not to a criminal section of the statute. So what are we looking at?
Senator Rasmusson.
Thank you, Mr. President. I rise to a point of order under Rule 35.2, germaneness, and happy to offer advice.
Senator Rasmusson has brought a point of order pursuant to Rule 35.2, and he will give advice. Senator Rasmusson.
Thank you, Mr. President. This amendment is not germane because it relates to a substantially different subject. In the underlying bill that's in front of us, there is nothing about price fixing. And the comments that Senator Kroon made convinced me that this amendment, if it would be germane to a judiciary bill, and that's why the underlying bill was referred to the Judiciary Committee. And if you look at the chapter that is being amended, it is within Attorney General enforcement, which goes along with the different civil criminal penalties that Senator Kroon outlined. And so I would ask that you find this amendment to be out of order, to not be germane to the underlying bill in front of us.
Senator Klein. Advice? Okay. Let's see. Anyone else? If no one else, hold a moment and I will give you my decision. Members, having listened to advice, having had counsel, the point of order is well taken. Senator Maye Quade, you have a second amendment? Any other amendments before we go to third reading? Seeing none, the Secretary will give the bill its third reading.
Senate File Number 4365, a bill for an act relating to commerce, eliminating the Prescription Drug Affordability Advisory Council, etc.
Third reading. Members, we will now go to Senator Abler.
Thank you, Mr. President. Good debate. There was a time when I wished I could be on Commerce Committee. That desire is becoming more and more extinguished. But I appreciate the good work that they do there. It's very important. And I want to commend whoever stuck it in there, the home care piece with Medica and Health Partners. This is a real problem, and I hope that this can be resolved either via this method here or through negotiation. I want to point out that the dire straits, that the 200 individuals who need these home care services that are very expensive, $200,000 a year, $500,000 a year, have been well suited and well taken care of by these carriers, and only lately have been interrupted at some point to the risk of rehospitalization or the actual rehospitalization or the risk of perishing by the individuals. So I hope it can, there's room for negotiation on this, and Mr. President, the reason I'm talking is I know that those individuals and those plans are listening. I'm happy to be voting yes on this bill because of that provision in particular. Thank you.
Senator Bowden.
Thank you, Mr. President. I will be brief, but I also want to thank Chair Klein for including the provision that my colleague just spoke about. This is an incredibly important protection for these 200 to 250 families who are relying on this care to keep their kids at home. Without this care, they're looking at really dire consequences, and so hope we can continue this, moving. This care has been in place for the last 15 years. There's no reason for the law that is in place currently to not continue to be followed. Thank you, Mr. President.
Senator Glimmer.
Thank you, Mr. President. So often we get involved in very heavy debate about very complex issues, and we sometimes forget about the people back home. The reason I bring that up is there's a young family in my district that is following a very specific provision in this bill, and I think it's important for us to hear their story. I'm going to read a couple sentences from their letter that they sent me earlier this year. Our son Chase, 4 years old, is very medically complex. He's disabled, requires 24-hour hospital-level care due to his medical condition. Because of access to in-home skilled nursing, he's able to be cared for at home rather than in a hospital. He needs a nurse with him at all times to perform medical interventions. Because of his disability, our son qualifies for Minnesota medical assistance. We also have a private medical plan with our insurance company since he was born. And so far, they've covered 84 hours a week of skilled nursing care. His diagnosis has not changed and will not in the foreseeable future. However, in December, we received a letter that the skilled nursing care would be denied in direct violation, they believe, of Minnesota state statute. We got nowhere with the Minnesota Department of Commerce or the Minnesota Attorney General's office. The reason I bring that up is we have a very important provision in this bill. It was actually Senator Bolden's Senate File 4502 I was proud to be a co-author in that provision, as is Senator Utke, Abler, and Senator Klein. And it's to address this nursing home issue for medically fragile kids. The original bill and the original legislative intent was created in 2010. However, at least 2 health plans have now decided to limit coverage to just 10 days per year. This provision clarifies our legislative intent from 2010. Somehow our system screwed up. Somehow legislative intent was either forgotten or it was ignored. And the enforcement mechanism did not enforce the legislative intent that's found in our statute books. Now, kids are going, if that legislative intent is not underscored, kids will have to go to a hospital to be taken care of. Now, I'm not on the committee, but I don't understand how that would be cheaper than having your kid taken care at home. Hospital care is extremely expensive, and I don't know for a little one if that's the best way we can handle this situation and help this family. Speaking of the family, they're hardworking people. They both have jobs. If they don't have that skilled nurse at home, more than likely one would have to quit their job in order to take care of their son at home. We have constituents. The couple that I'm talking about is in my district. I would imagine every one of us has a constituent family that has the very same issue in their district. And I'm going to be voting for the bill today. And I am underlying the human story that we're trying to help people that have, with no fault of their own, a serious condition affecting a child in their home that needs our attention, and a bold underscore so that insurance companies don't think they can intentionally forget about the legislative intent that was so important back in 2010. It's just as important now. Thank you, Mr. President.
Any other discussion before final passage, vote on final passage of the bill? Senator Johnson.
Thank you, Mr. President. I just wanted to say a couple of things about this bill. There was a couple of highlights in here that really appreciated. One was the reinsurance. This is something that many of us have worked on for a long time. I want to give special thanks here to Senator Dames. That's been a real project that he's been bringing forward for a number of years here. So I'd like to thank the author of this bill for his work too on reinsurance and making sure that although an imperfect product, at least gives some assurance to individual healthcare insurance policy holders, some stability within the market. So it's been a very important tool in the state of Minnesota as we are working on our healthcare system here in the state of Minnesota. Also, it's been mentioned several times, but also the 62Q changes enforcing, insurance companies, making sure that they are providing that uncapped in-home care for disabled kids and those who need that service within their homes. What an important service there, and I think is something that was good clarification within the bill on that in particular. And how could we forget in this whole bill and the debate that we've had that meat raffles have been amended within this bill. I know there's a number of very excited people here raising the limit of meat that can be given away from $50 to $200. So there's always small highlights within each bill here. And that's one that I know a number of people have been talking to me about as well, too. So I'd like to thank the bill author for including that in there as well. So thank you, Mr. President, and a few real highlights within this bill.
Senator Gruenhagen.
Well, thank you, Mr. President. Yeah, I just wanted to follow up on Senator Limmer's comments about that child. You know, a lot of people are going to blame the insurance company, which they do have fault in this also. But remember, members, this was my point earlier. It's the federal and the state bureaucracy and that is pushing these insurance bureaucracies and the hospital bureaucracies. And they're tightening their grip and they're reducing benefits and they're making it more difficult for the doctor to give the treatment that you need. You know, somebody said repetition is the key to learning. It's the bureaucracy. Okay? You've got to understand that at the federal level, and then a huge one at the state level. And then the insurance company and the hospitals create huge bureaucracies. And this is the nonsense you get out of it. People not getting the treatment that they need, and then we're giving $80 million bonuses to the CEOs who are milking the system. So you should have passed my bill. Anyway, thank you, Mr. President.
Senator Maye Quade.
Thank you, Mr. President. I really want to thank Senator Klein for putting the ban on chatbots for minors into this bill. It is so important. We have seen some just truly horrific stories from across the country. We have a 13-year-old girl in Colorado who died by suicide after talking with a chatbot. We have a 14-year-old boy who died by suicide who the chatbot encouraged him to do it. A 16-year-old boy who died by suicide after the chatbot told him, "I won't try to talk you out of your feelings." A 17-year-old whose chatbot helped him draft a suicide note and told him how to hang himself. There are just exponential risks to these unregulated AI technologies being available to our children. And we are not going to be the first state, but we will follow a handful of states that have already passed this law to make sure that Minnesota children are safer here in Minnesota without having AI chatbots just free to corrupt them. So I really am deeply grateful that this is in the bill, and I thank the committees for their work making sure that this gets across the finish line. And I urge a green vote on the bill overall.
Any other discussion before I go to the bill's author for our final passage? Seeing none, Senator Klein.
Thank you, Mr. President. I'll be very brief. Thank you to the members. I'm the chair of the Commerce Committee. I presented the bill, but these, as you saw, were all member policy initiatives that came, just as Senator Limmer described, from constituent experiences. And I thank Senator Maye Quade for her concern about chatbots, Senator Bolden for her concern about disabled people trying to stay in their homes, and Senator Duckworth's concern to improve our meat raffles in the state of Minnesota. They all made it for a great bill. Here on the floor today, we took amendments that were bipartisan in nature. That is the nature of the Commerce Committee. We work together in a workmanlike fashion to process the business of the state, and I have no doubt that that spirit will continue on Commerce when I am no longer chair next year. I would like to thank our counsel, Olivia Siverson and Nolan Huddela, our fiscal analyst, Krista Boyd, our DFL researcher, Amanda Peterson-Heaney, our Republican researcher, Linnea Michelson, the committee administrator, Mr. Bill Lunzer, our committee legislative assistant, Ellie Thibodeau-Lissick. Our pages are Jill Cherney, Sonny Amenti, and Paige Cox. Thank you to ranking member Senator Dames and Vice Chair Senator Seeberger and my interns, Sophia Tutt and Valerie Baltazar Ontiveros. I hope I can get a green vote out of you members, and thank you for the opportunity.
The Secretary will take will take the final vote on House File 4188 as amended. Members, please vote. Senator Hochschild, for those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Carlson votes aye.
Senator Carlson votes aye.
Senator Pa votes aye.
Senator Paul votes aye.
Senator McEwen votes aye.
Senator McEwen votes aye.
Senator Fate votes aye.
Senator Fate votes aye.
And Senator Port votes aye.
Senator Port votes aye. Members, please vote if you're at your desk. All senators having voted who desires to vote. Senator Jasinski.
Thank you, Mr. President. Senator Coleman votes aye.
Senator Coleman votes aye. All senators having voted who desire to vote, the secretary will close the roll. There have been 41 ayes and 23 nays. The bill is passed and its title agreed to. Members, we will now go to House File 3875. Senator Westlin.
Thank you, Mr. President. Well, I have a little legislative palate cleanser after that 6-hour ordeal. I am presenting to the members the Judicial Branch's policy bill. It has gone through some changes, and so, Mr. President, I would like to move that the amendment to House File 3875 by the Committee on Rules and Administration in the report adopted April 28th of 2026, pursuant to Rule 45, be stricken.
Senator Westlin moves that amendment to House File number 3875 by the Committee on Rules and Administration in the report adopted April 28, 2026, pursuant to Rule 45, be stricken. Senator Westlin, explain the changes.
Thank you, Mr. President. So there are changes between the Senate file and the House file in lines 1.23 to 2.2 of the House file regarding notification. The Senate file previously had more expansive language regarding when the court could provide notice on its own website, and the change now adopted in this particular file states the Judicial Branch may provide notice on their website if there is no qualified local newspaper likely to give notice, or to whom notice is or the person to whom notice is directed. Section 3 from the Senate file has been removed completely. There was a bit of controversy around that, and so that has been completely removed in House File 3875. And then lastly, in Section 4 on page 3, the changes on line 3.12, 3.13, the Senate file called for renewal of restitution orders. The language we are adopting indicates that restitution orders do not expire. And those are the changes, Mr. President.
Any other discussion on the motion? Seeing none, all in favor of the motion say aye. All those opposed say no. The motion prevails. We are now on House File 3875. Senator Westlin, anything else?
Thank you, Mr. President. Those are the primary functions of this bill. Again, Section 2 of House Files 3875 provides that There are occasions when the district court is required to provide certain notices and publish those. And as mentioned, those may now be published on their website unless there is a local paper that can provide the same notice that they are seeking. The other item on here I would highlight is under lines 2.18 to 2.19. In proceedings for dissolution of marriage and legal separation, there has been a practice and a policy that notification would be provided directly to the public authority. This is simply saying that that requirement is only where there are children involved, and then I've already discussed the restitution. I am happy to answer questions, but this is a very simple, primarily technical bill. Thank you.
Any other discussion on House File 3875 before we give the bill its third reading? Seeing none, third reading.
House File Number 3875, a bill for an act relating to judiciary, clarifying publication process for court notices and provisions regarding restitution and conciliation court.
Third reading. Any other discussion before we vote? Seeing none, the Secretary will take the roll on final passage of House File 3875. Senator Hashell, for those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Pa votes aye.
Senator Pa votes aye.
Senator McEwen votes aye.
Senator McEwen votes aye.
Senator Fate votes aye.
Senator Fate votes aye.
Senator Port votes aye.
Senator Port votes aye.
Senator Klein votes aye.
Senator Klein votes aye.
And Senator Carlson votes aye.
Senator Carlson votes aye. Senator Jasinski, for those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Coleman votes aye.
Senator Coleman votes aye.
Senator Dames votes aye.
Senator Daines votes aye. Senator Heisman, are you voting? All members having voted who desires to vote, the Secretary will close the roll. There have been 64 ayes and 0 nays. The bill is passed and its title agreed to. Members, we'll now go to House File 4502. Senator Duckworth.
Mr. Chair, or Mr. President, just want to double check with you. Did you say 4502?
That is correct.
All right, thank you, Mr. President. I'd like to offer the A1 amendment, please.
Senator Duckworth offers the A1 amendment. The Secretary will report the A1 amendment.
Senator Duckworth moves to amend House File Number 4502 as follows. Page 1, line 13, delete notwithstanding any. This is the A1 amendment.
Senator Duckworth, to your A1 amendment.
Thank you, Mr. President. Members, it's very much a technical amendment, just removes notwithstanding in a few provisions of the bill based on feedback from committee.
All those in favor of adoption of the A1 amendment say aye. All those opposed say no. The motion prevails and the A1 is adopted. Senator Duckworth.
Thank you, Mr. President. Members, I'll be very brief because this is another bill I think we can all get behind. It has to do with establishing a trusted contact program in regards to bank accounts for folks to help prevent fraud if and when a bank maybe sees it's being detected or is potentially occurring. It allows folks to put somebody else on a bank account to be contacted just to inform them of it so that they can contact the actual person that has the account and prevent the fraud from occurring even more. Very helpful, especially when it comes to folks that are caring for elderly loved ones. That's all I've got, Mr. President. Thank you.
Any other discussion on House File 4502 before I give the bill its third reading? Seeing none, the Secretary will give the bill its third reading.
House File Number 4502, a bill for an act relating to financial institutions establishing a trusted contact program, etc.
Third reading. Any other discussion? Seeing none, the Secretary will take the roll for final. Oh, did someone else? I'm sorry, Senator Nelson.
Thank you, Mr. President. I know we're anxious to move on here. I just had a question for the author.
Senator, because we got 5 bills. Senator Nelson.
The author. Senator Duckworth, would you yield, please?
Senator Duckworth, will you yield? He will yield. Senator Nelson.
Thank you so much. Senator Duckworth, has the CFP, have the certified financial planners weighed in on this provision?
Senator Duckworth to the question.
Thank you, Mr. President. I would be lying if I said I knew off the top of my head that they have. I will say this, Mr. President, I've received no negative feedback regarding this bill from anybody. Anybody that I've talked to regarding it or that has sought me out regarding the bill has been in support of it because it helps people not only detect fraud but prevent it from happening.
Senator Nelson.
Thank you. That's sufficient.
The Secretary will give the bill, excuse me, the Secretary will take the roll for final passage on 4502 as amended. Members, please vote. Senator Hochschild, for those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Carlson votes aye.
Senator Carlson votes aye.
Senator Pa votes aye.
Senator Pa votes aye.
Senator McEwen votes aye.
Senator McEwen votes aye.
Senator Fate votes aye.
Senator Fate votes aye.
Senator Port votes aye.
Senator Port votes aye.
Senator Klein votes aye.
Senator Klein votes aye. Senator Zazinski, for those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Coleman votes aye.
Senator Coleman votes aye.
Senator Miller votes aye. Senator Miller votes aye.
Senator Miller votes aye. All senators having voted who desires to vote, the Secretary will close the roll. There have been 65 ayes and 0 noes. The bill is passed and its title agreed to. Members, we'll now go to House File 1606. Senator Maye Quade.
Thank you, Mr. President and members. 2 years ago, I met a group of women who shared an incredibly harrowing story with me. These women had been friends with a Minnesota man for years. He had been their roommate. He'd been in their weddings, they'd been in his weddings, they'd been at milestone events, and they learned that he had taken their photos from private social media accounts, physical photo albums, and turned them into hyper-realistic sexual images and videos. Members, he did this to more than 80 women. Image-based sexual abuse is sexual abuse. Indeed, recent studies have shown that the effects of image-based sexual abuse are the same as being physically assaulted. And today, we have the opportunity to cut that technology off from being used to commit sexual violence against Minnesotans. This bill would simply require apps, platforms, and websites to turn off nudification functions and stop them from enabling and profiting off of this kind of sexual abuse. We've had some debates today about criminalizing nudification, and I want to be very, very clear. It's already a crime. We did that in 2023. We made it a crime to disseminate non-consensual sexual deepfakes. So it's already a crime. It's already a crime. But the stories on your desk, and I think there's 4 total, show how terrible this crisis is, and it's going to get worse. There's one story that's very recent from Pennsylvania where 60 girls had 347 AI-generated pornographic images and videos shared. If that had happened here in Minnesota today, they would have been guilty of a crime, but the technology to create that AI-generated sexual imagery is still available. And it's becoming a very serious problem.
Senator Maye Quade, do you have a motion?
Oh, Mr. President, I do. I move that the amendment made to House File 1606 by the Committee on Rules and Administration and the Part be adopted.
Senator Maye Quade moves that the amendment made to House File 1606 by the Committee on Rules and Administration in the report adopted on April 28, 2026, pursuant to Rule 45, be stricken. Senator Maye Quade, you started explaining, so now you can continue explaining. Senator Maye Quade.
Thank you, Mr. President. We were doing last-minute negotiations on this bill, so I apologize. So nudification technology, members, is often marketed to children via apps, and it'll let you turn yourself into a cartoon character or a fairy, and the nudification functions are revealed later. Nudification apps are available to every Minnesotan on every computer, on every cell phone of any age. They're downloadable on the Apple Store and the Google Store. And every single one of us, by existing in this world, could be victimized at any time. It would be easy to think that someone could avoid their child, for example, being turned into child sexual abuse material by keeping them off the internet. But nudification technology means that any person can take a picture of your child in the grocery store or playing at the park or dancing in their recital and turn it into child sexual abuse material. It means that someone could take a picture of any one of us or our loved ones walking down the street, from our campaign lit, playing in the park, eating out at a restaurant, and create a hyper-realistic pornographic video. And people are doing that because these apps, platforms, and websites are as easy to access and use as ChatGPT. Predators are creating child sexual abuse material. Children are using nudification technology on each other. I mentioned the story of 60 girls at the Pennsylvania school. But this really is becoming a scourge. And since this bill was introduced last year, there have been hundreds of national stories of how nudification is victimizing women and girls and children around the world. In Minnesota alone, multiple men have been arrested and charged with creating child sexual abuse material using pictures of children they worked with or knew, and those stories are also on your desk. Again, what those men did, it was already a crime, but the fact that they had the technology available to them to do the crime is the thing we have an opportunity to stop today. In 2023, we passed a law banning the dissemination of sexual deepfakes. Today, we can stop the creation, because that is where the harm is. It's in the creation. I want to thank Ayanna, my LA, and my interns for all their help on this. I want to thank Senator Uma Verbaeten for her help getting the money that will come to this, potentially to Crime Victim Services. And I want to thank my numerous co-authors, Senators Lucero and Fate and Duckworth and Wiklund. And we had to create clones of this bill because members on both sides of the aisle wanted to be part of it. So I want to thank Senators Lang, Johnson Stewart, Gustafson, Herr, and Coleman. But most importantly, I want to thank the victim survivors who came forward to make this bill happen. They have repeatedly shared their story in public, with us, with reporters, with law enforcement. Their power and brilliance and fierce advocacy is the only reason we're voting on this bill today. They know that this bill, once signed into law, will not bring consequences to their abuser. And yet they have still had a singular focus on making sure that this bill gets passed, so that no matter what happened to them will happen to no Minnesotan ever again. And so, Mr. President, let's make that so. I ask for a green vote.
So, Senator Maye Quade, there's a couple steps before we get there. You did us a fine service of going through everything so it'd make the other things go faster. We are on the motion, the Rule 45 motion to stricken the language, for a lack of a better word. Senator Rasmusson, to the motion.
Thank you, Mr. President. And I am supporting the bill author in her motion here, but was wondering if she would yield for a question.
Senator Rasmusson, is this on the motion? Okay, good. Senator Rasmusson wants you to yield. She will yield. Senator Rasmusson.
Thank you, Mr. President. Thank you, Senator Maye Quade. And I know one of the changes that will be made by striking Rule 45 is an amendment that I offered in the Commerce Committee that clarified that telecommunications companies like wireless service providers are not included in this bill, and that you're going after the programs that can be used for nudification. And just wanted to ask Mr. President, Senator Maye Quade, if her intent is that these wireless companies are not included in the underlying bill, even with this amendment going on.
Senator Maye Quade, to the question.
Thank you, Mr. President. The answer to Senator Rasmusson's question, Section 230 of the Federal Code already protects them from liability for what people transmit over their wireless network.
Senator Rasmusson. All right, seeing that Senator Rasmusson's questions have been answered, all in favor of the motion say aye. All those opposed say no. The motion prevails. Now we can go to third reading, or do you want to go before third reading? All right, Senator Liskey.
Thank you, Mr. President. Mr. President, I yet again offer an amendment to this bill, as I believe the main issue is the crime behind the programs themselves. So I offer the A3 amendment.
Senator Liskey offers the A3 amendment. The Secretary will report the A3 amendment.
Senator Liskey moves to amend House File number 1606 as follows. Delete everything after the enacting clause and insert. This is the A3 amendment.
Senator Liskey to your A3 amendment.
Thank you, Mr. President. And in the earnest respect towards time, we've all been over this amendment. Feel free to express your opinions. I've already debated as to why I believe this is a good amendment, and I look forward to a green vote.
A green vote would suggest that you want a roll call.
That is correct. Thank you.
Roll call requested, roll call granted. Senator Maye Quade.
Thank you, Mr. President. Members, I'm going to ask for a no vote for two reasons. One, this is a delete everything, which means that what will be left here is Minnesotans still being able to access nudification technology, predators still being able to access the technology to turn our children into CSAM. We made the dissemination of non-consensual sexual deepfakes a crime in 2023. It's been that way for almost 3 years. And yet, we still have these crimes being committed because the technology is so readily available. I ask a no vote because what we have in this bill is what is going to stop the creation of these nudified videos and images of this child sexual abuse material. What's in this amendment won't do anything, because if it did, we wouldn't be here having this discussion. We already made it a crime to disseminate it. So I would ask for a no vote so that we can actually stop this from happening in Minnesota.
Any other discussion before we vote on the A3 amendment? Senator Latz.
Mr. President, members, I too encourage a no vote on this for the reasons Senator Maye Quade stated. Also, this is a felony crime that we're being asked to create here on the Senate floor. This bill, as far as I'm aware, this has not been introduced as a bill. Nor has it gone through the committee process, which is a better way to create penalties that might put someone in prison. If Senator Liskey wants to introduce a bill next year, if I'm still chair of Judiciary, I will be glad to consider it.
The Secretary will take the roll. Oh, Senator Liskey.
Thank you, Mr. President. After the discussion on the floor, we already have voted on this once, so I will be removing the roll call and withdrawing the amendment. Thank you.
The roll call has been withdrawn, and the A3 amendment has been withdrawn. Any other amendments? Senator Holmstrom.
Thank you, Mr. President. I rise to offer the A1 amendment.
Senator Holmstrom offers the A1 amendment. The Secretary will report the A1 amendment.
Senator Holmstrom moves to amend House File number 1606 as follows. Page 2, line 18, before penalties, insert civil. This is the A1 amendment.
Senator Holmstrom, to your A1 amendment.
Thank you, Mr. President. Members, this is the same language as the Lucero amendment. The last time we spoke about this, a person who intentionally nudifies an image or video of another knowing or having reason to know that the subject of the image or video did not consent to the nudification is guilty of a gross misdemeanor. I bring this forward again because last time we allowed ourselves to lose our decorum, and I think we lost sight of the underlying vision here, which is the victims. I genuinely believe that the author is attempting to solve a problem here, and I think we agree on what that problem is and how to solve it. I would hope that it can be seen as a friendly amendment. I understand it's illegal to disseminate this technology and disseminate these images. And I read some of the handouts, and I see the 60 girls, and I know that there are adult women who become victims of this as well. And there are adult men, and I'm sure women, who are perpetrating this crime. And I really think that a wholesome approach to this is what we all want. We don't want this to happen anymore, and I don't want somebody to get a VPN and find some ridiculous program outside of the state, outside of the country, that they can legally create these on through criminal activity and have it. If you possess it, I think it should be illegal. And I think we can come together on that. That's why I offer it. I'm not looking to have a new debate or a new fight on the floor. I understand. And one more point I'll raise is last time this came before Judiciary Committee, I was not yet elected. Otherwise, I probably would have brought it up then too. But I appreciate the conversation we're having here today, and I ask for a roll call.
Roll call requested, roll call granted. Senator Latz.
Mr. President, Senator Holmstrom was elected and took office in January of this year. This bill did come through the Judiciary Committee, as I recall. There were no amendments offered in Judiciary Committee to this effect. I suspect there could be fiscal impacts on the courts, on local governments, and on on other stakeholders, public defender's office, et cetera. There's no indication that there has been a fiscal note offered. Plus, again, it's bad public process here, I think, to create new crimes on the Senate floor that haven't been heard in any committee yet. If Senator Holmstrom wants to introduce a bill that accomplishes this, we'll be glad to give it a hearing next year. I encourage a no vote today.
Senator Maye Quade, it was Senator Holmstrom's amendment. Anything before we vote?
Thank you, Mr. President. I would also urge a no vote. Again, we have the opportunity to create no more perpetrators. Let's do that. Let's not have people become victims and have perpetrators exist and then lock them up. Let's stop this technology from being available.
The Secretary will take the roll on the A1. Did you want to speak? I'm sorry. Senator Holmstrom, I thought you said you're closing. I'm sorry. Senator Holmstrom.
Totally understand. Again, this is an amicable amendment brought in good faith. I looked up the bill path, and it said April 1st, 2025. Maybe this came before another package, and I didn't notice it. That's, I suppose, possible. I will say that this is a both-and approach. We want the technology to be stopped so that we do not create victims, and we want to hold people accountable if somehow they skirt our laws. Again, both and. I hope to see a green vote because I think we all want the same thing here, which is to advocate for victims. Thank you.
All right. Now I want to make sure I didn't forget anyone. All right. Seeing that's so, the Secretary will take the roll on the A1 amendment. Members, please vote so we can move expeditiously. Senator Hofschild, for those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Pa votes no.
Senator Pa votes no.
Senator McEwen votes no.
Senator McEwen votes no.
Senator Fate votes no.
Senator Fate votes no.
Senator Port votes no.
Senator Port votes no.
Senator Klein votes no.
Senator Klein votes no.
And Senator Pappas votes no.
Senator Pappas votes no. Senator Hofschild, anyone else?
Thank you, Mr. President. Senator Carlson votes no.
Senator Carlson votes no. Senator Lang, for those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Coleman votes aye.
Senator Coleman votes aye.
Senator Johnson votes aye.
Senator Johnson votes aye.
Senator Miller votes aye.
Senator Miller votes aye.
Senator Pratt votes aye.
Senator Pratt votes aye.
Senator Jasinski votes aye.
And Senator Jasinski votes aye. Senator Eric? All members having voted who desire to vote, the Secretary will close the roll. There being 31 ayes and 34 noes, the A1 amendment is not adopted. Members, if no more amendments, the Secretary will give the bill its third reading.
House File Number 1606, relating to commerce prohibiting access to nudification technology.
Third reading, Senator Umu Verbatim.
Thank you, Mr. President. I just want to thank Senator Maye Quade for this bill. AI nudification technology should not exist, and it is creating more victim survivors. And when this bill was heard in the Judiciary Committee last year, I asked Senator Maye Quade if we could direct any of the fines collected to crime victim services. She worked with me, and we got that done. And this is so important because crime victim services are facing an unprecedented gap in funding right now. Due to the federal cuts, the Office of Justice Programs is facing a 20% funding decrease that will result in a $12 million gap in crime victim services. And I just want to make sure folks understand what crime victim services are. Crime victim advocates attend court with survivors. They meet them at the hospital to support them through sexual assault exams. They help survivors navigate the crime victims reimbursement program. They provide a safe place to live and find work. They help survivors gain a confidential address and a name change. They centralize investigations involving child victims so that the child is not exposed to repetitive, traumatizing interviews. They advocate for survivors in the face of law enforcement systems that sometimes don't believe them, and they educate and collaborate with those same systems to improve responses in the future. And if we don't find a way to fund this $12 million gap, we're going to lose these services. Programs will close. Some rural counties will lose their only advocate. Survivors will not be guaranteed access to the support and resources they deserve, and ultimately Minnesotans will be less safe. And so while this bill is not going to solve that $12 million gap this year, it is actually helping us find a new funding source that is ongoing, and that is thanks to the care that Senator Maye Quade had in crafting this bill and the work that she did with me and with the advocates. I'm very, very grateful. We really need to hold companies accountable for harming Minnesotans, and it is only right that the penalties that they pay should help the people who suffered because of this technology. So again, I really want to thank Senator Maye Quade for supporting victim survivors. I want to thank her for her collaboration and encourage members to vote yes.
Members, any other discussion before we go to the author and go to the final passage? Senator Maye Quade, you have the last word.
Thank you, Mr. President, and thank you, members, for the robust discussion today. We are really doing something groundbreaking here in Minnesota, but we will not be the last state. We're just the first. We will today, or someday very soon when this bill gets signed into law, become one of the safest states to be a child, one of the safest states to be a woman, one of the safest states to be a person in public. I want to thank Molly and Meg and Jessica in particular for making this happen. The circumstances that brought them to me and to this bill are terrible. But today we can say never again. This technology should not exist. It exists for completely and only nefarious purposes. This should be something that the federal government deals with. But states can and will step up in their absence, and today we are taking that first giant, huge leaping step, and people will know Minnesota for that. I'm deeply grateful to everyone who helped get this bill here, and I urge a green vote. Let's get this done.
The Secretary will take the roll for final passage of House File 1606. Members, please vote so we can move expeditiously. Senator Lang, for those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Coleman votes aye.
Senator Coleman votes aye.
Senator Johnson votes aye.
Senator Johnson votes aye.
Senator Miller votes aye.
Senator Miller votes aye.
Senator Pratt votes aye.
Senator Pratt votes aye.
Senator Jasinski votes aye.
Senator Jasinski votes aye. Senator Hauschel, for those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Carlson votes aye.
Senator Carlson votes aye.
Senator Pa votes aye.
Senator Pa votes aye.
Senator McEwen votes aye.
Senator McEwen votes aye.
Senator Fate votes aye.
Senator Fate votes aye.
Senator Port votes aye.
Senator Port votes aye.
Senator Klein votes aye.
Senator Klein votes aye.
Senator Pappas votes aye.
And Senator Pappas votes aye. All members having voted who desires to vote, the Secretary will close the roll. There have been 65 ayes and 0 noes. The bill is passed and its title agreed to. Members, we are now go to House File 4052. Senator Rasmusson.
Thank you, Mr. President. This is the telecom cleanup bill. It's the result of a lot of hard work from the telecom industry, the Department of Commerce, the Public Utilities Commission, and consumer advocate groups who reviewed Minnesota's telephone laws and identified obsolete language. It looked at old monopoly-era rate regulation requirements. It looked at requirements for coin-operated public payphones, and it took anything that was obsolete and is repealing it in this bill. And for the remaining statutory obligations, it's aligning it with federal law, in particular looking at federal E-rate programs. And so, Mr. President, Happy to take any questions from members on this work product, but really appreciate the collaboration from both state agencies, industry, and consumer advocate groups that have gotten this bill to us today.
Any discussion on House File 4052? Any amendments? Seeing none, the Secretary will give the bill its third reading.
House File Number 4052, a bill for an act relating to telecommunications, modifying and clarifying various provisions governing telephone company regulation, etc.
Third reading. Any discussion before we go to final passage? The Secretary will take the roll for final passage of House File 4052. Members, please vote. Senator Lang, for those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Coleman votes aye.
Senator Coleman votes aye.
Senator Johnson votes aye.
Senator Johnson votes aye.
Senator Miller votes aye.
Senator Miller votes aye.
Senator Pratt votes aye.
Senator Pratt votes aye.
And Senator Jasinski votes aye.
And Senator Jasinski votes aye. Senator Hoshoff, for those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Pa votes aye.
Senator Pa votes aye.
Senator McEwen votes aye.
Senator McEwen votes aye.
Senator Fate votes aye.
Senator Fate votes aye.
Senator Carlson votes aye.
Senator Carlson votes aye.
Senator Port votes aye.
Senator Port votes aye.
Senator Klein votes aye.
Senator Klein votes aye.
Senator Pappas votes aye.
Senator Pappas votes aye.
And Senator Maye Quade votes aye.
And Senator Maye Quade votes aye. All members having voted who desires to vote, the Secretary will close the roll. There have been 65 ayes and 0 nays. The bill is passed and its title agreed to. Members, we'll now go to House File 3155. Senator Duckworth.
Thank you, Mr. President. I move that the amendment made to House File 3155 by the Committee on Rules and Administration in the report adopted April 28, 2026, pursuant to Rule 45, be stricken.
Senator Duckworth moves that the amendment made to House File number 3155 by the Committee on Rules and Administration in the report adopted on April 28th, 2026, pursuant to Rule 45B, stricken. Senator Duckworth, please explain the differences.
Yes, Mr. President, they're very minor. They just had a better version in regard to title, which is why I'm making the request.
Any discussion to the motion? Seeing none, all those in favor of the motion say aye. All those opposed say no. The motion prevails. Now, Senator Duckworth, we're on the bill.
Thank you, Mr. President. Members, this is another good, hopefully short and sweet bill. It's another fraud prevention measure. This adds gift card fraud to the organized retail theft language we have in our state statutes. Long and short of it is there are organizations out there stealing gift cards from stores, taking them to their criminal place of activity, and recording information about those gift cards, and then putting them back in the stores so that when an unsuspecting consumer purchases a gift card and puts money on it to give to somebody as a gift, that gift card is almost immediately depleted of that money. It's gone, and the criminals are able to use it how they see fit. Right now, current law doesn't give police the ability that they need to prosecute this or to arrest and then have it prosecuted the way that would be effective. Long and short of it is, if we pass this bill, if an unsuspecting consumer were to find themselves in this situation, it kind of allows us to crack down on it and put some teeth in the law to go after these criminal enterprises and hopefully put a stop to it. That's all I've got, Mr. President. Thank you.
Any other discussions on House File number 3155 before we go to a third reading? Seeing none, the Secretary will give the bill its third reading.
House File Number 3155, a bill for an act relating to public safety, including gift card fraud and organized retail theft.
Third reading. Any other discussion before we go for final passage? Seeing none, the Secretary will take the roll for final passage on House File number 3155. Members, please vote. Senator Lang, for those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Coleman votes aye.
Senator Coleman votes aye.
Senator Johnson votes aye.
Senator Johnson votes aye.
Senator Miller votes aye.
Senator Miller votes aye.
Senator Pratt votes aye.
Senator Pratt votes aye.
And Senator Jasinski votes aye.
And Senator Jasinski votes aye. Senator Hochschild, for those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Pa votes aye.
Senator Pa votes aye.
Senator McEwen votes aye.
Senator McEwen votes aye.
Senator Fate votes aye.
Senator Fate votes aye.
Senator Port votes aye.
Senator Port votes aye.
Senator Klein votes aye.
Senator Klein votes aye.
Senator Pappas votes aye.
Senator Pappas votes aye.
Senator Maye Quade votes aye.
Senator Maye Quade votes aye.
And Senator Carlson votes aye.
And Senator Carlson votes aye. Senator Marty, are you voting? All members having voted who desires a vote, the secretary will close the roll. There have been 65 ayes and 0 nays. The bill is passed and its title agreed to. Members, we now go to House File 4075. Senator Westlin.
Thank you, Mr. President and members. It is my pleasure to bring this bill to the floor and to wrap up a very long floor session. This bill comes about from the work of the Domestic Violence, the Legislative Task Force on Domestic Violence and Firearms. And primarily what this bill does is it provides an actual process that does not currently exist, that is not standardized, and that does not function particularly well to ensure that those who are actually prohibited from having firearms due to an order for protection or various domestic violence charges, that they actually do transfer those firearms out of their possession. We've heard the statistics. In 2023, 26 women in Minnesota were killed by a current or former partner, and of those, 15 were from firearms. Nearly 1 in 4 adult women have experienced intimate partner violence. A 2020 study found that approximately 4.5 women alive in the U.S. had been threatened with a gun by an intimate partner. That same study found that over the last 40 years, nearly 1 million women have been shot by an intimate partner. I do want to be clear, Mr. President and members, this is not creating a new prohibition. This is about making sure that people who are currently prohibited by law from possessing firearms actually transfer those firearms out of their possession. As I mentioned, this bill comes to you from the result of the Domestic Violence and Firearms Task Force. And there are a couple of key provisions. We are now setting up a single part of the law that will contain all of the requirements of transfer. Looking at the bill, Section 1 deals specifically with CHIPS cases, and you'll note that there's a large amount of language that has been stricken on pages 4 and 5, and those are now in the new Section 6, and that's where the consolidated language is. The same is true for Section 4. This is where the consolidated language will also be going into Section 6. Getting to the heart of the primary changes, Mr. President and members, there is now a new section in statute that is called Transfer of Firearms from Certain Prohibited Persons. It has definitions. It defines the process for transferring firearms, which includes the fact that the court has to issue an order for transfer. And until that order is issued, the transfer does not have to take place. The court has to issue an order for transfer in cases where it is required. The person can transfer those firearms to a federally licensed firearms dealer, local law enforcement, or they may transfer them to a third party who's lawfully able to receive them. The third party cannot live with them. There does have to be a proof of transfer that is filed by the subject, and the court may hold a compliance hearing, which is noted on lines 18.10 and on. within 10 days, but the court may waive that if there has been satisfaction that there has been compliance based on the filing of a transfer order. Those are the primary provisions of this bill, Mr. President and members. And again, you know, we talk a lot about trying to keep survivors of domestic violence and their children safe. And we know that when we don't have a method of ensuring that prohibited people have transferred their firearms, we are putting lives at risk. This is a good bill. I'm happy to stand for questions, but I hope we can count on a fully green board.
Members, we're on House File 4075. Any discussion before we go to a third reading? Senator Abler.
Thank you, Mr. President. I have the A1 amendment I'd like to move.
Senator Abler introduces the A1 amendment. The Secretary will report the A1 amendment.
Senator Abler moves to amend House File number 4075 as follows. Page 16, line 17, after the period, insert. This is the A1 amendment. Senator
Abler, to your A1 amendment.
Well, thank you, Mr. President. I believe this amendment is appropriately titled A1 because it's really a good amendment. Senator Westlin, I'm working. I appreciate the work you've done on the bill so far. And I've actually spent quite a bit of time looking it over in the last couple days to figure out a lot of the nuances, and I don't have any questions about that because I got all those answered. But there is a shortcoming in the bill that I don't think was anticipated, and that has to do with an indigent person whose guns are being taken away. And in the bill, before we had a random amount of time that there may not even be amount of time, the bill calls for 60 days. And if you don't pay the storage fee, they can be sold then by the police who are going to be holding them. And I know a third party could hold them, but some individuals don't have a third party. And now there's quite a few hurdles for them to have to do that. And so what my amendment does is I think makes your bill better and causes it only benefit. It just says that no fee may be charged to an individual who in the last year qualified for a public defender or has been approved to proceed in forma pauperis in a court proceeding. The public defender is criminal, the forma pauperis is civil. And I think nobody intends that somebody would lose maybe their prized family heirloom piece just because they're poor. And so that's my amendment, Mr. President, and I hope that people can agree, and I would request a roll call.
Roll call requested, roll call granted. We're on the A1 amendment. Senator Westlin.
Thank you, Mr. President and Senator Abler. I am going to request a no vote on the amendment for a couple of reasons. First of all, I do appreciate the fact that this was floated to me earlier today, and I did get a chance to see it. If you look at lines 1.16, it says a federally licensed firearms dealer or law enforcement agency may charge a reasonable fee. It doesn't say that they are going to charge one or that they have to charge one. And then the third option, as you mentioned, Mr. President and Senator, is that they do have the capacity to transfer to a third party. And I believe that one of those options will give them the opportunity to comply with this law. This has not been heard or considered by stakeholders. The bill that you have before us has been, is the result of many, many, many stakeholder conversations. This represents a lot of modifications that have taken place through committee process, and I would not want to make changes at this point that have not been fully vetted with the various stakeholder groups. For all those reasons, Mr. President, members, I request a no vote.
Any other discussion on the A1 before we go to the author of the amendment as the last voice that we will hear? Seeing none, Senator Abler, the A1.
Thank you, That sounds kind of ominous, Mr. President. The last voice you will hear? Anyway.
Before voting on the A1 amendment.
Thank you. I feel better now we're talking about all this. Well, just a final thought. I think that some of these individuals who are caught up in this thing, to be an abusive person means that your life is not going well. There are people of great means who have, get caught up in this, but they have access to counseling, they have access to resources, they maybe have some neighbors. Some individuals, others have really nobody to help them. They don't have a friend. The complicated matter about how they're going to go take it to some place with a camera, and they're just going to give them to the cops. And I'm just nervous that this is going to happen, and I think given the value of this bill and what good it wants to do, I really wish Senator Westlin would reconsider her desire to not do this. I can't imagine if you go back to the group and said, hey, do you think you want poor people to lose their guns just because they're poor and they don't have resources and somebody that can help them out through this hard time? Really, that's what you want? So I would, please, members, consider voting yes. Thank you.
The Secretary will take the roll on the A1 Abler Amendment. Members, please vote. Senator Hochschild, for those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Carlson votes no.
Senator Carlson votes no.
Senator Pa votes no.
Senator Pa votes no.
Senator McEwen votes no.
Senator McEwen votes no.
Senator Fate votes no.
Senator Fate votes no.
Senator Port votes no.
Senator Port votes no.
Senator Klein votes no.
Senator Klein votes no.
Senator Pappas votes no.
Senator Pappas votes no.
Senator Maye Quade votes no.
Senator Maye Quade votes no.
And Senator Latz votes no.
And Senator Latz already voted. Senator Lang, for those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Coleman votes aye.
Senator Coleman votes aye.
Senator Johnson votes aye.
Senator Johnson votes aye.
Senator Miller votes aye.
Senator Miller votes aye.
Senator Pratt votes aye.
Senator Pratt votes aye.
Senator Jasinski votes aye.
Senator Jasinski votes aye.
Senator Rarick votes aye.
And Senator Rarick votes aye. All members having voted who desires to vote, the Secretary will close the roll. There being 33 ayes and 33 noes, the amendment is not adopted. Any other amendments? Seeing none, the Secretary will give the bill its third reading.
House File Number 4075, a bill for an act relating to public safety, establishing a uniform procedure for imposition, implementation, and oversight of firearm restrictions resulting from certain criminal convictions and judicial orders.
Third reading. Any other discussion before we vote for final passage? Seeing none, the Secretary will take the roll on final passage of House File 4075. Senator Hochschild, for those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Carlson votes aye.
Senator Carlson votes aye.
Senator Pa votes aye.
Senator Pa votes aye.
Senator McEwen votes aye.
Senator McEwen votes aye.
Senator Fate votes aye.
Senator Fate votes aye.
Senator Port votes aye.
Senator Port votes aye.
Senator Klein votes aye.
Senator Klein votes aye.
Senator Pappas votes aye.
Senator Pappas votes aye.
Senator Maye Quade votes aye.
Senator Maye Quade votes aye.
And Senator Latz votes aye.
And Senator Latz votes aye. Senator Lang, for those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Coleman votes aye.
Senator Coleman votes aye.
Senator Johnson votes no.
Senator Johnson votes no.
Senator Miller votes no.
Senator Miller votes no.
Senator Pratt votes no.
Senator Pratt votes no.
And Senator Jasinski votes no.
And Senator Jasinski votes no. All members having voted who desires to vote, the secretary will close the roll. There have been 40 ayes and 25 nays. The bill is passed and the title agreed to. Members, we will now proceed to the 13th order of business. 13th order of business is announcements of Senate interests. Any announcements of Senate interests? Senator Marty.
Thank you, Mr. President. The Senate Finance Committee will not reconvene tonight. We will continue Senator Hoffman's bill on Friday, and we are continuing our plans for tomorrow's agenda beginning at 8:30 in room 1200. Thank you.
Any other announcements of Senate interests? Without objection, the following senators will be excused from today's session: Howell all day, Johnson from 12:20 to 12:40, Miller from 4:05 to 6 p.m., Rarick from 5:45 to 6:45. Any other announcements of Senate interest? Seeing none, I recognize Senator Murphy for a motion.
Thank you, Mr. President. DFL members, we are going to caucus right after this in the upstairs caucus room. Mr. President, I move the Senate do now adjourn until Thursday, April 30th at 11 a.m.
On that motion, all in favor say aye. All those opposed say no. The motion prevails. The Senate is now adjourned.